Any discussion?
Yes, ma'am. I would like for item 12 to be moved up to before the break. Mr. McFadden has to leave for funeral, and if we could, I'd like to have that conversation before he leaves.
Well, one of the reasons that it is that where it is in the agenda is that Susan Sanders, our human resource manager, is in a class, Kevin, is that correct? Until 12:30. And she is the one that has information for us for that discussion. So I don't know how we can have that conversation without her.
Okay.
What time do you have to leave,
11.
Mr. McFadden?
11. 11.
11. I'm not sure I have a solution to that.
Has she started her class yet?
It starts at 8. It started at 8:30.
Okay.
I'm sorry. Yeah, okay. All right, we have a motion and a second. All those in favor say aye.
Aye.
Opposed, like sign. Okay, fellow commissioners, we have a hefty agenda in front of us. Not sure I've seen one quite like this in a long time. So, hopefully we can do this today. It's, but I don't want anyone to be restricted in their comments and discussion of all the various items that we have here, because they're all important. But, if we reach a point where we need to take a break, somebody raise their hand, get my attention, we'll take a quick 10-minute recess. So having said that, I will move to our next item, which is our boards and committees, vacancies, and our website. So Kevin, you want to bring us up to date on that?
Yes, with these, at least the portion, one of the items that was being discussed was the information that we have on the website, how people can know what kind of what vacancies we have on, what vacancies we have, boards and committees. So Jason and Lori went through and modified and updated information on our website. And this is just a screenshot of our county website. You can go on there and hit, how do I join a board and committee? And this will take you here. We have a list of all vacancies on there with a sentence on the committee. Not a whole lot of detail on them because we just didn't want to create a page for everywhere. As well as we also have a list of the committees that are on here. We have taken off some of the committees that are really entirely staff driven, like the CCPT, CCFT. Those are entirely in the health and DSS departments. You know, they're appointed by the board, but we don't invite, they're not community boards. So we took those off. We'll have a discussion about whether or not to take the water district board off, because that is the board of commissioners. So, but these are the boards that ultimately people can apply for. We'll still probably pull some of these down, like jury commission. That's a board that meets for 5 minutes once a year or every other year, so they can turn on the computer. And fire commission is another one that's primarily fire chiefs. So that one may also be, you know, we may leave it on there just so we have information to click on, but it's one that we would not invite. But these are the board, you know, this is a list of the community boards. And again, we have, and all of this is on one page on the website. If I try to put it on one page here, there's no chance of you seeing it. But this is the information that we have. And there, you know, like I said, you can go off and just click on the click to apply, and the application is online. and you can fill it in there, and that automatically comes back in and goes to Jason's email.
But is there a designation anywhere of openings? So SCAT's Advisory Council, if it had an opening, would it show up somewhere
It would show up at the top of the page under vacancies.
under the, okay, I'm sorry, I missed that.
Well, but I haven't read all of these. Does this tell how many vacancies there are on each committee? Because sometimes there's more than one.
Usually if there's more than one, I have put it there.
But as a beginner, just clicking onto it, but also to see what is it offering a person, all right. How many, I mean, the terms, the qualifications, anybody just clicking on, I'm gonna get involved, when do it meet, do this book, when you click on the one on this, tell you, stuff like that.
And what we discussed is getting with those committees and having them come back, okay, give us a line or two about your committee, and also like the Board of Health, when we have a vacancy there. Well, it has to be a pharmacist, or it will have to be this. And if we have those, we would put those on there.
Board of Health in particular, how many members does it allow from the public? Because there are some.
There are some members of the public. I'm not sure. They're not, well,
It's not many. It's like two. I
That's
think.
about two. It's
Yeah.
like that is-
I think Beth is one, right?
Beth is a community member, and I cannot remember who the other community member is. But that, and then you have some positions that are the professional designations, but then also they can become, if you just absolutely cannot find that position, you can get a public-minded citizen.
I think Diane is. Diane's the second public.
Okay.
I think she's.
Is there anywhere on these pages about boards and committees that a member of the public can look and see who currently is on the Recreation Commission?
We don't have that.
Yeah, I do on some of them.
Okay,
I do on some of them. I've not got around to all of them, but I've got some of them. I've got who the members currently are. The Parks and Recreation Advisory is not one that has sent me their information yet. Like JCPC, you can click on JCPC and it gives you when it meets, who the contact person is, and the purpose of it. Then also, since they have their own website, there's a link to their website too, that if people want to go to that website and see that, a lot more information than what I could possibly put on it.
Yeah,
And that one changes so often as,
Oh boy, it does.
well, because they change people at the courthouse and they have to put different people
Yeah.
in there.
So now if you scroll on down, anything with like a purple is something that's got a link. It's got some more information to it. And so like JCPC, you can click on it and it says, there's the meeting time, meeting place, and then the contact person. And then it says for more information, you can click there and it takes you to the JCPC website. So it's just a tedious process to get all the.
I think it would be helpful if you had that, but then, maintaining it's gonna be a barrier because some of them change.
They do quite a bit.
And some of that is going to depend on how much information the committees.
I was gonna say, I depend on them to share a lot of information with me too. If they don't tell me, it might be 3 months and I realize, and I say, so-and-so is so-and-so still on that board? And they say, oh no, they went off 4 months ago. And so then I have to start all over again. So.
And I do understand that, Jason, but it really does help if we can find a way to get those committees to be more responsible, because when you look at like the SCAT's Advisory Council, can you click on that one?
Yes.
It shows that the last meeting schedule is from 2018. And if I'm a public citizen just looking for a complaint, then that would be a concern. I'm sure there've been meetings since 2018, but they haven't updated that information, I'm assuming with you. So, it's 3 years old on here too.
And that's when they're required to meet quarterly, whether or not they actually, or they're required to have a scheduled quarterly meeting.
They are meeting, and I've met with them this year.
Yeah, but those meetings, most of the time, they're meeting to adopt policies set down by DOT. And that's when, as soon as we get updated information, we'll adjust those back in.
Like I said, I depend on those folks to get in touch with me too. Let's see, what was another one?
Any more comments or, recommendations, observations? I, for one, think that Jason's done a really good job since we had this conversation less than a month ago and trying to pull this together. It's far more than we have ever had in the past. So, and I know it's a work in progress.
And it will probably continue to be a work in progress. I mean, I don't know if it will ever get completely done.
You can call Betty, because they say contact Betty by email.
Where?
And that's what it says there at
Questions,
the bottom.
Betty, questions?
I better go get my glass out. So I can't.
Don't worry, your computer start baking.
I do agree. I think it's certainly an improvement, since we've been having this conversation. I still think, Jason, I guess, are you the one who keeps up with the website?
Yeah.
Okay. They're just tedious things I think just need somebody to sit down, like still on one of them, you have the county administrators, Ann Kurtzman. We know she's been gone. Parks and Recreation Directors showing still vacant. And I just think this is the way the community knows what we have going on. And it's important, I think, for it to be as up to date as we can have it. That was under the Aging Council, where Ann Kurtzman's name is still there.
I think
Now,
she's still on.
She's the
She is the
chairman
chairman.
of that council.
But she's listed as the county administration. Is that her role?
No.
And it has Scotland County, Scotland Place, Senior Citizen Parks and Recreation, vacant director. And he's been here a while.
Excuse me, I gotta get my glass. I can't see y'all.
Well, would it be maybe helpful, especially to Miss Golston, if we had also a box on there that was like a general board box, and somebody, I ain't trying to load you up, but somebody else maybe check that box every week or every day, that then you could send it out to her, or if she's sick or something's going on, somebody could, you follow what I'm just.
For questions and such?
Yeah, just a general email box, not a particular person.
Okay, yeah, we could, I don't know if I can't set that up. I mean, I don't have that.
No, I understand.
But, I mean, I can direct it to mine, to my email. And
I was thinking-
the only reason her name's on there is because
Right, no, I understand, but I
Carol was
mean, but
listed for.
if she's gone, or she's sick, or she can't get online, or something, there's somebody that it's going to, and it don't sit there for a month, waiting on
Mhm.
somebody to answer back.
Well, it could come to mine, because if there's a box, it's gonna be me checking it. So,
Thank you,
I
Jason.
didn't say that, I said,
I know.
I said somebody.
Well, I'm it right now. And, now I did make a change on, they can also print off that application. If they, if they don't feel comfortable doing that, filling it out online, they can print it off in PDF and fill it out and mail it to me. And I put my name on there, because it still had Ann's name on there, and I put my name and put the new address, put the Peden Street address instead of the Covington Street address, so there is that ability as well.
But they can also fill it out on here and submit it on here.
And it comes to my mailbox. And we could do the same thing with that question. We could send it to my mailbox, because I don't know how many questions you get.
Very few.
Okay.
But like I said, I was asking it earlier, what about the terms? I mean, I don't want to the point where a person can stay on their lifetime. I know some boys, we can't get nobody to serve on, but still, it should be on, here some kind of way letting them know this board here, you can only stay on this board here 4 years.
You could be
Well, like,
reappointed if nobody else
for,
applied. but
Board
you
of
should come
ENR,
off if you
Uh,
see somebody else.
on there, it does say it's a 3-year term.
And most of them I do have, like, how many years terms it
Okay.
is.
Okay.
And like, the Board of ENR is, and Jim told me about this, I didn't even know it, that the members are limited to 3 terms, 3 consecutive terms.
With the exception of the commissioner
Right,
appointment.
now, commissioner appointments are as long as you serve
Right.
in the commissioner capacity. So, now, once you come off, no longer a commissioner, if the board wants to continue to appoint you, you can be appointed as a citizen, and most of them.
But most of the time for the committees, we wind up with the committee itself is tracking its membership and when they should be back up for renewal, in general. And some of them are better at it than others.
Mhm.
If they got a staff person, they're usually, that's the ones that are the best.
Any more comments, recommendations, observations? Well, thank you. I think this is a big step in the right direction to helping our citizens know about the boards, to know about opportunities to serve, and to get the information that they need. So we're moving in the right direction. Thank you, Jason. I know this has been a lot of work.
And also, if y'all have any other questions or like to see any other little changes or find something where we have Ann Kurtzman as county administration, let us know and we can fix it because, you know, it's a situation where this is information that Jason looks at a lot, so it's easy to miss something when you see it every day. You see what you expect to see.
Good. While you're there, go to the scotlandcounty.org webpage that somebody would see if they opened it up on their device. Is that it?
This is it.
When was the bell tower taken off? In the last week? Because recently, when you would go, the St. Andrews bell tower was the picture that you got, and the bell tower's gone.
Yeah, the company has done the Civic Plus had done an update
Okay, I did
to
not
the
know that.
website.
Great, okay.
And if you notice, our new logo was on there.
Yeah, I did see that.
And one of the cool things, I think, if you'll scroll across to the community,
Okay.
and you see the little swoosh underneath it, I think it's kind of cool, but it's, but they've done a little bit of an improvement. And they actually looked at data about what has been our most visited sites and whatever those most visited sites are, the ones that got the buttons down there. So it's just a little bit of a different look for a little refresh for our website.
Are we ready to move on?
Yes.
Okay. Our next item is the ABC board discussion. Kevin,
This item was requested to be put on. So with that, the ABC board, of course, this is a board that gets a lot of discussion. But right now it has 3 board members. Under statute, it can have either 3 members or 5 members. And that is set by the appointing authority, which is for us, Scotland County, which is you. So it is your discretion if you wanted to take it up from 3 to 5 members. And it's just set up, basically, it's alternating 3-year terms. So when you have a 3-member board, it should be 1 member every year comes off. And it's in general statute. I think you have a copy of it in your agenda packet. If you want to go from 3 to 5, exactly how you would add the positions in. It also spells out how to go from 5 to 3, but that's not the issue that we have.
What does the board do? Is that gonna be in the next discussion?
I'm not
They kinda
entirely
manage
sure
the
what
revenue.
all they do other than operations.
The operations and the revenue.
Yeah.
Yeah.
They would supervise the ABC store manager and
Yeah.
hire him.
A lot of interest.
You're right. Well, the reason I brought it up one time was, or this time last year, we had a commissioner on the board. He wasn't a commissioner appointment, but Bob was on the board.
Right.
And I just think that's a board that's important enough that we need to have representation of this board on that board. And, I know we have to go from 3 to 5, which I don't know what difference that would make, but make at least one of those a commissioner appointment or commissioner, and then one more public person, or you can decide 2 commissioners. I mean, that would be whatever you want to. But that's, we kind of had it built in for the last few years with Bob serving on it, and even though he wasn't a commissioner appointment, he was on the board, so, and I think he's still on the board. But, that was the thought process behind it, because I think that's one of the boards that we need somebody on.
Yeah, when you have that much money flowing, I think it'd be wise to have permission on it, and personally, I would like to see 5, let it be a 5-member board. We have a lot of interest in that board.
Who are the 3 members now?
What's the question?
It's on the.
Who are
site.
the 3 members
If you
now?
can go to it's on that site.
Yeah,
Bob, the guy we reappointed last time,
and Doretha Strong.
and yeah, that's who it is.
Remember who the guy that we reappointed?
Larry
What was it?
McGill.
Who?
Larry McGill.
Larry McGill.
So
yeah.
Bob, Larry McGill, and who the other one?
Doretha
Swan. Doretha Swan.
But in the general statute, it lists the powers and duties of your local ABC boards. They have a lot of power.
Yeah.
I'm just looking at the buy and lease real and personal property. And of course, they oversee the tax revenue that comes in. They designate where it goes and oversees how it's spent. So,
We need to have a
and
commissioner.
they need it regularly.
Mhm.
That's what they
We
need.
need to have
At least one, if not both of them.
1 or 2 commissioners on it.
Aretha's a good one because in that, she worked for, the Wachovia Bank all those years, or what's Wachovia?
Yeah.
She's an excellent choice for that board. Her time
Yeah.
should be running out. I think soon, shouldn't
Well, and I would like to make it clear that I can only speak for myself, for the people that's watching or listening. We're not doing this because we think something's wrong with the current
Right,
ABC board.
Right,
It's that we think we need to add to that, so.
What would be the procedures to increase the board to 5 members?
Good question. Attorney.
It's under this statute that is in the handout or the agenda package. If you want to increase to 5, I don't know that I've seen the formal procedure in here other than assuming the board wants to increase it to 5, the board has the authority to name 2 additional members.
The way I read it was there were, like you said, there's really no procedure for
Mhm.
adding it.
Right.
Now there's procedure for
For
removing
going
it.
down, right? That's what I read.
Now,
too.
you may, depending on how the board sees it, you may want to take some time to allow folks who are interested in it to apply, given the conversation you just had about openings on boards, but that would be a choice the board would make.
Okay.
Well, I mean, we could make the commissioner appointment, then open it up the other one if we're gonna do it as a public. That would be.
I read it here, something where it says how you expand to 5. You
You
don't
have to
see that.
change policy.
And I think if it's talking about adding them in, it talks about that more about the initial term than
Oh,
the
okay.
process of doing it. And so with that, I would imagine it would probably be a reasonably simple action by the board.
I do think that given the way the statute's worded, Commissioner Ivy, that you don't want the board to function with an even number for a long period. I mean, I think the intent probably was that you had an odd number so that you never have a tie. But
Yeah, I got that. I mean, and that could be something we can say that is effective April 1st, or, which gives us time to fill the other position
Yeah.
too.
Right.
It doesn't have to be an immediate. I'm just,
And you will not have any trouble filling that.
really,
I mean, people, like you said, like we said, so much interest in that particular.
Let me ask you this, well, most
I know,
boards,
but
we
I mean,
don't,
what's the?
we don't compensate
The
for,
NBC,
do these
That's what
people
they
get
asked
paid
about when
something?
they come, when
150
they
is the
call.
model, I mean.
I thought they got something.
The statute says a local board member shall receive compensation in an amount not to exceed 150. So I don't know if that's what they're actually receiving, is not to exceed,
And I don't think they received that much.
may not, I don't know.
I think it's 50.
How often is the board meeting?
Hmm.
How often does the
They meet
board?
once a month. Golly. I can't tell you when, but they meet monthly and they meet regularly.
Commissioner Gibson, the statute says that this board determines the compensation. So if you choose to do a number other than 150 or 50, if you, whatever number you choose, not to exceed 150 a meeting, this board says.
We'd verify, but I'm thinking it's 50 because that's what we do with some of the others that we
I think
pay.
it's 52.
Well, I think,
But we can
I think
verify that.
we ought to know what it is. Yeah. And I would assume that that's paid for out of the revenues from the ABC.
Yes, sir.
And that's what we can check with finance because that's how, when they issue that money.
No, that's, ABC is complete.
Right, you're right. Don't come out finance.
And I hope that we can, whoever commission, if we do decide to do this, I guess we have to do it in a regular meeting, right? In our regular meeting, we couldn't do it today. We have to do it in our regular meeting, right?
I'm not
I mean,
aware.
to increase the board.
No, I think
You
if
didn't make a
that's
motion,
actually
did
what
you?
we get
Yeah, we can do
today.
it. Make a motion. Well, if that's what we wanna do, let's go and do it. Do we want 5-member board?
Is that your motion?
Yes,
Second.
I see.
okay.
Okay, we have a motion by Betty, a second by BJ to increase the ABC board from 3 to 5.
Yes.
Any more conversation?
I'd like to make sure in that, I don't want to make your motion for you, but one of those positions be a sitting commissioner appointment.
Betty, you want to amend your motion to include that?
I'd like to amend my motion to include a sitting commissioner, on that particular board.
Okay.
And I
A
guess
sitting commission.
I'm sorry, sitting commissioner,
Yeah.
one other question is, when would you like to make that effective?
April 1st.
That gives the month of March for public to
Yeah.
apply.
Well, let's rethink that because our regular March meeting's Monday.
Yeah,
So unless we get a whole bunch of applications for it by Monday, are we gonna have time to put that fifth one member in? Are we meeting again in March, do you know, budget or anything?
depends on how long today goes.
Okay, but you follow what I'm thinking.
Well,
is-
maybe we should do it the new year. You wanna do it the
I wouldn't
budget
go
year?
out that far, but I might would at least do May,
May, okay.
because that gives time to make the appointment, because we're not gonna have it by Monday night.
Yeah,
No,
So if we do it April 1st, then we're back to the 4-member problem until we appoint somebody, so that's just my thought.
okay, I amended to say, May 1st, May 1st meeting, May
Okay.
meeting, yeah.
And this may or may not should be part of the motion, but you're probably gonna want those two terms. They need to be 3-year terms, but initially, one of them probably should not be so that they're staggered.
Right.
So I guess maybe I would offer that the commissioner's position be a 3-year term and the other position be initially a 2-year term, and then after that 3-year term.
In that top paragraph, that's somewhat how it reads,
Yes.
Okay.
that it flip-flops from a 3 to a 2.
Okay, okay, when you finish the motion, I'm gonna say something.
I'm gonna
Yeah, The 5-member board is formed with the terms of the 2 new members shall be the 3
From what I've heard, I'm hearing the motion restated that we will expand the ABC board to 5 members effective May 1st, with 1 member being a commissioner appointee, with the
Sitting
terms of the 2 new
Sitting
members being
commissioner.
staggered. Is that somebody?
Is that correct, Ms. Betty?
Yeah, as a sitting commissioner.
Sitting commissioner.
Sitting, yeah, the current sitting commissioner, okay. All right, are we ready to vote? All those in favor say aye.
Aye.
Opposed, like sign. Okay.
And the comment I like to make is that if any of our commissioners are interested in being on that board, I think their name should be submitted before, May 1st, so that everybody, have an opportunity, they want to be,
Fair shot.
yeah,
Do we need to submit that information to you?
yeah,
The
get it to
interest.
me, yeah. Well, we may have to vote on it, but get it to me.
What if the
I wish I could
scenario you
really
want
need
2 commissioners want to be on?
to find out.
Well, we can't have one, because we already made the rule.
Well, no, we made rules, this is like, it's a,
One sitting
one
commissioner.
sitting, but I'm just saying they were just saying it had to be a
At
sitting.
least one.
It's like the situation that Bob was in. Bob was sitting,
Uh-huh.
and he lost, but he's still on the board.
Oh, he's still on the vote.
You know what I'm saying?
Now,
But if you report to a commission, but like say, if, like you got to run 2 years. If you on the board, then,
mhm,
then if somebody else, I ain't got to run again in 4 years.
mhm,
So you talking about, it could be swagger.
yeah,
But I'm just saying that's a scenario.
Yeah, that makes sense.
You want 2,
that makes sense,
if you want 2 on the board.
but we don't want to look like we're taking over that whole board, you know what I'm saying?
Ain't but 2 out of 5. How you doing?
They still have
That'd be
majority.
three, that'd be 3, because board, Bob is.
He's
the
not a
ex.
commissioner.
He's an ex, I'm saying, but,
So the public still has the majority.
Yeah,
okay.
I mean, that's a.
So it would be, one of them has to be a commissioner, but the other one can be.
Right.
That's what.
Yeah,
Yeah,
that's
yeah, that
what I'm
makes
saying.
sense, that
It
makes
can be.
So did you say, we should say at least 1 commissioner. We're saying 1 commissioner.
Yeah. I
Y'all
thought
give
that's
us
what
some
we were
wiggle
saying.
room, because somebody gonna challenge us on.
Well, the
other
board, you're not limiting the other position to not be a commissioner.
Mhm.
You're just saying that.
Are we
a
saying it,
minimum-
or we on,
Mhm.
is that implying it?
We're
Help me
saying
out, somebody.
one of them has to be, but we're not excluding the second one.
That's what I'm saying.
Mr. Attorney, do you
So
think
as
we're
long as
covered?
you put at least in there, that clears you because you've got the one that is mandated, the other may be.
Yeah, at least it's good.
At least 1 county commissioner. That doesn't say that the other person must not be a county commissioner.
Jason, you got all that down?
All right.
Along with this conversation, Mr. Gibson just made a comment that I think is important. Kevin, could you get us a list of all of the pay, what each board, the ones who do get paid? Because we need to know rather than saying, everybody saying what I think, I think we need to know. Can you get that information for us?
Yes.
Thank you.
There's not a lot of.
Yeah, but I just think we need to know.
I think we need to know.
Nobody here really knows. Everybody's saying, I
And that
think.
question may come up when a person show
You
interest,
need to know.
so we need to know.
I know the airport commission, they took it, when they redid it, they don't get paid.
Doesn't the planning and zoning board get mileage?
Now, you know, I have no idea.
Yeah, we get mileage. I know from waiver.
There's.
I know I'm not on a board that gets paid, I do know that.
And if I am, I ain't got.
There are stipends for I believe Board of Health, DSS Board, Planning and Zoning Board.
Board of zoning adjustments.
Mental health, Carol, you get paid, don't you?
What?
Mental health board.
Each point compensates, for meeting.
And there's no reason for asking that, because I don't, myself.
But we need to know.
But we need to
this.
know.
I know, because I was on the mental health board, I could.
But I mean, you're not making money serving on these boards when you travel 120,
Again,
240 miles.
understood, but I just think it's something,
Yeah.
when the question comes up, somebody should be able to answer.
It was only 30 miles when I was on that.
Okay,
All
that is good information that we need.
Oh, yeah, just to have.
All right, now we're gonna talk about ABC law, Kevin.
With this,
You
and this is not in the county, this is inside the city of Warrenburg. Currently, if you want to have on-site consumption inside the city of Laurinburg, basically, you have to have a beer, wine, and liquor license. So if you want a restaurant and you just want to sell beer or beer and wine, you still have to have liquor, license. And the liquor license is $1,000 annually. The chamber is going to make a request to city council. TDA is supporting this, EDC is supporting this, but they're going to make a request to city council this month that they seek assistance from our legislators to see about getting this ABC law changed so that you can get just a beer pack, just a wine, just a beer license, just a wine license. Or, if you want a liquor license, that's fine, but you are not required to have a liquor license. And again, this is only inside of the city of Laurinburg. And it would not grant any new authority to anybody. It just basically, like we're gonna have lunch today, if they want to be able to sell beer, they also have to be able to sell beer. They may not want to. This would give them the option not to have that as a license.
But individuals can do a per day permit instead of buying $1,000 for a year.
Right.
Just do it, like if I have an event coming on Thanksgiving night,
Right.
I won't have to buy that $1,000 for me. I can get a permit just for that day.
You get that one day,
Yeah.
Okay.
$25 or whatever it is.
And this would not change that. This is for
Establishments.
restaurants.
I've actually had some folks talk to me about that they're a place like Greek Village that wants to sell beer and wine, but it's not worth them paying $1,500 to get the full beer, wine, and liquor license, because they can't make enough money to pay for that.
Right.
So they could make help with revenues if they could just sell beer and wine.
Right.
That makes sense to me.
And so the request would be pushed back to this board just to see if this board would be considering offering a letter of support to that. Most importantly, they wanted you to be aware of it and, hopefully not be in opposition. But again, this is not creating anything new. This is just, allowing businesses greater flexibility and avoiding costs.
This conversation about the ABC law has been going on for about 18 months.
Mhm.
And it's complicated because what we do in Laurinburg is different from what they do in Rockingham and what they do in Lumberton and what they do in Sanford. Because it all falls into, like when Scotland County went from dry to having an ABC store. And then when they went to having a McDuff's and a Mickey C, that's all very different. And so the conversation arose because the bowling alley would like to be able to sell beer along with their food and their bowling activities, because that's done in other places. But the chamber and the city just feels like it would enhance the possibility of expanding some businesses in the city if this were allowed. So I'm just trying to give you a little bit of background on where this conversation has been for about the last 18 months. Is that fair enough, Kevin? And ABC laws are complicated. Oh my gosh.
So what do we need to do?
Consider whether or not you would give a letter of support for this change.
I'd like to make a motion that we do offer a letter of support. But if there's anybody who personally has an objection to it, I don't have a strong feeling one way or the other.
I think it's a good idea. Maybe we can bring in some new businesses in the town, you know, with that. So I agree. You make a motion on that?
I will make a motion that we have a
I
letter
second.
from the chairman to.
I'm in a meeting.
in
We'll
support
draft a
of
letter
this.
of support and send it to the city or to the
I'll probably
chamber?
change.
We'd send it to the city.
To the city, okay. So we have a motion to draft a letter of support from the Scotland County Board of Commissioners supporting, legislative modification to the ABC laws effective in the city of Lawrenceburg. Is that the motion? Do I have a second?
Betty said.
I don't have a second. Any discussion? Okay, all those in favor say aye. Opposed, like sign? Okay. Do you know the timeline on when they were gonna try to get this to our legislators?
They're going to go to city council meeting at their March meeting.
Okay, we got time, okay. Okay, now we're gonna hear some really fun stuff. Medicaid transformation. April, you doing this?
Yes.
There she is.
Kevin, can you put that attachment up there because it might be me, this tablet, it's got it sideways and I can't turn it.
She got this current man.
And that's what I was about to,
But you got it here, I think.
bring up.
I don't have.
No,
I
you
have
don't,
it.
we don't have that.
I've got it on here, but it's sideways.
May I notice that too?
You want the,
That, he's got it. He's
Yeah,
got
I'm
it.
good.
oh, okay.
But, for this part, I know enough to know it's complicated. So, I've asked April to go over this aspect, and when she's ready, I've got that slide deck that she has, and we'll go over it.
I'm ready. Can you hear me?
Yeah,
Yes,
Okay, good morning. I'll give you a high-level overview of Medicaid managed care. And of course, if you have any questions, I'll be glad to answer them. I'm going to speak first from the one pager I gave you. I believe you have that. On the first side, talks about Medicaid managed care as far as regular Medicaid and healthcare purposes. And then on the flip side of your paper speaks to Medicaid managed care and how that's going to affect our transportation department at DSS and how it's going to affect SCAT's transportation.
Do we have that?
That was the-
So if you
that was the
recall,
separate.
Medicaid managed care was initially to be implemented last July. And that got paused by the legislature. And so now we're back to be implemented July 1st of 2021. And so what Medicaid managed care does, there will be a small population of our current Medicaid clients who stay in the fee-for-service model. You go to your doctor, he decides what you need, and Medicaid is billed for that, if that's an eligible service. But then a large population of our Medicaid clients will go into what they call the new Medicaid managed care. And so this is where North Carolina is contracting with 6 insurance companies, 6 totally different insurance companies, like Blue Cross Blue Shield is one of them. First Health is one of them. So under managed care, it's, as you can see on your page, it's a prepaid health plan, and it puts a cap at what Medicaid beneficiaries can receive in their course of treatment. And so there's a predetermined rate for each client and caps it off at that rate. And so we will have 2 forms, I guess you'd say, not particularly forms of Medicaid, but 2 forms of payment for Medicaid going on in North Carolina. And so I put on here what could change for most of our beneficiaries, but what will not change at all for any beneficiary. DSS will still take all Medicaid applications, whether that be online, mail in, walk into our office. We will still process all eligibility for Medicaid to determine if someone is Medicaid and which Medicaid program they can be eligible for. And then it will be determined, are they in Medicaid Direct or in a managed care plan? So how North Carolina is moving forward right now. And if you see your timeline down there, beginning March 1st, enrollment packets will go out to all Medicaid beneficiaries that are required to go into a PHP, one of these health plans. Starting March 15th, they can call and they can self-enroll. They can pick which of the 6 plans they want to be in. And different plans offer different incentives. And so it's almost kind of like they can shop which insurance company they want to manage their Medicaid health insurance. They have through May 14th to enroll their sellers. We also have at our disposal from DHB an enrollment broker that will be working with a few counties at a time, one being Scotland County. And so if a client has questions about the different plans, we are to send them to that enrollment broker. Our staff are not to give advice out, information out about each particular company. That's not our place to do that. So if they do not enroll their sales by May 15th, starting May 15th, the division is going to auto-enroll all of these people. Meaning the division is going to pick what plan they go into, and they're just going to stick them in it. And then July 1st, we start. And so we foresee a good bit of people will not understand what they're looking at, or they will not really pay much attention to the mailing. And so come May, June, and July, we will be flooded with calls that say, what is this? Why can't I go to my doctor? Or I went to my doctor and he said, I don't have this Medicaid. And so we will end up doing a lot of community education after people were auto-enrolled in place. If they do get auto-enrolled, they have through September to change which PHP they are in. So they can back out and enroll in a different one if they want to do that. So that in a nutshell is the Medicaid piece of Medicaid managed care. One additional piece, July of 2022, will also begin some more tailored plans. That's when you will see your foster children put into a tailored plan of Medicaid managed care. But that's still another year out. Any questions I can answer about that piece of it so far?
Well, I guess to make it simple, it sounds to me like the Medicare program where I think like my parents is Blue Cross Blue Shield, Blue Medicare. So it's still Medicare, but it's an outside. Is that what's going on with it? It's just kind of make it simplified.
I think that's a pretty
Medicaid.
good amount. It's like all the advertisements on TV with Joe Namath.
Oh, yeah, Joe Namath, yeah.
Pick your Medicare plan. And so it's just being managed by an outside source. So Medicaid is following the way of Medicare. I do have a question. Will they be able to change it every year, just like people can change their Medicare plan every year?
They can. They can change at each redetermination
Okay.
or recertification.
I heard you mention about the potential need for community education once people are already enrolled because they missed the opportunity. What are we doing to educate the community on this now, locally?
So right now, we're in the process of training our staff. DHB has finally put out some staff training and some good, I guess you'd say like one-page kind of information things, some related to staff, some related to clientele. So we're educating every staff in our building, because while we may have 30 Medicaid staff, the social worker that goes out are gonna be asked questions about this. They may be handed a mailing and say, what is this I got? And so we want all our staff to have a good general base of what to do with this. But more to your point, Mr. Gibson, is we also are gonna start putting some of those press releases out. We'll start putting out on our Facebook page. We are actually having a meeting with our assigned enrollment broker today to find out what he will be doing in Scotland County as well, his availability. And so as much as I guess we can talk this up, and the main message now is if you get a mailing from Medicaid, pay attention, call us, call the enrollment broker. Don't throw it to the side, throw it to the trash. Let us help you out and help you understand what you're looking at.
Thank you.
And some of this, even though the state's been working on this for a couple of years, they'll work on it and then it goes up, then it gets paused, and they'll work on it and it gets paused. So DSS is just getting final information on how this is working now. So that's why, they've been able to say this is coming at some point in time in the past, but they're just now getting information. Okay, this is how it's supposed to work. And the state is basically saying that they expect 90 to 95% of people to be auto-enrolled.
Really?
Mhm. They expect very few people to actually go in and self-select.
I think you said at the beginning there are 6 managed care
Yes,
companies
ma'am.
that have been identified so far. I mean, that piece is
Yes, ma'am.
completed, right?
Yes, that piece has been completed by the state long ago
Okay,
of the 6 plans.
okay. Because-
And not every plan will serve every county.
Right, that's what I was getting
These
at.
plans,
I've been following this through mental health.
no, this is not fall under, I think you said mental health.
Yeah.
These plans decide which regions and which
Mhm.
counties they want to serve.
Yeah.
For Scotland County, we have 5 plans that are serving Scotland County beneficiaries.
And
So
that's
they'll
gonna-
have 5 to choose from.
5 of the 6 serve Scotland County? That's
Yes, ma'am.
good. That's real good. Mhm.
But if we got a segment of community that is not computer literate, they don't know how to, not unless you marketing and putting it out there to the community, they don't know about it.
Right.
I mean, you can
Right.
do staff training, but the staff, they got to come there to get the information. But what, marketing, but to sell this here, I know we're gonna have to do some marketing. Because, I know,
Yeah.
a lot of communities, segment communities, they just don't have the, access to, a lot of people not subscribe to a newspaper, a lot of people just, especially when you talk about Medicaid, that's the older population.
Yeah.
So they don't know
I think
unless,
as much as,
Medicaid.
yeah.
But, a lot of us will be called to help figure out what they ought to do, and that's a fact.
yeah, I think as much as our community leaders like yourselves, and of course us here, and anything we can get out, but if we can at least get that message out that says, if you get something, call DSS. They're gonna lead you down the right path or lead you to that enrollment broker. That's the beginning of it all. And then that enrollment broker will walk them through the process of which plan they may want to pick.
It is a plan that basically North Carolina is doing it, not other states.
Yes, ma'am, right now, this is North Carolina's legislation.
Okay.
April, the folk that receive Medicaid, how often does I guess the mother or whoever's in charge, how often do they come to the office? Is it monthly? Would you see
No,
someone?
sir. And so, in the world of social services today, in our economic programs, and this was before COVID, so this isn't just a COVID development, you really could apply, be approved, and continue for years to be on services and never walk in our building anymore.
Okay, the reason I asked that was because of the question
Right,
that Clarence
that being
said.
said,
If you gotta communicate some kind of way.
Would it help if we went to some of the medical providers and for folks that come in and are under Medicaid now, have them some information to hand to them as a patient, saying this is coming, just,
Because if they don't come in for a year, there's some folks that don't know.
it's gonna show up in a mailbox and they ain't gonna know what it is.
Mhm.
Yeah, this is very serious.
Right, and you know, so that would be good advice to give someone. When you talk to an enrollment broker, tell them who your doctor is. Make sure you pick a plan that your current doctor is in or supports. And those are the kind of questions that an enrollment broker will go through with someone to make sure they get in a plan that doesn't drastically alter their current medical care.
Would the medical field be, given, information about this program? Will they be knowledgeable? The doctors in Scotland County, say for instance, will know when the patient asks them, am I still on a plan that you on, you know, will they still have that information, the medical doctor?
Yes, ma'am. Department of Health Benefits has been working with the medical community as well. That's their piece of educating the medical community as well, because this is going to be a big change for them too.
It is.
No longer is it you can prescribe anything and everything or order any and all tests. There's a cap. And so you are really going to have to manage your client's care well.
What about the ones, and this does happen, chooses to go to emergency rooms as opposed to primary care doctor on a regular? How does that work? Would the hospitals, emergency rooms be a part of the program? I mean, with the doctor's program, how does that work?
Yes, ma'am, it is. And all pieces of Medicaid and medical care are in these plans. So, that they don't separate doctor from emergency room from urgent care. It's all wrapped up into these plans.
Okay. Thank you.
Yes, ma'am. So, we can go back to that some more if anybody has ideas or questions. I'll touch just a minute on the transportation piece.
April, can I interrupt you for a minute, please?
Yes, sir.
Tim's question about getting information to the physicians so they can give it to their patients. Are you saying that that's being done, but it's being done through the medical community?
So DHB, DHB is the old DMA, Division of Medical Assistance. It's Medicaid basically, and now they call themselves DHB, Department of Health Benefits for North Carolina. So they are educating our medical providers. That does, I don't see why that would stop us from also reaching out to some of the medical providers and giving them, if nothing else, the enrollment broker's information. Because that is the key here for all clients. That is the person that will lead them down the right path. Are these enrollment brokers that DHB have assigned to each county. So we could certainly reach out to some of the medical practices here and say, here's our enrollment broker. And when we talk to our broker this afternoon, we can make sure that that's permissible.
Okay, I think that sounds like a good idea to me.
And,
Okay.
and if it's possible, and we can have more discussion on this, if we can reach out to the health providers, we can also possibly share that information with other community organizations, community leaders, so that somebody calls off and, hey, what's all this about? Why am I getting this? They want me to change Medicaid. Am I getting kicked off Medicaid? You know, you can have them call DSS, but if they also have just the card, okay, call this person and they can help you select a plan.
And who would that person
Right.
be? Is that your broker you're talking
That's the
about?
broker.
Okay,
Because
Yes, sir.
DSS specifically cannot
do that.
do that.
Okay.
They're prohibited by the legislation that's mandating this.
And I would imagine that broker will eat the fee of any literature to hand out to Doc, because he's getting paid for,
Yeah.
they're getting a commission for this. So.
And I
And
think
they already have a plan for that, and then she finds out today when they meet with them, so, but
And that'll be another part that we have to train our staff in, that people are gonna be upset that they can't call and speak to their favorite Medicaid worker at DSS and the Medicaid worker tell them what to do. But it is simply not our place to, insurance shop for them or guide them towards a certain company. That's a conflict of interest, really. We can't do that, so. But we'll work through that and we'll try to make people understand, while we can't help you, we do have somebody that can, and here's how you can get in touch with me.
April, all those 5 insurances would deal with the medical aspect of that person, of that individual. Or what would be some of the difference between the different insurance companies? I mean, is there any major difference?
Like some might offer a discounted gym membership. There are not major differences. Their healthcare needs are gonna be provided. It's these other, I guess you'd say maybe non-critical things that might, be, I guess, dangled out there, so people might pick their plan versus another plan.
Okay, I understand.
Okay, so I'll speak for a few minutes about the transportation piece. As most of you know, if you are eligible for certain types of Medicaid, you can also be eligible for transportation assistance at medical appointments. And that's done through a variety of ways. At DSS, we give out medical vouchers that allow people to put gas in their vehicle to get to medical appointments out of county appointments. We do a lot of gas vouchers at DSS. We have people that come in every single day to get a voucher. So that's a portion of it. And then there are people that we refer to SCATs to do trips to medical providers. And often those trips are in-county trips and some out-of-county trips. So if you think about it like this, when somebody's required to enroll into one of these insurance companies, that company also has to provide their medical transportation for this program. So this may seem like a small piece, but this has turned into a big issue across the state of North Carolina. Because these transportation providers don't sit in Scotland County. They don't sit in Richmond County. They might be somewhere in Virginia. But they coordinate all the transportation for these clients. So what do they have to do? They have to contract with SCATs to do the transportation. So now, whereas a county, we are used to contracting with other vendors for services, it has flip-flopped. And they are dependent on us as a vendor to provide the transportation that they are required to give these clients. So there are 2 transportation companies that fall under each of these 6 PHPs. And so right now, myself, Mr. Johnson, we are reviewing the 2 contracts that they would like us to sign, the rates that they are willing to pay us for us to do SCAT's transportation to medical appointments. We're in the process of reviewing those, making sure we're okay with the terms and the rates, and getting those set up and put in place. So it is going to look, the day-to-day operations should not look very different for our community members. However, what is going to be a big difference, and is going to take a lot of, I guess, training, education, they will no longer be able to call SCATs and set up their transportation. They have to call these companies to say, I have an appointment on this day at this place. And then their company calls us to ensure that we can cover that ride and we can take them there. So we know who of course, our common riders are for medical appointments. We will reach out to them. First, of course, they have to enroll with a broker in order for us to begin to educate them on who to call to schedule their transportation. That is going to look different for them. And then from an administrative point, that's going to look very different for SCATs as well. So that'll be it'll be a learning process, but I feel like we're ahead of the game. We're on top of these contracts and on top of the rates, and try to get people educated once they enroll in a plan.
Is this all effective July 1st as well?
Yes, ma'am.
Okay.
Starting June 1st is when the Medicaid providers, the transportation providers begin accepting appointments. And I guess they're starting a month ahead to be ready for July, to begin July 1st.
I'm looking for my time sheet on.
Does Medicaid, give you, allow you all another staff member to deal with all these situations?
Medicaid doesn't provide staffing. Of course, the county determines how many staff we have and what budget we have to work with for that.
Okay.
Auto enrollment is May 15th. Okay.
And some of the people
So I'll
that
be
we,
glad to answer. I'm sorry.
and I was just gonna say, some of the people that we routinely transport, because we have more contact with those, they're probably gonna be some of the ones who are more likely going to be selecting an enrollment, because we have more opportunity to give them a little bit more information. So hopefully we'll be able to get some of those in higher demand, the higher demand for service, to go ahead and engage earlier on so they're more aware. Because as y'all can expect, somebody who's throws all this mail in the trash, July 1, when they call SCATs and, hey, I need to go to my doctor next week. And okay, now you need to call this 800 number in Florida. They're not gonna know what's going on.
That's why, that's confusing.
And we're almost powerless to manage that ourselves because we're not in charge of that. I mean, it's kind of up here and we're down here. April, how many Medicaid recipients do we have in Scotland County? Approximately.
Over 9,000.
Over 9,000 individuals in Scotland County get Medicaid. Ooh.
Yes, ma'am. That includes children and adults.
Right. So my question would be like, if you have a parent and they have 3 children that are eligible for Medicaid, and will they all be enrolled in the same managed care?
It depends on what type of Medicaid plan they're in. Typically, a parent with children are all in the same plan because they're on a family Medicaid case.
Right.
But you will have those rare instances where you may have, let's say you have an adult woman living with her father, her elderly father. They may be on 2 different types of Medicaid, and one may be a Medicaid Direct, and one in this PHP plan.
Yeah, okay.
And also, if someone has extensive medical conditions,
they're a high user. They will probably be they would be grouped into something else also.
April, from a practical standpoint, when you talked about the transportation, you used to give out cards with gas allocation on there or scats. Under the new system, from a practical standpoint, how are the people going to be actually transported? Either by the scats system, are you still going to be given cards for gas, or?
So I have been asking that of these PHP plans for months, because these people that are enrolled under PHP plans, we cannot hand them a voucher anymore. We are not responsible for their transportation. And we will have a very small percentage, maybe 15%, that we still do because they're left in the old plans. And so when I say we have people that walk in every single day for a voucher, I mean that. We have people that walk in because they're going to like a Suboxone clinic in Moore County every day of the week. We're going to have some upset people when they come in and they can't get a voucher, and we are pointing them towards their PHP plan. Now, we see them every day, so we can tell them very, very far in advance what this is going to look like. But I have not got a PHP plan to tell me yet how they are handling people that would typically get a voucher, because SCATs cannot accommodate the number of people that are getting vouchers to all of a sudden take out of town every day. We just don't have the infrastructure for that.
Well, I'm glad I asked the question, but that's not the answer I want.
It's not the answer I want either.
I understand.
Yeah, that's going to be very interesting, and I'm going to keep asking because it's a gap that I haven't heard anybody fill yet.
Would you expect the gap to be filled by the individual plans having some way to reimburse that person for their transportation?
They do. I've heard things like, well, we're going to send them not a gift card, but a gas card in the mail, or, well, that's fine, but if they need the voucher today because they literally don't have the gas to get there, getting a reimbursement card next week may not meet their medical needs.
Right.
So, yeah, I mean, I've heard some things. It's not a total non-answer, but it's answers that to me don't seem real reasonable to help out our beneficiaries.
Yeah. Well, just stay after it. I know you will.
What is the amount of income that qualifies person for Medicaid? Household, family income, or whatever. What income will qualify you? What does qualify you for Medicaid?
Oh, Miss Betty, that's almost an impossible question to answer because there's not one. Because there's like 20 Medicaid programs. It's all over the place. And then, there's your basic Medicare. Well, then there's your health choice, which is a different income level. I can certainly get you those charts if you'd like to see like numbers on paper as far as household size and things.
Yeah,
I'll be glad to share that with you.
okay. Because, say a person making $50,000 a year would not be qualified for Medicaid, right? I mean, most likely. So I just kind of want to know what income level they had to have. Okay, I'll get that.
And a lot of that depends on the type of, if you're coming in for adult Medicaid, well, here's an example. Adult Medicaid, each person in the household has to be a certain age or disabled and can't have over $2,000 of, I guess you'd say, assets. So if you're coming in to apply for adult Medicaid and you have a health insurance policy and a bank account, you got to spend all that down until you have no more than $2,000.
And that includes, because I had an experience working with an elderly man, and that also include not only any property too, it includes property as well, right? If he owns a home,
Insurance, you got to break yourself.
Insurance too.
Insurance, right?
Pre-need, they can't have more.
And on top of that, there's like a 2-year look back period, so you can't go sell your house yesterday and be
Yeah.
eligible today.
Yeah, right. I appreciate that information.
And that's,
Yes, ma'am.
and that is very important for, especially for seniors who are going into long-term care.
Yes,
Before they can get in long-term care, they got to spend on down. If you got a
yes.
$10,000 policy,
Uh-huh.
you got to do a pre-need, put that
Mhm.
policy
I
on
was
the
saying
bed.
that pre-need, yeah.
So you ain't really got that, you ain't gonna get that money. So that's how I do it twice a week,
And sometimes,
at least twice a week.
sometimes we see
You have
people
to
go
get it
ahead
out
and
the
get
van.
placed in long-term care. And they're making a self-payment, and that's paying it down their, reserve, and then we pick up after they've spent, I hate to say it, after they've spent all their money.
All their money, yeah, I know. It's rough.
No. Yep. All things said, just don't get sick.
I know. That's what saved me with this old man was, I found like that he had a
That's
sister.
harder to do.
And they
don't
can't
they?
care for him, you know what I mean? But other than that, he wouldn't have gotten it because he owned a house, but his sister's name was on the deed too. So that saved us.
That's why I own my parents' house.
Mhm. That's why I put all my problems.
And you need to do that 5 years before you need
Yeah.
to.
It was done, yeah, it was done a few years.
Well, at least 2, but
I think they go back 5.
5 years.
5 sound right.
Yeah.
We got anything else with this young lady?
All right, now do we have to take a
Thank-
test?
Thank you for giving me a few minutes. I'll be glad to keep answering questions or give updates when I have them.
I think the key to it is notifying everybody as much as you can early, because
And I think we should take a test now on what you've told us.
I gotta go to the bathroom.
I think that's
I gotta go to the
Mr.
bathroom.
Chairman, we need a little break. Can we have a little break, get some air?
Thank you,
You
April.
know, okay.
Okay, we're gonna talk
Did
about,
you have something else to say?
no, April.
She was
don't go
about to say
away.
something.
She was about to say something.
Oh, who was about to say something?
What I was gonna say, if you want, you heard of an elevator speech?
Yeah.
Something, somebody asks you a question, you can sum it up for them in the time it takes you riding the elevator. Maybe I can put that together for you.
Okay.
And that's something we can distribute and say, here's a
That'd be
2-minute
wonderful.
Medicaid managed care, what you need to know.
Okay.
Yeah, because I hear the calls coming before.
Yeah.
That's a good
That'd be
idea.
wonderful.
Yeah.
I'll do that and I'll send it to Jason, to shoot out to you all.
Okay.
Okay, don't go away, April. We're gonna talk about foster care.
Okay.
Miss Golston asked if we could take a little break.
But how much has she got to finish?
5, 6 minutes maybe at the most. I just want April to give us an update on the situation that currently exists in the foster care program. And I've got the sheet that you emailed me. Kevin can put it up on the screen with that data of children in care, staffing. And while I'm pulling that up, the foster care program, essentially in the last 12 months, the number of children in foster care has doubled.
Why?
And that is a trend that has happened across the state. It is related to pandemic, unemployment, increased alcohol and drug use. We do not have enough foster homes. Just recently, either the first of the week or the end of last week, some children came into care. There was no place for those children to go, so the children and 2 foster care workers spent the night at DSS. We've got a situation that needs attention at DSS with our foster care program with staffing. And I just want April to address that. And it's something that we need to consider budgetary wise as to allowing more staff to come on board at DSS to address this foster care situation.
Okay, thank you, Ms. Carroll. Ms. Carroll has summed it up pretty well. We have seen the number of children, and you have the numbers in front of you now, jump or basically double in the last 2 years, which means the work for our staff doubles, court time has to double, and getting children out of care becomes more increasingly difficult. Where do I start? So my concerns are when we have to give so many children to each foster care social worker, the level of care we're giving these children is not where it needs to be anymore. I am very concerned about our ability to protect children. I'm concerned about our ability to provide for their well-being needs and ensuring they are getting what they need. And I do understand that they are in foster homes and they are in placements, but we are responsible for these children, and we are responsible to know that they are getting what that they need and that they are safe. And so when I have 102 children in care, and right now I'm working with, let me scroll down on my page here. I'm working with a staff of 6 assigned to foster care. It makes me very, very nervous because I know we're not doing what we need to do. There are certain federally mandated programs we are not running because you can only do so much in a 10-hour day. And so we have to pick priorities. We have to pick what we're going to do and what we have to a degree, let go. We have done some things here to try to help. We go to court every week now. And that's a good thing that we're getting in court and getting on the calendar, but that creates more work for staff because you have court reports to do every week now. And foster care is mainly the caseloads that are above what the state says you should have right now, well above. Our investigators are the same, not to the degree, but they are also above where they need to be. I also have one supervisor attempting to supervise 102 children. That's next to impossible to guide staff on 102 children at any given time. So I'm not sure what else to say about that. I guess I'll just have to leave you with what we're in a crisis right now in foster care. And our positions are filled. So it's not that we don't have positions filled. It's that the ones that are filled just have to be assigned too many children because we don't have any other children.
So what do you need? 4 or 5 employees?
No, I feel like
Don't be
I
shy.
feel like if we had an additional foster care social worker, an additional supervisor, we would be in a much better place. Because I know once we get additional staff, over time, it will begin to level out. When you can give cases the attention they need, and you can work with parents, and you can be prepared for court, you begin to move children out of care. But now we're in a cycle that each case gets crisis management, you might say. And so they just see it in foster care because we're putting fires out instead of actually really working cases to get children into permanence and out of foster care.
Are you having trouble getting more foster care, more homes? Or did you answer that already?
Well, we do, and that's another piece of the puzzle. We have, I believe, 9 foster care homes in Scotland County. Now, all these children are not in those homes. So we have 9 of our own. We are ready to do another math class, which means, asking our staff to work over every week, more than they already are, in order to license new foster homes. So it's all like a snowball effect, I guess you might say. But we are going to try to forge ahead with a licensing class. I can teach licensing. The manager can teach licensing, so I'll be right here taking my turn to teach it too.
So April, are you saying we have 6 staff members plus a supervisor or 5 and a supervisor?
We have 6 and a supervisor.
And to help with the crisis, you're saying that we need 7 and 2 supervisors.
I need 7 staff and yes, sir, that's right. That's
Gotcha.
right.
April, obviously something has happened with the pandemic and otherwise that has created this increase. But my guess is you've also had increases in caseloads in your other areas as well. Is that true?
We have, like the number of investigations have increased. And we are seeing, I did child welfare for years. We're just seeing cases now on a more regular occurrence that are bad. We're seeing heroin, we're seeing methamphetamines. We're just seeing bad stuff that years ago we saw, but now we see it all the time. And so, which means, of course, you keep cases open longer. It takes a toll on your staff because they're seeing things that are much worse. You no longer get those, what we used to call easy child welfare cases, like somebody had a dirty house. And so you teach them the skills to do better with that. You don't see that anymore. You see a dirty house because your mom is using meth and leaving her children alone. So, and that's not just in Scotland County. That's of course in pockets of the state.
Well,
But
I
like
guess.
you said, COVID has had an impact. People have been at home with their children for a year. So our investigations have gone up.
Well,
We're seeing fatalities in Scotland County. And not all abuse related, but, we're seeing co-sleeping fatalities and some abuse related fatalities. It's just, we're looking at a different world of child welfare.
Okay, but is this need, you've got the greatest need right now?
Yes,
Okay.
Yes.
Is there?
in my entire department,
Okay.
not just in the entire social services.
Now, April has also made has already temporarily rearranged positions from lower demand positions and actually moved open vacancies into that unit. But, it's still,
Is there an open vacancy that has been moved into that unit?
I know we,
This is a once in a lifetime occurrence. We had somebody that left child welfare to go to food and nutrition. They took a demotion. I convinced them to come back. Now they've resigned from the agencies altogether. So I can't fill it as social work because it's a F&S position.
So of
And
your
F&S needs it back.
of the 6 social work positions that are in the budget, are all of them filled right now?
Yes, ma'am.
Okay.
April, what about, we know this is not gonna stay this way all the time. When you hiring all these full-time people, can you consider part-time, retired social worker that might wanna come in and work, stuff like that there? I mean, I know several people that's doing it now, but have you considered that route? Because I know that 102, some point in time, they're gonna get to the point where they're gonna level out.
And then
You might have 50, you got all these people hired and nothing to do. But, part-time basis, I would think, hire somebody that has got the experience and gonna work a few hours, a month.
just to help handle the caseload.
On caseload, to handle that caseload, bring it down a little bit. Have you considered some part-time workers?
We do. Matter of fact, I reached out to Vanguard this week. And that's exactly what Vanguard is. They have retired social workers or people that maybe want to travel. One of the issues we run into is when you come into child welfare, you have to have certain training. And unless you've had it within 2 years, you can't touch cases. State won't allow you to work in child welfare. So Vanguard, however, that's who they employ. I reached out to Vanguard and they said, we have nobody for Scotland County right now. So we can bring, matter of fact, this summer, I did that as well. We had somebody that left us and went to the school system. And I reached out and they came back and helped us for the summer. But they still had that training within 2 years, so I was allowed to do that. So we do try to think a little out of the box as well with that.
I think you put it out there, sometimes they don't know you in a situation you're in, and like that, put it out there so they'll know. You will be amazed by what kind of calls you might get on it, support. There are a housewife that, like now with the COVID, the kids home, and maybe they go back to school and say, well, I want to do something, got the experience, so we want to do something.
That's a good idea.
Right,
They
but
want to do it, get out of that.
Let's ask the question, if we were to approve 2 more positions today, because this doesn't sound like something's gonna wait 6 months. There's a portion of that, and Kevin maybe know or April, but the state's gonna cover, right, of the salary.
Yeah,
Yes.
there's a reimbursement that we get back
a
from
large.
anybody in that position.
You're gonna get, yeah, you're gonna get 60% back in reimbursed for their salary.
So 100,000, we're gonna get, it's gonna cost us 40,000, and I'm making that number up, but.
It's gonna be
That's about
between
right.
60 and 70%. You can't put a definite number
Yeah,
on it
yeah.
because it's all based on children's eligibility.
The state doesn't have a ceiling on how many positions we have in different departments.
No, sir. Social services can, commissioners can choose to staff social services any way they like.
They have a recommended caseload, which would be more of a floor.
We're way above.
But
We're
yeah,
way above that.
Yeah.
Yeah.
Well, I'll make the motion
Okay,
to hire a supervisor and I don't know what the name of the position is, foster care service
Social worker.
provider immediately for DSS, and that's my motion.
you said a supervisor and what?
Whatever that,
Caseworker.
whatever the caseworker, whatever the official name is of that position.
How many though? One, or did you give a number?
One of those and one supervisor.
Okay.
That's what she's saying she needs.
And I'll second.
All right. So, the motion is that, effective immediately to hire, an additional supervisor and a foster care social worker. Any more conversation, discussion, comments?
For how long though? Just for the duration?
I can't hear you.
For how long? For the duration?
For the, yeah, I mean, they would come on board permanently, yeah.
But I think, I'm not putting words in their mouth, but I think, a year from now, the caseload snap back to
See what I'm saying?
68.
Drop
Then
it
what?
down,
Right.
we just,
Well, if it went back to 68, we'd still be at what the state recommends
Right.
per person.
Madam Chair, we need to get it before the board, then discuss it. We're discussing it and having a second.
he said.
It was second,
It was
it's on
second.
questions now.
Okay, we had a motion and a second, and now we're discussing. I think
Right.
that's what we're doing.
That's right.
That's what I thought.
Okay.
Yeah.
And the point being,
Yeah.
when the caseloads come down, we'll still probably, I mean, maybe in line with the state, but if they come back down to 46, that'd be a great thing. But
Right.
we also have enough attrition in
That was my
DSS
next-
that the
I think
that the
attrition
staffing
there takes
will
care of
level
a lot of
out.
that.
Well, then, okay.
I think.
Well, and if she's got a greater need somewhere else, she can move the position like she's done in the past.
Right.
Okay. So we do have the motion for a supervisor and a foster care social worker made and seconded. Are we ready to vote?
Yes.
All those in favor say aye.
Aye.
Opposed, like sign. The motion has carried. Okay. April, thank you. I don't think we have you on the agenda anywhere else.
Thank you all very, very much.
Okay, I think Miss Betty wants a break.
She's not alone.
Not just me.
She just spoke on behalf of the group. She's not alone.
I
Just
just
taking a shower.
Yeah.
She saw the eyes floating.
We'll
Yes.
take a 10-minute break and come back and hear from the liaison committee.
Okay.
I got to go outside.
I'm gonna talk to you when I'm
I'm gonna leave on that break.
You know, I saw,
Just so y'all know, this is still streaming, so I'd have to stop it and then start it again.
So we're still on the air.
So we're still on there. Now, train them on. Who to the
There's only 3 people watching.
Oh.
pretty late in a year and a half.
And chances are they work for you.
that's right.
So, 3 people that were watching.
You can go.
They probably
Yeah, you're
work
gonna
for
be
you.
here for a while.
I have a question.
Okay, yeah, I got it. Wait a minute, I put my name on it. My name on
Sent you a text.
We got your granddad.
Oh, yeah, wow.
Take a part of it. I'll let them. I was killed them just. Pretty bad.
Yeah.
Pretty bad. Then
I'll put my name on it.
gloves on, man. Put in there, me. And what I do.
Chicken.
You want a side? It comes with a side.
Well, let me check.
Let me see.
Make you get.
So if it's, we'll all get the soup and then
Well, see, the lunch part. Right now, is it?
I got my water.
Nancy gonna-
Because they cut.
I ain't Joe say actually.
Don't need me, I got water.
I'll get you to the water.
I'll see, you're not gonna watch it. I'm watching, it just gotta be in his own little world. But that's the lesson, you don't need it.
Oh.
This ain't done now. Miss, what's her name? Karen? Karen.
Oh, this is what?
She talked to Lisa about,
It's true.
well, Lisa.
Do we need to
Shot.
take action
So Lisa.
on our
Lisa
meeting
might
place
be-
for this month?
We've been going before in the past.
We've already, we did that last month.
Just saying, so yes, I saw it. She said.
We've been doing
I said, you weren't saying-
Last February, we agreed to meet here in March.
You got it right there with you.
So, yeah, Monday, you'll agree to meet here Friday.
After April, you think we can get back
You need to report out.
to the
Okay, we'll talk, we'll give you some.
Now, the drive-through clinic tomorrow.
Okay.
Page Station,
It's, I mean,
the only thing I read. The Page Station, thing I know I read it.
I think you already. I got a friend today, tomorrow. Saturday, Sunday.
I think when we get
Or yesterday.
But I know I read, you can do it Page Station, it's gonna be raining and they don't have enough tent. Okay. Oh.
But that's just New York. They call it,
That's why they coming in.
they're coming in.
You gotta go to get ours.
They send the shower. We own the gentleman.
That medication.
Yes, sir. His granddaddy wanted to go in.
My granddad go in. He picks up. He'll go
They
in.
go in. I'm serious. I told you, I tell you what now, she been holding on for 2 weeks.
I just-
Silas Fields' wife, Miss
Marshall.
Marshall.
Oh, we ready to go to Georgia.
Yeah, he ready. Her daughter called me when they first put her in hospice. She said, it was 4th of July, not 4th of July, April Fool's, Valentine's Day weekend. That Friday, she called me, I didn't want to tell your granddad, I said, well, when she passed, I'm gonna have friend home and fix Lamb to pick her up, but she didn't have. Then I had his granddaddy go pick her up from there, because we can't go across state lines unless it's involved.
Okay.
I just can't go pick up, I really thought I could do that.
And I'll tell you about my granddaddy, since you told him that. I called him that Sunday to
ask him to do something.
Am I going to read my number?
I probably gotta go to that.
I'll show you.
He is ready. I think he was put out something with you. Jason.
Yeah.
Hey.
She not still here?
Salty, that's good.
Oh, solid.
Sweet and salty.
Actually, what I'm doing is pulling up.
I thought that was clear.
You leaving now?
Yeah.
Okay. Well,
Because I'm
What
just
I'm
basically
doing-
modifying your
oh,
stuff. I just took your
yeah.
stuff, put it on here.
You know, I forgot we had that meeting with so many things.
Alright, so I'm real quick, just in case.
Oh.
I didn't really want me to be.
You're on the phone.
Something I wanted to mention yesterday when we were talking, and I got off of politics.
That did this.
Fund balance, one thing I do is fund balance. I took your.
I may be all night to do it, but you home.
Oh, for that, okay.
Go, go.
I'm just-
I need mine. I need mine.
This is for later. Here's the expenditures.
Core value.
Whole,
That's been happening.
So we're just, so we're just doing it.
A lot of people are upset. Some roles, I
Now, wait a minute, this is by 12.
Oh, no.
Yeah,
I'm going over this and then.
I'm sure, we could have a mass exodus.
For taxes.
Of their staff.
I'll send it to you.
Is when I take it from Excel and put it into sheets, it
What is
changes
it about
everything,
That's why we
so.
don't like, we don't like.
Meetings we have like this on these days.
But basically,
They blow up.
you know,
With you personally?
Yeah, you know, it's just not.
Well, I've had 4 phone calls that I
Because
didn't.
I
That was New York that kept calling me.
property
Chasing.
taxes, and then,
What's going on?
Nothing.
That's what it amounts to.
Okay, how are you?
Hey,
You're all skinny fat.
Yeah.
sales tax.
It was more,
last week was my week for that.
it was more of
And
that I
instead
didn't
of
answer
showing
the
them the
phone
big,
than.
Then there's a
Yeah.
big
just going back so they can see. So you have 2021 going back in time. So really, if you look at this, our sales taxes, hopefully it's gonna blow us out of the water. Uh, Property taxes are,
I want to sit down and just have a long conversation.
They're about the same as they were. I had a conversation with Jim before I came over. And pretty much said we've only had 1/4% increase from where we were this
Yeah.
time last year, so we're
So-
all talking.
but if just looking at this and, you know, we're a little bit ahead of where we were last year at the end of January. So, which means we're right on target. So. Don't think that. And of course, all of this information that we're presenting, it's all in Google Drive, so you have access to all of it.
Okay.
So those charts I saw, I was showing, they look better in Excel. So if you download it and open it up in Excel, there's more information there. But, you know, we're gonna show the graphs. If you wanna go into the 6 pages of detail with them, feel free, because there's detail all the way back to 2008, if you wanna see it.
Oh, I had it.
Did you?
I didn't know it. I really enjoyed
Wherever
it.
you wanna be.
I've been made it for me and I enjoyed it.
I was beginning to be worried because I'm glad it won.
There's a microphone.
Where you get it from?
Jason and I are the only spots that are not picked up by the camera.
Okay,
How they
yeah, I
I gotta
noticed
use
that. So, yeah, I noticed the sound was better too. I could hear.
Have you read that article?
I have not.
I'm gonna see.
And I can't believe you didn't make the shirt.
I do, but
You want to choose one?
Have you eaten anything from over there?
I saw that, I'm like, oh,
Now, I have heard
Yeah,
that chicken.
I saw that too.
I don't know that for a fact.
Have you eaten from here?
I'm sorry?
Have you eaten from here?
I have.
Now,
The only thing I had was the club,
I was.
and it was good, but I give you french fries, and I don't think
You've been doing
french
good.
fries coming here. I've heard the rice bowl and some of this stuff.
well, you know, it's funny.
That's just what I heard.
You said now you're a person.
That's the second day.
We have.
And I usually get that outside too. No, just go out and take a picture. There you go.
Real upset.
The
More than I wanted to.
Philly steak and cheese is probably something I'm gonna try at some point.
They've got a, or they have been running back in the morning.
Oh, oh, really?
Now, they also, I think you,
And never did.
I think they have, don't they have chicken and dumplings? I heard that, they may not have it on their.
And I
on
think
that.
they have
Bumgarner.
breakfast for breakfast sometimes too. Cause I saw, cause I was looking at the.
Oh,
I saw
Okay.
some pictures of them baking gravy.
And did do it.
But he said,
All right.
but he said,
Hash brown.
No.
on the company passed, and it took,
Corned beef hash.
Yeah, corned beef
hash.
Yeah, something like that.
yeah,
It looked good.
but he got promised to me, telling me he was gonna do it.
All right, I'm gonna go order this.
He told me what that happened. You could have
How's
told
the
me.
child?
You don't know.
You're growing way too fast. She's 6 months already. Crazy.
Looking for
Who
the
is?
picture.
My
It
child.
ain't made.
Oh, my God.
Yes, time has flown
You got any
by.
pictures?
Lines.
I do have many pictures.
Yeah.
Are they on the screen or?
You got a phone?
Well, no, I know Tammy was fussing at my husband at the election poll,
You would-
that she had to Facebook, friend me to see pictures of the
Yeah,
baby.
right, right.
Well, she Facebook friended the wrong one, because she Facebook.
My daughter's having so much trouble, I don't know how to get down and how to do all this stuff. It's a living nightmare.
6 months.
And see, even you guys love me. I don't know why.
She's 6 months, hard to believe.
Did Alexis go back to Charlotte?
Yeah, she went back,
You know,
Matthew graduated?
I'm doing good.
He's a junior. He's a junior.
Well, maybe he'll get to have a normal senior year.
yeah.
And that's something that hits you too. It's not just doing your work.
He's barely one of the staff members of that, Joseph Davis.
Fourth
There's not
generation.
need not.
And then the other one I told you is.
They'll have
is-
something,
He loved that.
but next year is.
Dogs,
Dogs.
dogs, and I'm Joseph Davis.
Well, no,
And
what
the other
happened
one
is that she, this is about 30.
This won't take long.
So that's three of
And
them,
that's
his
all I
staff.
got.
That's the.
Yeah, I don't think there's much for them to report.
Cause he's gonna get sick.
They just really don't want to know.
Has the transfer been done completely?
I mean, it's just
Are we
like,
still
oh,
transferring?
How's Stephanie?
We've not transferred.
We haven't?
No.
Is there anything to
I
stop
talked to her
it?
on the phone, she's on some sort of a.
Yeah, you say no or city council says no.
but you know what, Sean?
Oh, we had said yes.
I want to take it back.
We never took
And
action.
I'm every day, I'm
Y'all say
trying.
yes 4 times.
I see people.
And then city goes, oh, okay. Or they're trying.
Oh,
I can't believe something. I mean,
They told me the other day
If you do what you've done 100 times before.
That's
So I had to
possible.
go get tested. Get tested.
I know to have mine out, because I got a stone in me.
Isn't that Bobby here?
Sit down.
You know, vaccines and stuff. I figured hospital, they said only 50% of the staff at the hospital is taking it. 95% of the doctors are taking it.
Only 95%.
I'd say 50% of the hospital staff is not taking.
That's what I said, 50%.
We're ready.
We're ready.
The nurses and the custodians, that kind of, everybody else has not taken it at the hospital, won't take it.
How was we in her community if they don't do it? And how we gonna get straight? Hey, when you go to the post office, you go to the social security, yes, see.
They make them take the flu shot.
I know.
Here's the deal, just take it yourself and you
Yes.
will get sick but not die, have to go to the hospital.
Mhm.
So that's my way of thinking.
Okay, I think we're back and ready to hear from our three commissioners that had a liaison committee meeting in the last week or two. So who's gonna go first?
I think
Well, you won't be
ladies
hearing from
first, we'll let Betty.
There you go.
Well, you will not be hearing from three, you'll be hearing from basically one expert. Mr. Quick Gibson, Commissioner Quick Gibson, because he is, been around for a while. When I came on the board, I was out 4 years, I was elected, I came back, everybody had negotiated, did all these things, and I'm kind of new. And Bob Davis put me on this committee. He said I asked for it, but I said I didn't, but he said I did. But anyway, it's a good committee. Wick comes and gets me and shuffles me to the meeting. And I enjoy it, because it was raining that day and I couldn't drive at night. It was raining at night. But it's been a good meeting. I enjoy working with the school board members. I think we getting somewhere, don't you think so, BJ?
Yes, ma'am.
So I turn over to BJ.
We had a really good meeting, some really good conversation. I think we share some concerns that exist as far as just the way that the school board handles monies and them being what we here in the community so often that they're top heavy. They shared some of the creative things that they're doing through the new superintendent to kind of change some of those positions. We didn't really get into numbers as far as, I don't think they're ready to talk about that because they don't have a budget or even an idea. Of course, you know, the past couple of years it's been that way. But really good conversation. I think we're off to a great start. There was conversation about the concern from school board members about their, what's the right word? What do we call it? Our, what we get paid.
Oh, somebody, they use the term stipend.
Yeah, so there's a concern from school board members about an increase of their stipend. I don't think it's been increased over 20 years or so, they're saying, and they're meeting more often. So that is just a conversation that we had. But otherwise, I think we are off to a great start.
Do we pay that stipend we give them? We don't have anything to do with that.
Well,
stipend,
the
do we?
understanding from what our conversation, if you remember, Betty, is that their attorney was sharing with them is their part of their budget, but they have to go through commissioners for approval. They can't just do it themselves.
That sound like it?
I'd have to look at the question.
That sounded a little odd to us, but we
Yeah,
didn't-
we didn't argue it.
We had not had any conversation, did not know that was gonna be a topic.
I mean, I don't, it may be true, I can't say that it's not, but for us to have to approve them increasing their stipend, that doesn't sound right.
Well, that-
There are stranger things in the law than that.
It came from the attorney, but I would ask Mr. Johnson, just based upon the fact that the conversation started, if you and Kevin would maybe look into it, just to find out.
We'll verify.
Yeah, that's an interesting point, I'd like to.
I'd be glad for us not to have to do it, but.
I mean, I know that their stipend.
No, it comes out of their budget.
Comes out of their budget.
Their
Yeah, but
budget.
it better come out of their
Well, if you think about it, it may be, they may like it better that it has to be approved by us.
I think they do. Or would, I would.
And I know the stipend's not very much.
Yeah, that may be right that way.
That makes sense.
36 annually, 3,600 per year.
3,600 per year.
Mm.
I wonder how that compares to other school boards, do you know?
We asked them to bring that back when we meet again, because they have that information. They said much like us, they're at the bottom of the totem pole.
But see, anytime, and I have that, compare the board of commission, what we get and what Robinson County get and some of the other places, no comparison.
Right.
You know, so it's probably the same way with the school board.
Well, I can tell you, $3,600 is nothing as often as they meet.
Yeah. The headache, yeah.
So I'll turn it over to Mr. Gibson.
Well, I think y'all have covered, it was a very good meeting. I did say I felt outnumbered because both our commissioner, BJ Gibson and Betty Golston are former school board members. So I told her I felt like I was 1 against 5. But I thought the conversation was really good, and we kind of reiterated to them that for several years, we have kind of had a target that we thought we needed to try to move towards. And that we understood that last year, they did not feel like they could go down because of the, one, they didn't have a approved budget to work from. And we told them that we still are, I told them I wasn't speaking for our group and wasn't speaking for this for the board, but that, for the last several years, I had been part of the conversation that advocated that we try to move below the $10 million figure and down maybe another couple $100,000. And they said that their board has, last year just didn't feel like they could afford to do that. They really hadn't had much discussion about that this year. Commissioner BJ Gibson, I thought, brought up a really good point before the meeting, and we brought it up at the meeting. And that was sometimes that there are issues that may impact education in the community, like the poverty level and others, that perhaps money could be used in those areas that would help our county and our citizenry and our school system that wouldn't necessarily have to go through the Board of Education. I thought that was a conversation that they took notice of and I think found maybe appealing to them. There was some conversation, not any numbers, but about the amount of CARES Act funding that they had received and how much of that might add to their current expenses and whether or not they would be able to operate in the coming year with perhaps less funds because of the money that had come to them through the CARES Act. They also said, and I think this has been advocated a little bit in the news the last week, that they may be having to run an enhanced summer program. And that, I think, is being encouraged by the state and is likely to occur in many counties. Whether or not we're prepared to do that, I don't know. It's a beginning of a conversation, obviously one we've got to have some meaningful dialogue in the next couple of months, because we're talking about the current expense budget for the schools starting in July. So we've got a lot to do. Our next meeting is in about 3 weeks. I think we met a week ago, and we'll meet 3 weeks from tonight.
You did schedule another meeting?
Yeah.
Okay, good.
Our tentative scheduled date, and we may have to have more than these, is the third Thursday. And the next one will be here, and Jason will have to help set that up.
Wow, that sounds
But
great.
one of the conversations that I think we talked about was that the purpose of us making this report is we would like to hear from other commissioners as to what our marching orders ought to be. You know, what kind of suggestions you may have to us in regard to our conversations with the other three members. The other three members are Summer Woodside, Herman Tyson, and Rick Singletary.
And if I may add before y'all respond, going in, that was my question to these two, so that I know, because it's not what we want, it's what this board wants. And so that's how I got an understanding of the, I guess I'm gonna say commissioners really wanting to get under the 10 million. So as Mr. Gibson says, I think we need to hear from you all, what other things you all would like for us to be discussing with the school board or with our committee.
I mean, I think we may come up with issues as we move more into the budget and we see, I mean, how the schools is going to adapt to children coming back into the classroom. Tutoring, I know I've heard some stuff on the radio about tutoring programs that are going to develop, enhanced summer programs. There's just a lot we don't know yet, but I think as we learn more, it may create more questions for me as to, is there a role here for the county that we don't know about yet? So we'll see. Okay. All right. Any other comments on liaison committee? Thank y'all for that, and thank you for being a member of that committee.
Carol, if I may want to add one more thing, and just because I'd forgotten it, we asked them what their ADM was for this year, and I don't believe they were being evasive. They said that kind of statewide, the assumed ADM for September of this year, which was September 2020, was the same number that was used in September of 2019.
Really?
That's what most, the term that was used, I think, was would be held harmless.
Yeah,
The ADM would remain the same as the previous year in order that the system would be held harmless for any reduction that may have occurred due to COVID.
I don't know how they calculate. I mean, I don't know how they.
they don't know how,
They
yeah.
don't have a calculator. They don't have any, I'm sure they have some number of how many kids they're serving, but.
Oh, yeah, they do.
it could
That,
be-
there's concerns all over the state about the number of children that are not logged in. We know that, but
And we talked about, is it costing less to run the school system because you don't have kids there? And a lot of they admitted there probably were less money spent on utilities, but you're still having to keep it clean. Most of the cafeteria workers, the buses are running to deliver meals. They didn't have a definite figure as to what it was costing as compared to what it would cost in a normal year. But we got the impression that it wasn't going to be substantially less.
And I don't know why it shouldn't be. I mean,
It seems
that
like
was,
it
that was
should
my
be.
thing.
Yeah.
But, Wick did a good job of getting information is on your email. And, it's broken down into a whole lot of areas and categories that you may want to look at.
There's two things, we're three documents that we talked about, and one of them, I think we're still waiting maybe from Herman Tyson. This is the map book for this published by the County Commissioners Association, and it rates systems and the amount of money that is allocated on a per child basis. This is something that comes out every year from the school finance officer, finance study, public school forum, and these statistics are really about 2 years old. But in both of these, we have used in the last 6 years in talking about how Scotland County funds its school system, both as a dollar amount per student, but in this one, it specifically talks about dollar amount per student as it pertains to your county's ability to pay. And when you look at that, we may be 40th on the list on ADM. We're absolutely first by a ton when you compare it with our tax base and the amount of money that we actually have raised in taxes.
and that's been true for the last 10 years.
And I think the school board recognizes that, and they're sympathetic to it. They're not in any hurry to rush to get us at a funding level of significantly less than what we're currently doing, but they're not. And the other comment they made, and they said, when we do, in the past, when we have been able to reduce what we've given them, we generally, for the most part, reduced our tax rate at the same time. And I know in the last couple of years that we've done that, which has not been this year, maybe not even last year. We try to give credit to the school board for their contribution to us being able to do that. And they were hoping that if we moved forward and did reduce it, that we did reduce the tax rate, that we would give them some credit for having done that.
Mr. Gibson, sometimes in these federal programs and the funds that come, there's sort of a caveat that the funds that are given can't be used to basically supplant local funds. Did they say whether the CARES funding or whatever sources that are coming to them have any restriction as to that, or is it possible that, given that money's coming in, that it could benefit locally by reducing the amount of the local contribution?
I don't remember anybody specifically making a comment about
But
that.
it's something that we need to ask about though, because they were very vague about the CARE Act. And we were asked about, you got this kind of money, and are you going to, would it help you make your commitment to us? And they were very vague with it, so we need to find out.
And it may be more relevant if there's a second package that really would apply to this year or the upcoming year.
No, their CARES money was no way intermingled with ours. Is that right, Kevin?
They got direct allocation.
Okay.
And not to defend them or whatever, but I think they just lost another finance officer, right?
Right.
And just rehired one, so he may not be up to speed yet on the numbers. I don't know that. I'm just throwing that out there.
Yeah, I think they've had, since Jay Tolan left, however many years ago, there's been 3. So they're, I think you lose a little bit of consistency when you.
Okay,
It's a good question,
all right.
Mr. Johnson. I don't remember that being the topic.
Probably more relevant to the upcoming year. anyway.
Yeah. And it was the first time we had met, so there was some feeling each other out kind of conversations. But I thought the committee was pretty much on the same page and willing to be very open and honest about what we wanted and what our situations were. And I think that's basically how it's operated for the last several years, and I don't see any reason why that won't continue. Thank y'all for your time. And if any of you who are not on the committee have input that you would like us to be aware of, please don't hesitate to pick up the phone and call.
At any time.
All right, are we ready for Beth?
Ready when y'all are.
I think we're ready.
All right.
We're gonna have our
Do y'all
financial
mind if I sit
update.
here, or do y'all want me to stand, or y'all hear me okay?
I don't know that the online
Yeah.
people can hear you.
You want to come?
I can.
That can't be larger print, is that as large as you can get it?
No.
Oh, okay.
So what we're looking at is the actual revenues as of January 31st. Show our budget in the first column, any amendments we had made in our current budget, which is right at 45.7 million. Our actual revenues that have come in so far, 29.2 million, which is about 64% of our overall budget.
One thing I do want to point out, in here, fund balance. Of course, we have 1.8 million fund balance appropriated. That number is always going to be 0. So that's going to push down that total revenue amount. That's going to suppress that number.
And let's see, too, under the revenues, I think Kevin said you guys had access to this full worksheet.
Yes.
Kind of listed some notes of what has happened and why things may be decreased.
We have access to what?
The workbook here.
I don't.
It's,
either.
it's in the Google Drive.
Which Google?
There's a Google Drive that's shared with you for, this meeting under the commissioner's monthly reports.
Oh,
That's.
I didn't know that.
I think it's, while you're on this page,
88, the number?
Ms. Hobbs, Beth,
Yes.
sales tax is on here. Is that your restricted revenues or that's the local option sales
The
tax?
local option sales tax, that is, yes, that's strictly sales tax. So that does not include, that does include the schools portion, if I'm not mistaken. Yes.
It does.
And that is restricted. So that is both unrestricted and restricted sales tax. That's in total.
Yeah, you'll have to send me that because I don't have it.
Okay.
So that's, and you're saying, so we're at 56%,
That's correct.
and that's through January, and aren't we always operating about
We're
2 months behind?
That's correct.
So those revenues are looking pretty good.
Yes,
We were afraid they weren't.
that's right.
Right.
So we're looking
Better
at,
than we could have anticipated.
Yes.
yeah, so I think when we get to the projections and all for the end of the year, we're looking at anywhere between a 1% and 2% increase from where we actually budgeted.
We budgeted way behind. I mean,
Yes.
And the fines and forfeitures are way down because we're not having court.
Well, that, and then they've been way down in the past couple of years anyway, because of the way that the law changed, I guess, as far as the fees and all being collected from the individuals coming into the court system, I guess their ability to pay, if I'm using the right words. So some of that has cut the revenues and all in that category.
I guess my question on that local option is I know we budgeted as if, correct me if I'm wrong, 10% drop.
Yes.
So it technically is an increase year over year. It's just over the budget.
Correct.
And also on the property tax, I had a conversation with Jim Brown before I came over, and there is, as far as where we are right now, we were up 0.25%. So we're still on target as far as our collection rate at 92, 93%.
And just with collections, after at the end of January, we're not gonna see a large chunk. We'll see a small increase in in March, after we advertise. But thereafter, we'll probably collect another we'll collect more, but we're not going to go way beyond expectations in these last 5 months. That last 6% is going to be hard to get.
So next are the expenditures as of January 31st, and we have expended 25.4 million of our overall budget, which is, we are looking at right now, or as of January 31st, using about 58% of our funds, so we're kind of right on target with close to 56% being utilized. And some of that savings is coming into, well, I'll take that back. We've with the CARES fund, we had some salaries and all that we were kind of, I guess, refunded for lack of better words. I have not made the journal entry to move those funds out, so this is actual where we are now without taking the CARES fund into consideration. Right, the projections, as of June 30th, looking at overall revenues of collecting 91% of what we had budgeted. And there again, as Kevin said, the fund balance does not come into play, or it comes into play with this number as far as making it inflated. Anticipate there again having a slight increase in the sales tax, looking at around 2% growth. The other thing I took into consideration is our federal and state dollars. We request the drawdowns as the funds are spent, and so we will not spend all the funds. Some of the other fees and services were reduced due to lack of activity because of COVID restrictions. We also had in our investment earnings, we have a significant decrease there. One of our accounts with the North Carolina Capital Management Trust was in a term portfolio account, and that account was doing great. And then all of a sudden it didn't. So we have closed that account and have moved the funds into our governmental portfolio account so that we can continue to earn some interest. It just isn't at the rate that the term portfolio was earning. So that's why there's only 10,000 in interest earned so far, or will be, or that's projected. So we've got a huge decrease there where we had not anticipated that happening.
Going back on that local option sales tax, you said about a 2% increase, or you talking about a 2% over the budget?
Over the budget, yes.
I just don't want people to hear that and think we're year over year,
Gotcha.
because that's probably still behind
Yeah.
the previous year.
Yes.
And of course, with the sales tax, the taxes that we actually receive for July and August are last year's numbers. So we only have 5 months of collections at this point in time.
Is that huge drop in the investments at the state level? Is that going to be statewide on that account you're talking about?
I guess those that were invested in that particular fund, yes. The recommendation of the trust was to more or less everybody in the state that participated closed the account out, and they've more or less dissolved that fund. So, yeah, it just was not, I guess with the COVID and everything else that had taken place within the last year, just hurt the rates and all that we were earning.
So the state treasurer was invested in that, making that choice, or?
I'm not sure if the state treasurer was involved in that, conversation or not, but, this was just another investment opportunity that we had with, the Capital Trust.
Yeah, these investments are through North Carolina Capital Management Trust. So the retirement system, the health insurance system for the state, local government employees retirement system, they can make actual investments beyond what we can. So they're not quite as limited. So they may have had better growth than we've been able to do.
Basically, the CD rates went to almost nothing. Is that what you attribute it to?
CD rates have been nothing for
Yeah.
years.
Right. And of course, one of the things, because like in the last year, some of the stock market has continued to do well. We can't invest in the stock market. We can't take equities or anything else. So we get those really aggressive things like municipal bonds and U.S. treasuries.
But you anticipated you're gonna have a $230,000 return on it.
Right. We originally did, and that's what we were doing last year.
Right, that, yeah.
But the market dropped out.
You're not anticipating the impact on COVID and all that on some of the investments. And the fund that we were in was probably more aggressive than the governmental fund that we had. So we were definitely, we didn't put all of our eggs in one basket by no means, but the funds we were not using at that point, we definitely invested to take advantage of the market at that point in time. And we didn't, I'm not saying we lost anything by no means, we just didn't, what we lost was what we just didn't earn in interest. Any other questions on the revenue piece? All right, we'll flip over to the expenditures. I project that we're going to spend 94% of our budget. That's 42.9 million. And if we take out the fund balance that was appropriated, we will have a revenues over expenditures of about 500,000. And this does take into account removing the CARES funds, dollars that we receive to cover some of the public safety salaries.
Why does the school fluctuate so much? I mean, we set the rate, and then I know there's capital funds have to go into it. But why is there and in this case, $40,000 difference? How does that, is there something that we're paying out only as they bill it, or don't we just give that to them as for lack of a better word, a lump sum?
So each month we send the local current expense check, which is running a little over 800,000 a month. The capital we have not paid out because until they request that, we don't pay that. That's usually towards the end of the year. I'm not sure where you're referring to.
Well,
the difference there. Yeah, so there are some other, like the fines and forfeitures, the schools get those. So if we budgeted 140,000 and we only collected 84, that's all they're going to get is what we've collected. And so we budgeted.
So that comes back through us.
Yes.
So
Seems like a lot of,
it's,
yeah.
so that, for instance, drives what we actually spend out. There's also some fees that are incurred with the bonds to pay our trustee to handle the accounts. Those are minimal, it's like $4,000 a year. The other stuff pretty much is straightforward. Like I said, the capital and the current expense, that we definitely know 100% of those dollars are in and out.
It's not a big difference. I just operated under that. Here's your money.
Right.
Have
And
fun.
100% is going
But that brings up a different question. Have we not paid any of that 300,000?
We have not, and I did notate that on the January 31st worksheet.
Because if you add the 300,000 to that expenditure,
Now, at this point in time, by June 30th, we will have paid
okay,
that
all
out.
right, so you got that in there.
Yes, I'm sorry, I misunderstood.
Yeah, but the fines and forfeitures, the flow-through money,
Right,
that's probably that's the vast majority of that 1% underspend.
just scroll up on that sheet a little bit, just make it a little bit for a minute. Your health and DSS, your notice funds dispersed as,
Basically as requested, so a lot of these dollars are programmatic and I guess programmatic driven. So if they don't have somebody there for the services, they may have budgeted for something and they're restricted on what they can spend those funds on. So we know we're not gonna spend all of that.
okay,
And this is also why some of our restricted revenues, we know we're not going to receive because we're not going to spend.
you're not gonna have the service, so you're not gonna get that revenue from the state. Okay. Hold on just a minute. Parks and Rec, is that reduction just because they haven't been able to?
That's just because of the programs they have not been able to offer.
Okay.
Go up, because like I said, I can't see this. It's the first time I've seen
Yeah,
this.
and I don't see it in the Google Drive either.
Okay.
The ambulance, where's the ambulance service? Is it
EMS,
EMS?
that is, it's up further.
Right, yeah.
Right.
There you go, okay, that's what I was looking for. Tell me what that note is.
Okay, so that's coming back to the CARES grant, or the COVID grant. It's majority of the payroll there for the public safety with EMS and with the sheriff's department. Those funds will be moved, the salaries for that were eligible for the grant. So there will be a reduction in the general fund, in those line items to cover the payroll that we were kind of I guess for lack of a better word, reimbursed for.
So there's additional money that was used to pay, it's just listed on the COVID sheet.
It's on the
Correct.
COVID sheet, yeah.
Yeah, they're in a different fund, or will be in a different fund.
Will we see those COVID funds and how they were spent?
Yes, and that was in the report last month at the January meeting.
So in theory, in the EMS case, there's $520,000 lying in a bucket unspent for salary because it was spent on the COVID side.
That's a majority of it. EMS, there are funds there for the ambulance and ambulances and whatnot. We never know what's gonna happen. So there's funds there for repairs and maintenance that may or may not get used for a particular period. So with Roland and whatnot, very frugal with his money. So
That's a good
therefore,
word.
he did not expend, and I know everything and he will not with his budget.
And the sheriff's the same situation, basically, right?
Yes.
Not quite as good off, but
I'm with you.
And there's, just depending on what
I
happens,
think
that
that would
number
be
could
true.
go up a
What
little
is-
bit if there's,
what you can
I guess a vehicle that may need to be replaced or whatnot due to, an accident or something, that number, like I say, could go up, or if they incur some additional, expenditures that are unanticipated.
$500,000 applied to their budget, which freed up $500,000. It's gone somewhere.
In the same manner as this.
well, Now go back to the total, because now I'm more confused at the bottom. 44, 45 was actual, right? Or
Yes, column E is at 45.8 million is your, budget amended,
amended budget?
yes.
Yes.
The actual is column F.
42.
The
That's
actual, yes.
projection.
Okay,
Or
never
the
mind. I had them in my head backward though. Okay. I'm gonna say, well, we should be a couple $1 million ahead of the differences, but I had it column backward. Okay.
What's column C? What is that? tell me?
Column C is the original
Original
budget,
budget.
Original budget. All right.
In these amendments, right?
correct.
And that gives you
Flex
E,
and E.
and F is actual.
Now, is the 94% to date, or is that what
That
That's
will be
projected.
projected into the year?
That's where we expect to be at the end of the year.
So it won't be exactly that, but that's what you're
That's the-
anticipating is gonna be close.
That, yes,
And we have revenues over expenditures.
right.
Uh,
And we're
Once
looking
you
at
take
about,
into account the appropriated fund balance, which means then, which is here,
Well, we just spent a little money today too.
yes.
A little, I mean, that's a,
It's not gonna be significant.
Well,
The
you got,
push
you got
based on-
460 on there, you may have spent 60.
right.
What's the assigned fund balance?
So the assigned fund balance, those are items that you guys have kind of put restrictions on.
Rec center part of it?
It is not. These are actually coming from the 2020 audit. So this is, these will be the audit numbers coming in at the end of last year. So that's where we kind of start. And then we throw in what our revenues and expenditures will be at this point in time to kind of come up with our projected. So fund balance overall, not just unrestricted, but overall is projected at 17.4 million. We started out with the 18.7, and then kind of taking everything into consideration, ended up with 17. And so projected for fiscal year 20, we're still maintaining our 24%. And looking at where we are, where I project us to be, we're still going to be able to maintain that 24% for 21.
Then the removal of the,
Now,
Once we do the rec center, that's gonna
Right.
be about a 20% reduction.
that's
Yeah,
right, and so we'll
roughly.
end up at an 18, 19.
we'll bring it down to 20%.
No,
No, we'll
bring
bring-
it down by 20%, be about 18.
That's the 18.74%. If we just
Oh,
take
there, you've
2.4
already got
million
that.
out of fund balance.
It's on there, so 19% will be what's in there after the Laura Hill Center.
Go back up, if you don't mind, to the assigned, and I know I'm supposed to know the answer to these, but what is the assigned number assigned to, and what is the restricted fund balance?
So the non-spendable, I'll just kind of go through, the non-spendable, that's going to be your prepaid expenses, anything that we have recorded at the end of the year that actually applies to the other, to the next fiscal year. So that's what the 9,000 that pretty much is made up of, and I'm running off memory on this. The restricted, that's going to be restricted by state statute. So those are going to be your DSS dollars, your 911 dollars, DSS, health department,
Sales tax receivable.
yes, and the sales tax. That's,
Beth, could you send us that with that information?
I can.
Because, I mean, that's good, but to know what those, I don't know it.
Let me ask this question. Kevin, did I hear correctly? The projected, fund balance, that's when we say we have this amount of money. That's not cash in the bank, is that projected, revenue that will be collected? Or is there actually dollars in the bank?
That's effectively, that's money in the bank.
Money in the bank, because I heard otherwise, okay.
And that's part of it. Here, your restricted dollars, that's assets, but that's not, your restricted is not cash in the bank.
Okay.
Because like a big portion, a large portion of that is sales taxes receivable, because we will receive it in July and August.
Okay.
So that's why it's not there. Reimbursements for health and DSS that we receive in July and August and September, they're there. Since we don't have it, we can't spend it. So really you get down to your assigned and unassigned.
Okay.
That's cash that you can spend. Assigned, or we're going to do this with it. We know where it's going. And your unassigned that's just money that you have sitting there that you're paying bills day to day with.
Okay.
And the committed amount, most of that is the tax revaluation fund. So those are dollars set aside for revaluation purposes.
And with this, if we need to have $4 million in the bank, or $4 million in the bank to cover a month. That keeps our cash flow going.
That's your 8%.
Which,
It's actually less than the 8%, but you did or more than, but I follow what you're saying, that's your cash flow.
yeah. So if we don't have to worry about whether or not we're making a tax deposit today before we make payroll.
But that's why I'm not speaking for the board then, but I think they said it at 16% rather than 8,
Right.
was not to ever hit up against that wall of not having the cash on hand.
I think that at the time we were having those conversations, the average for the 25, 30 counties that were similar in size to us, they were maintaining somewhere in the 20 to 24%.
Yeah.
Fund balance.
Well, I mean, if you took it to 10, or if you took it to 8%, we would be at risk of not making payroll one month.
Right.
And we've been there.
Yes.
I mean, that's a number, that's a true number, that's not made up, so.
We were there for several years in a row.
And just going back and looking at property taxes, and did this in Excel, so there was more information on here, but now we're doing it in Sheets, so it's stripping some of it out. But you have the last 5 years of property tax data that we've collected. The purple line item is our budget year to year. The green is the total for the fiscal year. And the red is what we collected by January of each year. 2021 is on the left-hand side. So that's why the green and red are equal there. But you'll look, we're actually, possibly a little bit ahead of where we were last year for property tax collections. So we're easily on track for the end of the year. One thing that actually was part of a conversation that a number of, county managers were discussing, because of the first round of stimulus checks that came out, you had a lot of people who wound up earlier on, or a lot of counties were ahead of their property tax collections because you had homeowners, you had small businesses that went ahead and took that money and paid off their property taxes or made payments towards their property taxes. But that was just an interesting comparison. But right now for property taxes, we are on track for where we where we plan to be for next year. I mean, for this year, which is gonna be comparable to last year. Sales taxes, and again, and I'll share this, I'll make sure you all have access to these files. But we have information on here going back to 2008, I believe. So if you want a comparison, you can get it. But this is sales tax through for the since 2012. Again, I believe the green is the budget, red is actual, and blue is where we were as of the end of, actually, I think February, because generally, we get that payment middle of February. So we've already received this month's.
Which is 2021, I can't tell.
2021 is the far left-hand side.
Okay, okay.
So.
So that the green bar on the 2021 is the budgeted through February of.
Right. No, the red bar is budget. The green bar is actual collections for the year.
Okay.
The blue one is where we are as of February of that year.
Click on green one more time, if you will. Got you.
Take it away from there for a minute. Yeah, because those two should be the same number.
Yes.
Okay. Red is budget, green is collections, and blue is February. Okay.
Yes.
Look, what's the last year to the far right, Kevin? What year?
Far right is 2012.
2012. Just observe the difference in sales tax in the last 8 years. It's pretty significant. I mean, in the recession, what did we lose? 5 million? Our loss of sales tax?
Sales tax alone during the recession was 3 million.
Yeah. Mhm. So we have recovered in some ways.
So, we have been seeing a trend, and of course, this year we did put that 8 to 10% reduction in budget. But, hopefully we will be above budget this year. We're still not going to see that same, you can see a slight upward trend here. We're probably not going to be at this level, which would be the continuation of that trend. But,
We got another stimulus to come out.
That's what I was getting ready to say, Tim.
yeah, if you hit that, there's no telling what's
That's
gonna happen.
$34 million dropped in Scott.
Something's coming. We
Yeah.
just don't know
When
when
is it
it's coming.
coming?
Well, if they pass it.
They're gonna pass something eventually.
March.
So,
We just don't have a price tag on what they're passing. That's all we don't have.
You know, the
So-
state of Maryland gave the people the stimulus checks. I don't know how they can afford it.
North Carolina paid it to.
Paid the who?
Mhm.
They gave it to families with children,
For children, family
Yes.
children.
$300-400 a piece.
Yeah,
When was that? When did that happen?
A few months ago.
November.
I think it was December, I think, or maybe you had until December to apply, but yeah, it was.
Okay.
Really?
I got the $300 check for Matthew. I did not get one for Alexis. She was over 17.
Okay. I didn't know that. I missed that one. Did you know?
I knew it, but I still hadn't got mine.
Yeah, okay.
No,
Were
man.
the income guidelines the same for that as they were for the regular students?
I don't remember.
I have no idea what the qualifiers were on that one.
I know basically you had to qualify for the child care credit.
Yeah, I see. Earnings
I
and credit.
hope my children didn't miss that opportunity. check with them.
I'll
No,
see
it
what.
was-
You
yeah,
didn't have to apply or anything, really,
No,
if you
I
did your
think-
taxes.
yeah, you use the tax
Use the
return
tax.
Then it
and,
just appeared.
Mhm.
yeah, and if you did not file a tax return, but you were eligible based on your kids, then you had to fill out an
Right.
application.
And it just has been staggered. I mean, that's why I haven't received my, for me, just waiting on it still.
Yeah.
My daughter in Maryland hadn't received hers either, and, you know, she got 4 kids, so that's why I was asking. I didn't know North Carolina gave us, I don't have no kids' homes, I didn't know anything about it.
I knew there was something out there floating around.
I didn't know.
You gotta go get
People got all this
your,
extra money in their pocket, I didn't know they
Miss
had.
Betty, you gotta go get your child.
No, sir.
Go adopt. Go ahead, adopt it.
No, I
telling me the chick you got to pay for your child? I don't believe so.
I got Percy made my cat. She almost should qualify for fancy food.
I have no idea what that was.
But, any questions?
That's a good presentation for what we need to know on February the 25th.
Well, I'd like to get a copy of it because I hadn't seen it. And I just looked on my act drive and I don't.
Yeah, I don't see it either.
Okay.
Um,
I'll go back through and I'll make sure you have access to this
Thank you.
drive.
Can I ask Beth one more thing before she goes?
Sure.
Are you, are you done?
I don't, well, I'm done when y'all tell me I'm done.
Well, you're not done, no. This is goes back to the county website, if you still got it there, Kevin, and you can go to the, well, anyway, I think it's under government in the budget site. The last year that's listed on the table is 2017. Yeah, government, then budget, yeah, it's the first one. Take you right to it. There you go, 2017. People have asked me about that. I said, well, if you go down, it's in the financial documents, the ordinances and the budget summaries in there. But I think we should update that.
Okay.
And if we can't update it, to take it off.
Okay.
Because I think that confused, why you only got 2017, it's 4 years later, so.
Mhm.
Yeah, because we have that information, we have that information available for the tax bill.
I can't imagine that would be hard to change, but it just it confuses people when they see it.
Yeah.
But if they go down into the financial documents, the information is in there. The budget summaries and the budget ordinances and all that stuff, but it's just, they don't see that. First thing they see is that table.
Well, I mean, that doesn't look good that we still got 2017 up there when we've had 2 or 3 or 4 other years that
Yeah, it's
transpired.
better to have nothing than to have something.
Right, that's why I said, if you
Updated.
can't update it, just take it off. But
Right.
Yeah, but that's something that we should be able to adjust. The next item probably should flip these, but hopefully this will be a fairly quick item. I have started conversations with Charles Nichols again about looking at transferring the Scotland County Water District, the assets, well, with a conversation with our bond attorney, conversations with the county attorney, the city attorney, USDA. If we cannot just transfer the water districts over, but we can set up, if we do a capital lease of the assets of the water system to the city of Laurinburg, that does not interfere with the bond debt that we're holding, would not require bondholder action. USDA does not, I contacted them, they do not have any claim or any interest in our water system. So if we did a long-term capital lease to the city of Laurinburg for the duration of the bonds, They could operate it, and at that point in time, they should be able to consolidate the entire county the water system into a single water system under their permit. Talking with the state, they don't care who actually owns it. They want to know who has control of it. Now, with that, the city of Laurinburg would have to go to the LGC to get approval of a long-term capital lease because it's over $500,000. Basically, we'd draw up a lease document with the city of Laurinburg, and they would make semi-annual payments to us that equal our bond payment for the next 25 years. At the end of the lease, they would have a bargain purchase option to buy the water system for a de minimis amount.
Would they ever opt to buy, you think?
Yes,
Really?
because basically it creates the system, but basically the purchase option would be after we pay off the bonds.
Hmm.
And once we pay off the bonds, at that point in time, we could sell them the entire water system for $100.
And the bonds there's 25 years.
It may be
I think that's
23 now,
20
but
Okay.
it's
Yeah,
approximately,
it's 20.
Over 20, okay.
yes.
Do you
No one in this room is going to be paying attention at that point in time, but
Well, BJ Long.
I'll still be, no, I'll still be vibrant. Yeah.
I'll be close to retirement by then.
Yeah.
Yeah, you may not be sitting
I'll
here,
still
but
be
you'll
looking.
sitting up and waiting.
BJ will be in Washington DC.
Oh, aren't you kind?
Hey, BJ, what they trying to tell you?
Jason will still be here.
I can retire in 6 years.
That don't mean you won't be here.
That's
That's
Well, I go back to my original problem with this. Why do we want to give this thing to the city so bad, other than just to save $150,000 a year? And it's not we don't lose money on it. And number one, that's a concern that we would want to do that. Number two, as a city resident, I'm concerned that they would want to take the thing. So.
Yeah, I think, go ahead, excuse me.
I mean, that's my concern. I don't understand either
What's driving
side
this?
of why we want to get rid of this just to save whatever that operating cost on that fee is, because Uncle Sam's gonna get wise of that. He's gonna fix that, and it's gonna be right back where it was. And I mean, if we were losing money on it or whatever, I mean, they operate it pretty much anyway now, right?
Yeah.
They bill it, they do the construction, or they keep it up. And I just don't see the need to do it, to get rid of it. I mean, and stepping out of the county issue back over to my city issue is, why in the devil do we want it?
Well, that was the question I was gonna say. What is the advantage to the city for them taking it over? Revenues?
Control.
revenue. You have long-term, some of the advantages for it is we can go off and we can create ultimately a single water district in the county. So at that point in time, future development would be easier to adapt to. Also, right now, we're coming $200,000. It's profitable, so basically we're asking the people who are on the system to pay $200,000 that we're paying to engineers out of the county. Versus we can do that versus, okay, at some point in time, we're gonna have to go up on the cost of water system because it's going to cost more 10 years from now than it costs now. So if the greater profitability we can build into the system, the longer we can absorb cost increases.
Kevin, how many employees do we have associated with this, if any?
None.
None. No employees associated with it.
But it is presently profitable for us.
Yes.
And our reason for wanting to get rid of it is,
Basically last, or 2 years ago, when the state broke it up from 2 systems to 5 systems, they just dumped $150,000 to $200,000 worth of costs. And it's all engineering costs and it's study costs. None of it impacts the safety of the water.
But maybe that's something we should take up on a state legislative level, maybe to look at that, but I just don't get it in going back to the county role in looking out for the citizens of the county. What makes me think the city of Laurinburg is gonna give 2 rats of a you-know-what for anybody up around Sneed Grove that has nothing, or pick your place, but, that they're gonna care about expanding the service or doing something particular. I just don't see why. I don't see why. You know, the $150,000 is one thing, but if we were losing money on it over hands over fist, we couldn't give it away. I guarantee you.
Right.
It's making money now, and you know, we have to adjust rates at some point. That's the natural course of doing business, but I just don't follow the reasoning of doing this.
If we transfer it to the city, does the city incur that additional cost of those?
No.
Why do they not? have-
Well, because at that point in time, the system is basically broken up by once it hits a master meter and it's under different control, well, then it's a different system because we're feeding off the city. We're connecting to the city system and to LMAs. So we have a master meter at each of those connection points. So every place where we're connected to the city, that becomes a system. And over here, we're connecting to the city for that part. So that becomes a system. And a couple of years ago, we transferred two small systems because they were going to break us up into 7. They were calling a system, but it was one neighborhood. Basically, we connected 12 houses. We just ran into a neighborhood connecting 12 houses. Well, in that system, we still had to draw 20 samples in a system that had 12 places, so we could not do it. So DEQ just said, okay, we'll just transfer or Diener just said, transfer that to the city and we're good. It was 10 houses. It made no financial impact one way or the other. But since we have this, we have to do all the testing 5 times what we were doing before.
So they tested on their side of the meter, and then we turn around and test it on our side of the meter.
Yes.
See, that sounds to me like a state legislation issue that needs to be addressed.
How long will that take?
Right, because we're not the only ones that's sitting in that boat, I promise you.
Who tests the water? You said we don't have an employee. Who tests the water?
We get the city of Laurinburg does the test, and actually they contracted out. They have a company that comes in, EnviroLink Services. They test the county systems. They test the city systems. They handle all the testing, the lab work, and everything.
That's what it sounds to me like. I'm sorry, but if that's the only issue here, this needs to be looked at from a legislation standpoint with Garland and Tom and say, look, and because it can't be just here, it's not here. Let's them take a look at it from a state standpoint and say, why are you testing on both sides?
And make it make sense.
Same water.
It's same water. The only difference is that meter sitting in between.
But how long will this take though? I mean,
I don't know.
But we're not losing anything.
But we're not losing
As long as it would
we're
take.
not losing anything, I agree.
So it doesn't, there's no urgency to it.
Well,
Duplication just won't make no sense.
Yeah, well, that's typical.
and
But
this,
government out bureaucracy, that's all it is. And somebody's pocket somewhere is getting padded.
Yep.
And I don't mean illegally, but by gaining that contract to have that done or whatever.
Yeah, that's
And I
waste of fun.
this regulation has been on the books for decades, but we went from a regulator who we knew who worked for us for years to somebody new and, oh no, here's the rules and okay, this is it.
Well, they have a boss. We can get to that person too. But,
Well, the boss who they have now is the boss who approved our system.
We still got a boss.
Yeah, and we reached out, but, and then also, if we do this, that also gives a greater possibility of creating, expanding out to looking at, bringing in, future steps, bringing in Laurinburg Maxton Airport. Bringing that under, a single control. Then you could also look at the possibility of Wagram and Gibson. So going, where I'm looking at it is because financially, it doesn't make as much of a difference. Other than, yes, it costs us 7% of our budget goes to testing that we don't need. But long-term, this is a step that could actually get us to having a true county-wide system.
Operated by the city.
It would be operated by the city. And frankly, they have the personnel that has the expertise
The infrastructure.
that can do it versus we have LMA who's, a small system, but is vital. Then you also have Gibson and Wagram. They just have small systems, and Gibson's is hanging on. And if you're consolidating, creating a better financial asset, the possibility of going in and into these weaker systems improves.
What water system does East Laurinburg use?
They're on the cities,
They're on the city.
their city.
Where does Wagram and Gibson get their water?
We have our own system,
Gibson buys from Laurinburg. Wagram has a well.
yeah.
Oh, Wagram.
Yeah, it's the only thing we got, that's about the only thing we got.
Because every time we have a hurricane, we have to send one of our generators there.
We have sad
All right,
Was this
what
something
you
you
Yeah, I
wanted
had
to
to,
take
yeah,
action
set
on?
up, but I'm saying that.
Was this
The one thing that you said that tends to make, may make sense, having to do with, tell me, having a one system, water system, the advantage to it is what again?
The big thing of it is going to be the possibility of if we can enhance future development. And as far as residential growth, unless we get a 60 to 100 housing unit development, we're probably not going to be in a position anytime in the foreseeable future to expand out additional residential.
But how do you know that ain't coming?
It might. And
But if you had that, either the current system or the new system would be able to
expand out of that.
Okay.
And that's all I'll say.
Yeah, but really it comes into, if you're looking for additional industrial growth, and if if we go off and bring some of these weaker systems in, and develop them, we'll be in a better position for our future industrial growth. Ultimately, my target is to consolidate the systems. So ultimately, my next step would be to strongly encourage the consolidation of LMA's water system into the program.
I don't think they'll ever get that, but I might be wrong.
Let me ask this, if we were to transfer our water system to City of Laurinburg, and industry come, like FCC, and they need millions of gallons of water, they would have to negotiate that with the city, we wouldn't have nothing to say about it, is that correct?
Yeah.
Correct.
Correct, but once you transfer.
We out of it.
them, baby, you out of it, all right?
Or if Wagram wants to tie their system into
Uh-huh.
the
And
system,
Maxton would be
Yeah.
involved in that conversation.
Wagram has to go to the city of
City of
Laurinburg
Laurinburg
and
instead of-
control their water. Or Gibson, or Laurel Hill, Laurel Hill.
Let's not give up control of our water.
I think,
Let's not
Kevin,
do that.
I think Kevin made a very good point about the growth and the possibilities. I like that. I like what he said. And I think it's advantage for us to give it, to let the city have it.
Well, and because with that right now, most of our industrial growth will either will be in the Laurel Hill industrial area, which is already served by Laurinburg, or at the airport, which is served by Laurinburg Maxton. So if somebody comes in and wants to build a plant somewhere, chances are Mark's going to be involved, but we're going to bring one of them in as the utility provider. We're not going to be the utility provider there, most likely, unless we go off and bring somebody in at the Wagram site. That's the only location that we're going to be the utility provider.
Lumber Max didn't give up that water. I don't think unless
No.
they would be crazy to do that. That is that's their income. But I mean, I just don't, right now, it doesn't make sense. But
How old is their whole system? Their system
But Max,
50 or 60 years old?
yes,
LMA,
Yeah, I can imagine it would be
it's an
old
old
back.
system. They've had improvements, but they still need.
Can they afford to upgrade it? I mean, that depends.
I'm not aware that they have any plans to do significant upgrades.
what about the water fund that's there now? We just got that the other month, and
Mhm.
I want to say $1 million, $1.2 million, $1.3 million was in that. Top of your head.
It was about $1.2 million.
What happens to that? Does that go to the city?
No. The legal entity of the water board would still exist, and at that point in time, the water board could do what it needed to with those funds.
No, I'm not saying do anything, but I'm just was wondering what that would be. I personally, I don't care for it. And that's from the county side or sitting as a city resident side. I don't know how the city council feels. They may also say, we don't want this.
but they're doing most of the work now, we
Well, they're
say.
doing all the work now,
Well-
but that can all, that you don't base the ownership of that based on who we contracted to do the work, because there's other companies that can contract to do that work if we needed it. But,
And we just lose our possibility.
right, we have absolutely no say in it.
And for me, if it was hurting us, I'd say, let's do it, but it's not hurting us.
You're making money, so I
Right.
don't need.
And we're not making a fortune, but we ain't losing money.
But if it were a situation where we were losing significant money on it, the city would not be interested in it.
Oh, of course.
But you gotta look at the financials on it, and the last financial on this thing, we depreciated it quite a bit.
Yes,
And you take that out, we're making a whole heck of a lot more money than what it looks like on black and white paper. Because once you take that depreciation out, then that's true money. But I mean, I'm not basing it on losing or making money. I mean, I'm just considering it as a break even right now. I don't see doing it, and losing the control over something, because as soon as this happens, something's gonna happen. We're gonna want to put something somewhere, and they're not gonna be willing to move the water out there, or they're gonna want us to pay. I don't see losing control of that right now. If somebody wants to.
It just seemed to me, if it ain't broke, don't fix it. I would just leave it personally. If there's no benefit for doing something, why do it?
well, when the state broke us up from 2 systems to 5, that has significantly changed the outcome, and this year was when we're starting to hit those real added costs.
Well, I
in
understand
that.
all that, but let's work it from I would say work it from our legislative angle first to try to get that fixed. Because we can't be the only one that's doing that problem as well.
No, the same person who came in and told us, he said, oh, yeah, don't worry, I'm doing this to several other districts
Yeah,
as
I
well.
guarantee you, there's probably hundreds of systems in this state that are suffering with this.
Are you wanting us to make a decision on this today?
Well, this is something, and again, the board's has said in the past that they were open to transferring the system to the city of Laurinburg. But I was going to bring it back up with Charles to start conversation again in earnest. And he wanted to make sure that the board was still open to that conversation. But if the board wants to go off and not make a decision right now, we can let him know that, you know, you're just not in a position to make the decision, or that you're in favor of or not in favor of.
Well, we don't have to make a decision
This week, the thing getting back more.
unless we want to pursue, we want to direct you to have a conversation with Charles.
Right.
I mean, there's no reason for you to have a conversation with Charles if this board does not
And not,
think
Full
that we
force
should
one.
make this transfer.
Well, I don't think we're fully in favor of it.
That's a good assessment. So there's no reason for Kevin to be having a conversation when the board does not have some level of favorability for this.
I think the conversation probably needs to be, as Tim just suggested, perhaps on a legislative end before we go pursuing, the city. Maybe see what we can do or what our legislators can do on our behalf.
I think the first step is anything being done legislatively. Lots of times things are being.
Already out there and we just don't know
And
it.
we don't
well, we
know
all
that.
got the email this week from Tom and Garland about, legislation that needs to be looked at before next week. So maybe that's topic one they always call me on Friday for some reason I say, look, here's what we need to do. And go from there. DATQ, you said is the one that manages that. And let them see what they may bring it up and 50 more legislatures say, hey, we have the same problem.
Mhm.
And so,
And it might be a federal thing where they can't, I don't know, but
So would we like for Kevin to communicate with our legislative delegation on the potential for this becoming something that can help us legislatively, or just get more information on a fact finding?
We can ask for their support, but yeah, it would have to change something that would change the regulatory
Right.
definition of a system and testing.
I just don't see each side of that meter having to.
That ain't gonna happen in the next 2 weeks.
Oh, no.
no, they don't know.
Because I have had this conversation with our legislators and with representatives from the governor's office and before.
And what kind of response or encouragement did you get from those?
That's a bad situation.
Yeah.
Yeah.
But
You have it after 12 o'clock. You don't want it.
yes, after 12.
Well, why don't we table this conversation,
I think that's what I'm hearing.
Madam Chair?
We don't need a motion to do that. We have just,
Chair it for when? I mean, you said we're gonna talk to our legislators, right? So we're gonna wait for a report to come back from that or see which way we're going before we have discussion again, right?
Yes,
Are we gonna keep on discussing and not get anywhere, right?
but I don't think we need any more discussion right now. I think we need to see if there's anything on the state level
And open the door for him.
that would change our, that would impact any decision that we make.
Well, are we going to leave it to individual commissioners to contact our legislative delegation? Which is fine with me. But I mean, I think we need something from Kevin to them. as to
Yeah,
what-
I think it would be best just for Kevin to send out something to, Pierce and McKinnis on the subject and see what kind of response you get from them, and we'll go from there.
Okay.
And I also think any commissioner is always free to contact their legislator about an issue that impacts the county.
But Kevin, you're gonna give us the information overall,
Yes.
and then we can reach out to them.
I mean, we always have the freedom to talk to our legislators about any issue that impacts
I
the county.
I assumed everybody got that email last week.
I don't, so, but anyway.
I thought he sent it to everybody.
I
That's why
didn't either.
forward it out.
You did or didn't?
I did not. I just checked my email to see, and I
yeah,
didn't see.
Okay, I
Have to
think-
add us on.
so are we clear on where lunch has
How
arrived?
long is it going, how long we have, I gotta go to the hospital to get some information about a test, so it's gonna take I may be a few minutes late coming back. At what time you giving us Carol for lunch?
Oh, thank you. 10 after 12, how
10.
much time do we need to eat?
You got the thing real hard.
45 minutes, come back and,
So 1 o'clock.
1 o'clock, yeah, 1 o'clock, yeah, that'd be 50, yeah. We'll come back together at 1.
I'm gonna talk to you sometime about the waiting situation. All that water drainage, your dad.
So we're recessed right now?
Right. We're at
This
recess.
present board, we got, just don't do anything, make the farmers just won't. I don't know, it just seems like they just don't.
This conference is no
I
longer
know,
being
I'm
recorded.
saying, for instance, drain, that $200,000 grant was a lot of money way back in that day. They got kind, I have called and called, it's that's impossible to do her. Probably was. They actually are pine trees growing in the drain, they wait on even comment about the drain, all the flood and things. They won't do anything, this is what we got hiding them, not. Only they collect taxes and water bill.
Just
But it's just a board like, you try to go there, as a citizen, talk to them. But nothing ever seen it done, and Commodore should know anything at all. I have, you know, he called, I got you. And it's no problem. If there's some interest in doing things, they're moving town, I don't know. But if you're looking for something, you know, old houses out there, dirt, I'm not saying they got the money to do everything, but we can do shit with grant things.
Are you sure? You all right?
I know, but it's not, it's, I said, it's not to get everything in this board. I'm having to run away with this to help, try to get the town, get the town on some kind of track with it.
Where's this?
They'll do it, I sign, my community, the stop sign is faded out, no stop. We can't do that for 6 months. So it is very sad, to see this decision waiting and then every. Well, I need to call you. I mean, people driving fast.
I think you're at the bottom of the bag.
There you go. I mean, it's not functional. And we got, the police has to kill it. You know, work. Even the people, the vendors in the town, that go on the stage all the time. We don't have body. We don't have a police to work, yet we pay these salaries. And it's their money that they gave the town away to put in his front budget. He doesn't do anything.
What's his name?
Lot,
If I could just add.
Yeah.
No,
And the people in the town say, no, but he's on home, he doesn't do anything. He doesn't come to work.
twice
Never
a month,
seen
twice
him
a month,
shed.
that black truck can come out and stop and go.
Who?
Police officer up there.
Oh, checkbook can't never find it.
No.
It's the way it was, it got sad police department.
I don't think 911 ever dispatches him. 911 just calls sheriff's.
They do, they just go straight to sheriff's department.
Maybe they gave us a dessert instead of a drink. Is that what all that is?
You know what I'm saying?
I think they got the wrong.
Oh,
Oh, here it
is.
That's dessert?
Coconut cake. And I
Coconut
got
cake.
5 beefs. There's coconut
That's
cake and a cheesecake.
I want coconut cake.
Well, that's 5 little tea cakes. What you gonna eat?
For you.
They're my string beans. You know what they was.
So you did order dessert.
But you got them.
Now,
Where is that right?
What do you want to try?
That's right. I guess. I got it.
Oh, we'll be all right.
Give me my, cake and I'm gonna.
Okay, it's right there. One is coconut and one's lemon cheesecake.
I don't want to think of that.
I may have to go get some food.
No, we do too.
You all around yet.
Well, that's a lot of soup.
Yeah, but you never tell me when. I'm ready anytime. Anytime you say ready, I'm ready. And I pay half of my fee.
Thank you.
I've got, I think there's a roll and some.
Okay.
I have a feeling I'm gonna be eating this for dinner too.
I didn't have a thyroid test done. And my doctor.
Ms. Carol, do you cook often?
And I try to give them information. They send me my and you send it out to my doctor.
I have during the pandemic.
Of course.
No,
Yeah,
nothing.
I know oftentimes for people, when it's just one person at home, it's,
it's awful.
yeah.
And I didn't cook when I had a husband. He cooked. And I was, yeah.
It's tough to cook this for one.
It is.
Ketchup with my fries.
Anybody got a ketchup? I'm sure there's a kitchen around here somewhere. John needs some
Yeah.
fries.
Some in the,
There was some in the drawer.
Got any ketchup around here?
if not, I think I'll keep some in breakfast.
I don't know. Go check and see real quick.
Let me go see if I can find some in breakfast.
You follow what I.
Yeah. Isn't that the free trade zone or something out there now?
Or it's going to be. I
Yeah.
don't know if they got the designation,
Extremely interested in that.
I don't think they've gotten it yet.
but the airport expansion, you know, runway expansion is moving on. I know he's made a lot of promises to the TGA companies that are coming to Moore County for their R&D to be done out there.
Well, I think he rightly sees it as a very valuable resource for us.
But to do it, they got to have that roadway expansion.
Didn't they get $8 million for that, or?
They already got money, but that and new terminal.
You're welcome.
Mr. Johnson,
Yes, sir.
I think Milton better look out. Miss Betty's.
She's already been up there once about that, you know.
Oh.
Did you know that?
She told me.
What you want?
Stop sign.
She wants them to clear up the drainage issues they've got in the outlying communities.
And it's bad.
Who else has got all the calls about the trash here lately? I know I
I have. And it's bad. 401 is awful.
The worst I've seen is Burke Ridge Road.
Oh, yeah.
And I'll remind y'all again, we're still live on.
You can't hear us, right? You,
Well, on there, but not on YouTube.
Oh.
There's no, only thing I can do is stop it. They don't give you a choice of mute and
all they need to do.
Thank you for the reminder.
I just thought I'd let you know.
I'm not, I can tell you. We got it on there.
I was gonna say, there's two people right now, according to what I was thinking.
You mean the emails? Tim, you talking about the emails about the litter?
Yeah, and I got a couple comments.
I got a couple Facebook messages too.
There's two. Oh, come on now. There's still two people on there.
Yeah.
But I think the weather has a lot to do with it.
Mm-hmm.
Just washing it up into one spot and making, you know. I saw the sheriff had some people out yesterday working on it.
Has the media been listening, do you know?
They might be on the YouTube because there's two people on there watching.
I don't know. I see Chavis. and one person on the phone.
Cheeseburger with no cheese.
What?
A cheeseburger with no cheese. I wonder, do I have COVID? My taste buds. But upon further inspection, no cheese. It's all right.
You know, we have to get some extra staff for Friday. No?
Well, we have the health department, plus we have the schools.
So the schools is providing manpower to
Yeah,
them.
all of their nurses are gonna be there. They're having other staff there.
Okay, good.
Public buildings is gonna be involved, EMS is involved.
Mhm.
What time is that running on Friday?
Starting at 8 o'clock.
How many you trying to do?
We allocated for 500 doses. And the hospital gave us 300. But I think we are at about 320 appointments.
Do they have to pre-register or can they just show up?
They need to pre-register.
That's a small number compared.
Awesome.
That's scary.
Oh, good.
Walgreens must be doing a ton because all their appointments are booked.
I don't understand, but
Walgreens.
They're getting 100 doses per store of the, 313 of 351 stores in North Carolina get 100 doses.
I was told something, and I haven't read it, so if y'all know more than I do, if you had COVID, are you recommended to not get the vaccine and to wait a while? Do you know, Kevin?
They want you to
Have read anything
be-
about that?
14 days.
So many weeks after you,
Yeah.
they still want you to get it, not if you're still active.
You have to be outside the 14 days. You cannot have another vaccine
I knew
in
that.
the previous 2 weeks.
But I think I read that if you've had COVID, that you've already got antibodies in your system and that you needed to wait like 3 or 4 months or 6, I don't know.
I asked that question because I had it, and I
Yeah.
had the antibodies, but they told me if you were to get it, you wait like 2 weeks after your last,
Mhm.
after it's gone. So-
Symptoms, no
Yeah,
symptoms.
Right. I had that surgery last week. They tested me like they tested me 3 times before I went in the hospital.
Really?
Have you been having trouble with your gallbladder?
I'm having a pain in the morning. It's probably gonna still happen. Just when I get up. Pain, it's like you hit me in the back with a baseball bat. One time and that's it. I'm done.
Just that one.
That's it. Boom. I stand up, I'm done.
But every morning?
Every morning. So they started checking everything, and doing that. They found that the gallbladder, it was no gallstones, nothing, just said it ain't working. So that's
But
got
apparently that's not the issue.
that's got a big problem. They snatched it out and it ain't a problem.
Yeah, but
Other than looking like I've been shot with a shotgun, I can feel no difference.
Wow.
Nothing,
Good or bad?
good or bad. So I'll go back tomorrow to continue the quest.
That's why they call it practicing medicine.
That's right.
Well, that didn't work. Let's try something else.
Right. depends on what else it could be. I mean, they check me for kidney stones, everything.
Are you using Parks and Rec and Library Friday?
Not library.
Not library, okay.
May not need Parks and Recreation.
There's a Robinson County Health group across from the hospital that is starting giving the vaccine.
Get that cheese.
Where?
It's part of Robinson County Health, but it's across from Scotland Memorial.
This cake, they got coconut or cheesecake. Lemon cheesecake.
Yeah, that's.
Well, you didn't get one, you gotta have one. Got to be something.
Gotta be up there, so.
That was good.
Oh, that'll work. Consider a cat or dog meat without it.
Yeah, that's right.
They make it work.
They make it work.
Smarter than that. Jim, I guess they'll have our conference next year.
Well, they have it, they're just doing it all online. Oh. Ain't no way I can sit through that online. Better sit through it while I'm sitting there.
They're taking the first,
That's why I needed a year off from.
So the NACO conference.
I wouldn't go up there right now. Either.
yeah,
You
it's
say,
safe.
you get the code thing, I just wouldn't want to go up there. Period.
Atmosphere ain't right. They sure enough fighting up there now. Mean fighting.
We had some hot soup.
Somebody, when you come to the office, you go, they don't want to be.
No,
Just to talk about.
ain't no walking through that tunnel like you did, I guarantee.
Yes, sir. There's been some hospitals.
You get in there, it ain't nowhere to go.
PJ's, Herman Tyson, member of your church.
He is.
Oh,
Somebody told me that.
Mhm.
I just thought that they faking and where to go. This is bad, this is.
It's worth it.
Y'all ain't playing up here, y'all just.
They ain't doing nothing. They're not- None of them doing anything. but you.
I'm not aware of anything that
They used to hide it.
we have that requires a specific zoning for temporary or for rental of single family.
I tried to get out of Herman for a while.
That's the hardest thing in the world to do.
And this has been several months. Somebody said he admitted.
As long as it's single family,
Yeah, something going on with him.
there's no requirement.
Back in the fall, he had, he was probably one of the first cases of COVID. And it was really bad. He and his wife were sick for about 2 months.
This was probably in September, October.
Yeah, they were both really, really sick.
I was trying to get all these back from election stuff.
Mhm.
And I talked to him before, but he'd always been real responsive. And I had a conversation like this, I said, you know,
Put the commission on time.
maybe it was me, and I said, hey, some comment about
No, I've been able to get
not being get it.
it. Yeah, in fact, I'll tell you, they were so bad. His wife now did not have any asthmatic issues before, but does now. She's on a nebulizer and a few other things to help with her breathing
What he got,
still.
we don't know who killed his sister.
That's funny, some people tested positive, never had a
We
symptom.
can't say who did it.
I was that one.
Well, and that's something, that's probably
Me?
more.
And my three children all had it, but very mild symptoms.
We had a son, his wife and 2 kids had it. The wife and 2 kids
We killed him.
never knew they had anything.
Mm,
And the son
We hate it.
went to the hospital to leave him.
wow.
You kill me, you go to the message. Don't.
It affects everyone differently.
I don't know that I've heard anybody else who went hallucinate. We didn't, that's not what we thought. We didn't know what we were not in town. We were getting phone messages.
I gotta call David Wells. You wanna talk to him?
I wouldn't want to deprive you of the pleasure.
That's why you get the big bucks, woman. That's why you get the big bucks.
That's probably who's watching on YouTube. He's probably playing a live feed of us eating lunch
On the radio.
on the radio.
Did you leave me some?
No, I'm part of it.
Hello.
Yeah, it's 4 5. Good.
Well, we just call it our retreat, and we are still here, and we will probably be here till
Later.
3:00.
1:30.
I would 1:30.
Well, I can give you part of it now. I mean, we are, oh, okay. Okay. All right, I will do that when we're done. Okay. All right. Uh-huh. No.
We want to know.
Oh. ABC board meets on Monday, the first of the month before the commissioners meet.
Okay.
Yeah.
So does the still property.
And that's fine.
Well, they must be meeting earlier in the day.
They meet, I'm trying to remember, because Bob would always have been to the ABC board meeting when he came to the commissioners meeting. I don't know exactly the.
Because all three of those are retired, so they can be anytime you want to.
Yeah, so can you,
Okay.
I just thought I'd share that with you so you know it.
Kevin, this was a good choice of places to get food.
He made it.
It's good. Have you been there before?
I'd eaten the teriyaki bowl before, and it was good. This sandwich is delicious.
Mm-hmm.
And the soup is delicious too. so.
Teriyaki, that's what I had. It's good. I probably haven't eaten half of it.
Chicken teriyaki.
Weird.
Yes, sir.
I got to walk out to the car. What time did she say, 1:30?
1 o'clock.
We got 30 minutes. I good back.
He just wants to toss them over here. Jason.
They'll get them tonight.
I've never had the lemon meringue cheesecake. Is that what they call it?
That is called lemon cheesecake.
Mm,
You good?
it is.
They had 2 things, so I got 5 of each. We all have choice.
So we all have one over there?
Mhm.
What's the other?
Coconut cake, roast formal, you don't want.
Yeah, I like them both now, I'll do.
What time you finish?
You can join us right here whenever you want.
Okay.
If you choose to.
What would you propose the ending time?
Well, when we come back in, we just have a couple of things. Well, I got basically two things before we get into health insurance and that. We'll be finished by 3. If you need to run home.
Okay.
Go ahead.
I'll be right back. If
You got a couple of things before me, right? Okay.
Worry, we'll pick on you if you're late.
My virtual wife would appreciate me coming.
Mr. Gibson, I think I've had this conversation with you before. What was your mother's name?
Martha.
Miss Martha. I remember your mom. Have I told you that before?
What's that?
When Denise Riggins was over American Red Cross, I worked for her when I was in high school. And your mom used to bake cakes and bring them up here. I remember her making I don't want to say it was pound cake with cream cheese icing. Was the cake that she would always bring.
She was a Red Cross volunteer for over 50 years.
I thought so. Yeah, she was. It was Denise and Grace Long Russo.
Right.
Were the two who were kind of running it during that time. There was another young lady there, but it was through the program co-op, WIA at the high school.
Okay.
With Donna Fall.
Okay.
I worked with them during that time. And I remember your mom during that time.
She's been dead 15 years.
Oh, wow. Wow.
You were there, that was about the time you were there.
That's right. Yeah, that's about the same time.
Yeah, and she was 91.
I thought so. I thought she was.
And in the last month of that she lived, she worked a Red Cross Bloodmobile. She taught a Sunday school class and taught an evening Bible study.
So she wasn't really down sick before she left.
She was not. She about 3 years earlier, she'd gone to the hospital with diverticulitis. I don't even know what, I probably knew then what it was. And she was in the hospital for about a week. And that's really the only sickness she ever had.
Really?
Yeah. She fell in her bathroom. My sister called her every day and didn't get an answer. She went over there and found her in the bathroom about probably 3 or 4 o'clock in the afternoon. And they don't know whether they think she had a stroke, fell and hit her head.
Mm-hmm.
But she died about 6 o'clock the next morning.
Wow.
But by then I've got 2 sisters, and my 2 sisters and I and our spouses and our 6 children and their spouses and any grandchildren, everybody
Had a chance.
had a chance to be there. And she never regained consciousness.
But up until that moment, she was.
Oh, she was. Yeah.
Wow. That's a blessing.
Oh, absolutely. We I came back home 40 years ago, and sometime over those 40 years, we said to her, Mom, you got enough money that you could go to Social Village if you wanted to. And she said, yeah, I would really like that when I get a little bit older. And she was saying, well, actually about 85, we said, we've been saying this to her for 20 years. She ain't going.
It's over. Right?
It's over.
So she stayed in her own house.
She stayed in her own home, the house that we bought in the 1950s. And we sold it after my 2 sisters, one lives in Marlboro, one lives in Greensboro, and I had a house, and my wife and I talked about, Tammy and I talked about selling our house and moving into that house. It was on Van Street.
Okay.
And, but we just decided that's not what we wanted to do.
Right. Wow.
We still, and it would have been big enough for us, and now it probably would fit our size better than the current house does. I appreciate you saying that.
You start here and go there and then end up back,
Yeah, we bought, I was married, my previous wife, we bought the house that Tammy and I live in, and we had 2 sons, and we bought a house, 4-bedroom house, we turned one into an office, and 3 of the bedrooms, the office and the 2 boys' bedrooms were upstairs. So for us, we just don't use.
Don't even go upstairs.
We don't go upstairs.
Rick Singletary tells me that when I talk, I don't even know what upstairs looks like. At their age, we don't go up there. So the grandkids go up when they come over, but I can believe that to be so. But yeah, I was just sitting here thinking about your mom. Grace Long Russo. I know it's Grace Russo. That name always went together. Did you ever hear? I think they were at Scotia at one time. She and her husband.
I'm thinking she's deceased.
Wow.
And in fact, this conversation, Tammy and I just had this conversation this past weekend.
Wow.
And I don't, not sure why. I don't know what it was. We had an occasion to have contact with a fellow named Russo, and it's Leonard. That was Leonard's grandchild.
Oh, okay.
Not, Leonard and Grace
We're
were second marriages. So it was not, we had an occasion, his wife called Tammy about something and she asked if we know another Russo. She said, no, he was, I think he said he was Leonard and Grace's
Okay.
grandson. And
Is Leonard still alive?
Leonard still living, because we went online, because I was trying to think, I said, I kind of like what you said. I just haven't heard anything about Grace Long. She's too active
To just be
to
quiet?
just be quiet. And I think we looked it up and I'm gonna say 3 or 4 years. she died.
I kind of remember, I think in my mind that you said, I remember Denise emailing me and saying something that she was sick or something had happened or something.
And because we were trying to, and you made, I was trying to think of what Grace Long's daughter's name was. Because she worked for one of the banks. You probably know her, just don't know that she's
associate the two
Grace's.
together, yeah.
And I still haven't been able to think of her name. Because she worked at one of the, either Wachovia or BB&T, and
But now you told me you have completely retired.
I have. And
I saw the hesitation.
well, I've had a couple of, the bank has asked me if I would, one of the ladies at the bank down in Charleston, who's retiring and who I really enjoy, and she was talking to the local branch, and they were saying what the bank was saying, we're not going to do without her. And she said something. She said, "Oh, I really wish Whit were still around because he could fill in everything that I've been doing for you." And Kim Dennison said, "Well, why don't we ask him?" So they kind of asked. I don't want to go back to work full time.
Gotcha.
I'm
You're enjoying.
well, I retired 15 months ago, and I had a pretty serious health issue that came up, and I also had a knee replaced, and then about 4 months later, had a gallbladder issue that was really pretty severe, and then the pandemic. So I have not really enjoyed.
Oh, I can imagine.
The last
So you
15
really
months.
want some time to enjoy.
I want some time to. So, but there's a couple of other kind of part-time things that I've begun to explore,
Gotcha.
and I think I may,
Do that more so full time.
yeah, something. Even if it went to work at the bank, it would probably, in order to do them any good, it'd have to be at least 20 hours a week, and I don't know if it almost fails.
It's good to be in a position where you can make choices.
I'm very,
That's a blessing.
very, very fortunate. Like we came back to Laurinburg when my mother actually was a teacher in Lakeland. My mother and dad both grew up in the St. John Church community, and my dad was, mom and dad got married, and mama was a teacher. She taught home ec in Lakeland. And he was a highway patrolman. They moved to the Outer Banks. He was a motorcycle highway patrolman.
Oh, okay.
And then,
Wow, that was fancy back in those days.
my dad was born in 1910, so, but he joined, went in the Army in World War II. And stayed in the Army until 1960. And we came back to Laurinburg then. Whew, hot outside.
Is it?
Jacket on, yes. But this has always been home for us.
That's a bad problem, good problem, I guess, being hot.
The average age of the,
I'm gonna walk by y'all like the folk walk by Peter's shadow, you know, it was hills, so I'm gonna walk by you all. So I'm gonna do is walk by you.
AJ, my mom had 4 people in her 4 siblings. She had 3 siblings. My dad was one of 8 siblings. There were, I think, the total of 8 males and, I'm sorry, 2 males, whatever that other age was, 8 females.
Oh, I'm
The
out.
average age of the males when they died was about 49.
We'll start.
The average age
Start back.
of females
I just saw what you called.
over 91.
Okay.
Wow.
So I'm hoping I had here.
So you got some. Well, I think at the rate you're going, you must have.
I've long survived the male rate. So.
Now, is that what it was? In fact, both, every time I come to this building, I had a grandmother on my mom's side
It was here.
who was here. She was 108 years old when she passed.
I just got a text. People are listening to y'all.
Oh, yeah, I forgot about that.
Yeah.
I don't know what you said.
It's been good.
But,
Maybe somebody will remember Grace.
and every time I go down the hallway to Kevin's office, that's where she sat in the hallway every day. And then on my dad's side, which is the grandmother who raised me, there were 12 of them. And their average was about 92. In fact, her dad passed away at 99.
What was
Here,
Yeah.
the Rebels, Maggie Rebels.
I remember the name.
I used to love old lady. We'll let the nurses make her bed or anything she did.
Yes, I got halfway through. The cake is.
I had worked with a fellow in Greensboro, his name was Andy Meacham, and his great grandmother died in Anderson at 114, and the time she died, he was the oldest living person in America.
You still working with the bishop.
I wonder who was the oldest living citizen.
Well,
Of course, you know, my grandmother was a country. So that was that side, my grandmother's sister. My grandmother was a grocery sister.
Okay. I love his Kurt.
Yeah, I was over her house yesterday for the first time since you passed. It was breathtaking.
It was too many curious. At her birthday party, she did not have a hat on. I had never seen.
Without a
What am I missing there, Jason?
She loved the hats.
Is that something in our package
What a gracious lady.
that you got?
Oh, no, that's for their insurance.
How are you liking your first retreat?
They're having ethics training tomorrow.
It's good information.
It is, a lot of
It's a lot of information.
information.
it was just.
Not bad.
See, like, me and this Apple don't get
Some
along.
folk will walk.
School board retreats,
A lot of that has to do.
in my opinion, works because they're on Sunday evenings. We always get our retreats on Sunday evenings. So I would have to literally rush from church,
Sure, yeah.
you know, get there, because the church was actually in
Very,
session.
very.
We
Sunday
meet,
evenings when you're supposed to rest to get ready for the rest of
we
the
try to
day.
meet for one day about 8.
I didn't
It works
use
good.
I didn't use.
Until I
you know,
get you to say,
iPad,
I'm not coming on Sunday, and Jeff was like, I'm not either.
Yeah, I think that, I agree
Yeah,
with
my
that.
wife, her tablet is.
That's
a
family
fire
time.
Yeah.
Just remind me.
Those are pretty good now. And I've never really been.
We're on YouTube, we're not on the meeting.
Well, yeah.
Yeah, that reminder's good.
Desktop, not aware the laptop was not.
That's everybody about that.
I took it and stuck, plugged it in. And it popped up on the screen. Which that was the best I got.
send me something tomorrow.
But the other
Yeah,
one,
I've got it
I just
somewhere.
couldn't
It's
take that.
every,
Well, your grandfather out at
Yeah, because now,
Early
instead of
voting.
that, I think it's just a parking lot.
He may have come in. She worked great. Okay, so let's remember about that.
Yes.
I remember somebody out there.
And I remember we had conversations about it. Somebody told me that's all that whole day.
He was a.
Best thing I liked about that docking station is I had.
And, got her in there.
Yeah.
So I could have all put it together.
I figure, you know,
Now, when I was gonna take it, work it.
For
on
RCC,
laptop, I
yeah.
could see one thing at a time.
That's a little harder to get used to. I've had to do that myself.
What should I not tell them?
What is this? Now, if you just find Microsoft, and turn the air down, I'd be happy. Getting hot.
That,
They control over that.
that creates more
Thank you,
conversation.
So he had.
And just an update on it's in my 9,000 people in Scotland County.
And it's basically also managed care program like people have.
Here before.
Lay
They
home,
probably
update
put
the
it
meeting, and they want-
We got survey flags out.
Temperature don't bother me.
Hard
That, this probably the only time I can tell you in the last 30 years, I've been bothered.
It was cold. Probably when it's been so many
Your
to
update doesn't mean
affect
anything
that.
for June 30th.
Yeah.
Property tax collections on par with last year.
Property tax and sales, our revenue projections are right where we expected. A little bit positive.
Do you reckon?
We
My house in the mountains is supposed to close.
project, we plan to use fund balance.
If you know, you have some money in your trust account.
We are going to do that, but we're going to use.
Yeah.
So. our projection-
Well, I don't know.
Unfortunately,
Well, look at this, she's back.
yeah, the way I didn't
But it's in your house.
with
That's okay, we voted on a couple stuff and appointed you the head of it.
Oh, God.
All the stuff.
Always.
That's bad.
Don't worry about it, you'll get a letter.
Because I can't get the, here's my problem. Well, they will, but I've got some Facebook and all that, which is in our.
You didn't get a chance to read it for lunch?
Get all the stuff that I need. Yeah.
No,
But I mean.
I even think I would plan,
I'll say it like.
if I don't have time for food, I'm gonna.
You'll get dessert.
Back and down, you know. But
I know,
anyway.
that's
We always do it on TV anyway.
Yeah, they're not taking this down on YouTube all the time.
Oh, my God.
Could we do that? Could we do it on the 1st of April? First day of April?
I'll see what we want to say.
That will be out here by 2:30.
That's what you said.
Let me see.
You are gonna be out there, okay, I'm gonna bet on that.
We have to drive it to it. We funded it.
I
That's
agree.
right, that's
Yeah, we
right.
don't
You'll
go
work
for a couple more.
And Blues Farm.
3:30.
That road is right before we get to Expo on Blues Farm.
I'm sure we're all good now.
I don't know, I can't say that.
You go.
Yes, it's.
That's the best way to do it.
It's not.
We're too old to be sitting here struggling, trying to make ourselves.
It's after 1 o'clock.
We're right here.
Okay.
And it's a sacrifice for us right here.
I don't.
I'm waiting over here. I'm on the court.
They just remodeled in 2007. So, they let the chip get on with it.
That's what it is. Not, you know. But you know what I'm saying, that's what it is.
I had to get on, I sure will. Else up there. So,
That's why I ain't sitting here.
would not, we won't say the old, we did that. I didn't wait till. So, but I'm waiting on that. I
Yeah.
hope that ain't gonna happen. If it does, I'll let you know. But we'll try to shoot the first of April.
You got it.
First of all, I told you I would when I moved here. Second of all,
Well, I vote for it.
Yeah.
That's what you want.
but she,
I wanna do.
she wants just threes and paint.
Oh, that's right. That's right.
Other than that, I'm saying is exactly
Well, worse than our house.
I get in 560.
What it is about that, right? All right.
Okay,
It's that time, isn't it?
it is time to go forward. All right, up next is, I hope everybody had a good lunch.
It actually
Thank you,
was.
Jason.
You're welcome. Glad y'all enjoyed it.
It was nice, yes. Okay, now we're gonna hear about, what's going on with Capitol.
Okay, with capital, we're looking at, we're continuing our normal capital plan. Parks and Recreation will be looking at its parks master plan going forward also. But we will also be looking at probably in with next year, getting estimates on air conditioning, the weight room gym.
That'll make a lot of people happy.
We're also going to be looking, you know, we have our public safety vehicles on a plan. Law enforcement is still getting a set number of vehicles each year. The ambulances, we're not going to need an ambulance in this upcoming budget. We will need one in the following budget. But right now, we are going to need to look at our other vehicles that we have. As the average age is over 10 years on them. So, and just get into a cycle so that we can start replacing them before we have failures in there. And we've been waiting on the library roof. We've had issues and we've had maintenance on it. And there've been some design issues in there. but it's also reaching the end of its life. So either in this year or next year, we'll be looking at replacing that. Also, right now, our phone and voicemail systems have reached end of life. So, which means they're no longer being supported or by Cisco. So we're starting to look at alternatives there, but depending on exactly how things, it's functional. We're not having major issues with it right now, other than we have needed to add some additional licenses to it. But it's going to be difficult to acquire additional licenses going forward, or if we need to roll it over to a new server, we'll have, at that point in time, we'd have to upgrade the system. So, and those are our large ticket items.
Before you change that screen, the Wade facility air conditioning,
Mhm.
when are you talking about in this upcoming budget, or, because originally I know we kind of tied that together with Laurel Hill,
Yes,
but since Laurel Hill is not going to be completed until 2022 early, I would like to see Wagram's air conditioning in there if possible, and this is what,
yeah, and right now, I'm just putting it in next year. The board wanted to allocate funds and look at doing that in this year's, that's
what was
possible.
it, about 50 or 60?
It was that for the air conditioner.
I mean, that's all we're talking about though, right?
Yeah.
And
And I
Wade
don't
don't
know
offer
if
to pay anything for that because we gave them the recreation center, like the minute they could have released help pay for this system. Did they offer to pay for anything?
Have we asked them?
I mean,
I have not.
well, people have been complaining so long about the air conditioning there. They very well know it's a dire need for it.
But they may not know that we have a plan to install. So if we have that conversation, they may be willing to help.
Maybe we want nothing better but a try.
But they may.
To my knowledge, and correct me if I'm wrong, they don't make any contribution to the center, do they?
No.
In the beginning, weren't they supposed to pay the utilities?
We need to look at that because they're not gonna do anything if they're not made to do it. So we need to go back and look and see what the original contracts or information we put out there for that gymnasium, for that recreation center.
I think in the beginning, they were going,
Well, they do
it's
the
been a
grant.
long time, but they were gonna do the outside maintenance.
Right, yeah. Well, besides, I was Tim, if we can do it and get air conditioning in by summer,
That'd be good.
the citizens that use that facility, they will think we are heroes. I mean, I hear that a lot.
Well, it's a need.
But I agree with
It's a
that
need,
too.
and
Well, and it's something that can pay benefit now instead of,
waiting.
if you wait to put it into October,
Yeah.
it's no benefit till next year. So the next year,
So
Do you want us to vote on that or just direct you to pursue that?
And if this is where the board wants to go, what we'll do is we'll go ahead and, get public buildings to go off and do an assessment, find out if we need to do additional insulation in the building.
I thought they'd done all that.
I just don't recall right off.
Brian, Graham, aren't you here on the call?
It's at lunch.
He
Well,
was.
he
but I don't
was
know if
on.
he's on there now, but I swear I think all that was done and he had a number.
I know the number for the air conditioning was about 50,000.
Yeah.
And I just don't recall if that included any insulation or any other work that would need to be done. But that's something we can get
and bring back to us.
and we can get an assessment
We'll get
done
that by Monday night.
and then do a scope of work.
Well, do they,
It
Well, I'm
depends
talking
on
about
if
if he's got it, we can have the
If
whatever by Monday.
if it's
Yeah.
not, we can get it done and vote on it at our April
April,
meeting and
yeah,
still
yeah.
have it done by summer.
Yeah.
Okay.
Yeah, we can go off and we can go ahead and develop a scope of work for the project and bring that back to the board for consideration by the April meeting.
Okay.
Something tells me that the proposal he had would call everything, what it needed, if it was installation or whatever needed to be done. He had an all-inclusive number, but just don't quote me on that. For some reason, I thought he did, because he got it together for the Laurel Hill Center. thing, because we were kind of combining at the time.
I think you're right, because
That does sound vaguely familiar to me, but I
Yeah.
can't say for sure. Okay.
what, Calvin, do we have the school capital outlay funds up there on that too?
Right now, just probably anticipate continuing the 300,000 capital plus allocation of restricted revenues, restricted sales tax.
That's all, what we've been doing, and
Yes.
we don't have any choice about it.
Yeah, I've not put any recommended changes
Well,
for the schools.
one of the thoughts, and the 300,000, we've been giving that to the schools for a number of years. And I know at times that may not have been adequate, but now they're maintaining fewer facilities and several of them are
Brand new.
brand new.
Yes.
So I don't know whether their need is as great as it was 5 years ago.
And that was one of the things that we discussed in the, with this replacement plan. Because with the savings that were in there, because in the projections, we did the savings, but then also had David Cheatwood put in an additional $500,000 as an additional cushion in the savings, and then looking at the savings compared to debt service. And part of that goal was to make sure that we could potentially build in an additional area where the school system could actually have additional funds that it could allocate around to other capital needs, IT replacements, things like that. So with this, really this year, the savings could be there, and next year, because now that South Johnson is open, and especially when they can dispose of, I guess, the three schools that they have, that they've closed, that they are still maintaining title to.
So a quick answer, nothing has been settled on North yet.
No.
No.
They lost it, right? My understanding, they
It
lost
what?
the guy.
They
They
lost
lost the guy that was going to have it.
How did Magic do that?
He pulled out of it.
Well, I was listening to their COW meeting, and I think there may be, they're having some conversation with him.
Maybe he'll come back.
Mhm.
Oh, I just got a text from Parks and Rec, Kevin Hurt, or Brian Hurst. And it is 50,000 all in, and he'll get that to you to bring it back Monday night.
Well, good.
Yeah.
Okay, great.
So we'll have it.
Fast.
And then from that, we'll develop a scope of work and go out and bid out the project.
Yeah, I don't know who that quote's from, so.
Yeah.
I mean, if we know we're gonna do it, we don't need to wait till July. Okay. Well, that's one of the shortest capital needs that I've ever seen since I've been on the board.
You just put
Because
the
I've
curse-
seen
you
some
just put the
big
curse
ticket
on it.
items.
You know, you just put the curse on it.
Well, put it this way, hopefully that unit that we want is not on back order for construction.
Well, that's true too.
Yeah.
So,
They can borrow one from Vistaville.
I mean, talking about,
Five
I mean, we used to be talking about the capital needs of the schools, and then we were building this building and the parking lot, and that's what I.
The air conditioning.
and
This should
when
be
we
a
go
good
into
school.
it, we are gonna start looking, probably next year, we are gonna need to go off and do maintenance in some of the parking
I
lots.
thought.
And some of what now?
Parking lots, for the annex and, the courthouse. Now, the courthouse, does not need to be replaced. It will need to be sealed and striped. You know, but, so there will be some maintenance, that we'll need to do. If not in this upcoming budget, but next year's budget. But I think we're good on the complete resurfacing of, the complete renovation of parking lots for a little while, but we will have maintenance on those.
What's the status of the roof of the courthouse?
That was replaced in around 2006, approximately. And when we need to replace that roof will come in at over $1 million.
That's
It was.
$1 million. That roof cost us $900,000 in 2006.
Yeah, it still leaks.
I need to go by and look at that roof again. There must be a lot of roof that I'm not aware of.
There's a lot of roof, actually, there's not a roof up there. There are a dozen roofs up there.
It's all
And,
the add-on.
yeah, and and the design was poor,
Terrible.
yes.
It's leaked since
We
it
spent
was.
more money in that
Yes.
building. We
Does
could
it still
build a new
leak?
one.
Yes,
Well, and
Does it still leak?
in places.
You'd have thought whoever clerk was at the time.
Much pull as he had.
Yes.
Well, I think when we did it in 80, when they re-roofed it all, it,
You were there when they put the front.
So this is probably a separate conversation, but I want to ask while we're talking about the courthouse, with the register of deeds and the tax office moving in that vacant, what is the plan, the big plan?
Yeah, that's a good question.
What was the tax office is now the jury assembly area.
Okay,
So that is for jury assembly, and they can use it for temporary court space, dependent. What was the register of deeds office is currently being transitioned to additional office space for the sheriff's office. The goal will be to go in there, or the current plan, go in there and actually start utilizing that vault potentially for additional evidence storage and giving them probably their civil office, that front part of that office space. So that was the last discussion. And that was held primarily with Judge Futrell, with DA's office, public defender's office, and they all agreed to that need and benefit.
Do you think that'll change since we have a new court judge and we're in a different judicial district with different DAs?
I wouldn't think the change in DA will.
Okay.
You've already been talking with those folks anyway, haven't you?
Yes. Well, we've had conversations
Judge
with
Futrell.
them about the renovations that we've done in the main courtroom and the jury assembly office.
Who's the judge?
Futural.
Yeah, I've been talking with Judge Futrell about it the entire time, but the new DA, I've only had one or two conversations with.
His name's Saunders.
I think they're pretty close.
Yes.
Of the two of them.
Yes.
Who's the new DA?
Reese Saunders,
From where?
Rockingham.
From Rockingham. Ray Saunders?
Reese, R-E-E-C.
Ray Saunders. Okay.
So,
And Futrell's from Rockingham.
Mhm.
Yeah, okay. Good question. Okay.
so with that, the inside of the courtroom, the only problem we have with the inside of the courthouse is keeping water out. And keeping it conditioned.
And keeping it cool in the summertime.
Yes.
I mean, I know that's a major issue.
I know you're using those rooms right now as your COVID overflow that Reverend
Yes.
Gibson was asking about it. Have they got any sort of a handle on how much longer that's gonna last or?
COVID overflow?
COVID, for people, the additional people that will not fit into the courtroom because you went from a X number of capacity to about 16 or 18
Okay.
people that can be in the
Gotcha.
office now. And so the folks that aren't able to get in there initially are the overflow, and they're being seated
Wait,
socially distancing in the register of deeds. And I think some of the tax office too want to.
No, they're going primarily in the tax office, but they did have something that they put people in the register of deeds office.
I think they had a grand jury down there.
When they were seating the grand jury, they split the pool up.
Yeah.
And they limited the number of people who could come in at a point in time, and they did all that. But for right now, hopefully some of the issues will be eased up by July when they need to reseat the grand jury again. Because that will be the next large issue. But yes, if we have to have a jury, if we have a jury trial, and speaking with the DA's office and the judge, there are some cases that either in March or April that they would like to actually, that could easily potentially turn into a jury trial. if you go in there, the audience, when you walk in the right side of the audience, that would be the jury pool. And I think we can get 12 people on the entire right side of the stand, so.
That'd be on a good day.
Yeah, because for every, now we remove some of the benches totally, but thereafter, with 2 benches, you get to seat 3 people. So, that is complete. And they have a situation so that they could actually do more, distance courtroom. If you're in the jury assembly, the now jury assembly room, you can see what's going on in the courtroom. You can see and hear. So that's set up, and they can also do remote participation as well for court personnel.
I just thought of something, Kevin, and I know that we had discussed it when we were still meeting over at the EOC, and then you and I had a conversation about when we go back to meeting over there, and you had done some preliminary work on creating a better acoustical system for hearing. Can you share that information that you shared with me a couple months ago?
Yes, and I need to remind them that because we were slated to have that work done in March, but I need to push that back till April. When you're going into the EOC, when you walk into the primary door where we come into the room, we would actually go off and we're looking to replace the speakers, getting 12 new speakers, replace the soundboard, and add in a camera, which when you walk in will be ceiling mounted in the left-hand corner. So opposite of where we normally sit. And that will be designed so it can capture the entire room or have a couple of select areas that it zooms into. And then have it where we can actually plug directly into the soundboard, plug a computer directly into the soundboard with microphones, video, so that we can live stream through this as well as live stream on YouTube. And we would use the existing microphones that we had because they're still functioning, but the soundboard would be replaced, new cabling. And again, like I said, adding in a camera that can capture the entire room.
And is that gonna be set up as our permanent board chambers? And I ask that because I've been asked by a million people. The school board has a nice meeting area, city council has an amazingly nice, and then we are cooped up in this room.
Right.
So is that?
You mean
that's the
this
plan?
room?
In this room.
Yes, that has been the board's meeting space. But for the last couple of months, we've been using this space because we've been using the EOC for COVID clinic, and it's been set up there.
You talking about EMS, you talking about emergency.
The EOC
room.
place where he's talking about putting this.
But you talking about, you asking a question about our regular meeting place, right?
Yes, ma'am.
Not this place, you talking about the meeting, you were talking about the meeting. Did you understand that, Kelvin?
Yes, and once we are not doing the COVID clinic in the EOC, the commissioners will go back to that location.
But he's saying with appearance, is that the only plan we have? Would that be permanent? Or we not gonna ever get a nice looking place like the city got and the school got, but we will be going, there's no future plans to do anything any different. They prepare us in that building, make that building better, right? Is that what you're saying?
We're making that space so we have better communication, better sound, better visual.
What about better looks? There's no way to fix it.
Not.
The place, you know.
Well, I go back to a year ago and I had talked with 3 or 4 of the city council members and they offered their facility to us. Would be glad if we used it. And I'm sure we'd probably be gladder if we even paid them a little fee with it to help them maintain it and the lights and all. But about that time is when COVID hit and we just kind of, we were, nobody wanted to go anywhere.
And then we also had the conversation about making our facility, enhancing it visually and audio.
Right.
So that people, because when you're sitting in there, I mean, if the audio and the visual is improved, then the people that will begin to attend the meetings going forward, they will have a very nice experience sitting in that room. Yeah.
But Carol, it's just not, it doesn't, we are the top, well, we are one of the, I won't say most important, but one of the top boards of the county. And our facility is just don't look as good as the other areas of the school board and the city government. There's no way for us to make it look that way because that is a working place. All that has been moved out and people have to go to work. So it's no way to ever have it really looking pretty, I mean, not
Permanent.
professional looking.
You talking about with the lecture room?
Yeah, all that fancy stuff.
I mean,
It's
we
not,
can work on furniture. I mean,
Well, the problem with that was, I think, was my question, where would you keep it? And then every time you got to have a meeting, you got to have somebody go in and put it together, and et cetera, et cetera.
and every
et cetera.
time you meet at the A.B. Gibson Center or at the city, then the staff has to, just like when we meet at Scotland Place, it is a heroic act to bring everything together for us to meet in another location.
Is there a reason though that we're not that we don't have the same style set up somewhere for us that these other boards have? I mean, I don't know.
we had it in the past before we gave it to Health and Social Service, right?
Yeah.
We had our own board place for assembly. It was really nice.
Where was it at?
And we gave it to Health Department and
Oh,
Social
okay.
Service.
The DSS waiting room
Used-
was,
the
used to be
commission.
there,
Oh,
and
okay.
it was modified.
Wow.
I think we're all, I mean, I'm just in a different place from where you are, Betty. We just see things differently.
Yes, we did.
I don't know that we need, I don't, I'm not as interested, I guess, or willing to invest a lot in creating some type of space other than what we have, as long as people can hear and see. And they're comfortable and they have lights outside the park and we can accommodate 100 people that want to come to the meeting.
But Carol, I had those same concerns when you brought the idea up of, leaving A.B. Gibson, I had those same concerns. And it's fine with me, but one person did ask me about it and why didn't we have a place that looked like, and so, that's why the subject was brought up.
The A.B. Gibson wasn't our place.
I know it wasn't our place, but, we just thought that, the person thought that, the county commission should have the best looking place there.
But I'm glad we're gonna have it so people can hear and see, so.
Okay, well, I guess we've done everything we can then.
Well, I still think it's a conversation worth having to do something more stable and more permanent.
That may come a building where we can do that in.
Well, let me throw this out there, and you're talking about the 911 center on the end after where we meet now. 3 walls is all you would have to build with a roof and a concrete slab right there, whatever size you wanted, and then run it off to electrical, you got to run air conditioning. But couldn't be that bad to put it right there. Then you don't have to find a place. You only got to build 3 or 4 walls. I'm just throwing that at you.
And in the meantime, it would seem to me, if we put a 12-inch platform, maybe 8 feet across it, where we would be sitting up higher than the people, and get some tables that look
Nice.
Yeah.
Look like
that would
professional
suffice
look.
until what Tim is saying would happen. But when we're sitting at the same level of the people in the back
Can't see
will
you.
ask you a question, and, a couple of times I had to stand up, because the person that would ask the question, I'm sitting over there 5 feet tall, and they can't see. And they can't see you, so that's unprofessional. And then the acoustics, like I said, we all know.
Yeah. Well, if we can raise the level
We need to
of,
fix that quick.
I mean, it's a one night a month meeting.
That's the most
So let's
important.
keep
night
it
the
in
county.
perspective of what we're trying to achieve. I didn't mean for us to go down this tangent. I thought everybody would be interested in knowing that Kevin had pursued improving the audio and the visual of that meeting space because we had specifically asked him to do that.
Well, I had actually put it on my notes to bring up anyway, so, I mean, it was not a pointless conversation.
But we didn't have our own space. And so, and we oftentimes got booted out of the A.B. Gibson Center if the schools had to use it We had to go find someplace else to meet, so. anyway.
I'm done with it, but I just think we need our own space. I really do. That's nice,
We can always
professional.
ask
We
Kevin
got
to
our
talk
own
to
space,
Charles
but you
about
mean our own
using the city
professional
facilities and rent it from them, or, I mean, surely they would want to do it for free, but, I mean, they were all for that, I mean, because now they've got that big building that they're used one time a month, and they don't need it the same time we do, and I thought it was a good offer at the time, but we dropped it because of COVID started.
Yeah.
But, and their facility's already wired, the sound, everything is already in there, so. but-
I've never seen it. Have you seen it, John?
I haven't been in it.
Oh, it's beautiful.
Oh, yeah. it's
I was in it at one of the candidates forums, and it is very nice and very functional. Not a lot of seating space for the public.
Public.
I really,
Yeah, I really hadn't thought about that until, I don't,
But with their system that they have sound and they can see the presentations up on it, and they actually have somebody in there operating the camera. So if you're talking, they're looking at you. You know, they're not looking 30 feet away back here. They look at you, but the sound is excellent in it. I just thought it was a nice offer, even if it cost us something.
and I would rather see us consider something like that, going back to one of those places than building a room at,
Yeah.
you know, at EOC just for us that we're gonna use
Well, it
15
helps
times a
them,
year.
helps them qualify building. When people question that, why did you build this? Well, county uses it also, and we make a little money from that.
Yeah, and I'm okay with that. I'm personally not, I don't think this is really what we need as a local board meeting.
It looks temporary no matter what we do.
That's right.
But if y'all want to ask Kevin to have that conversation with Charles before their meeting this month, well, I guess they've already had it this month.
It would be the March.
That's up to y'all.
Yeah, I mean,
We dropped it last year because the COVID came up and that everything went out the window then. But, you were there when we had the conversation
Yeah.
at the Christmas parade.
And I think it would be wise now for us to make a decision. And I'm certainly for, partner with the city to use their facility. Because, we can do better than this and better than that. All we have to do is do it.
without spending a whole lot of money to build something.
And my only reservation about the city would be, I need somebody to tell me how many people you can get in there.
mhm.
No.
Because our last meeting at the EOC was in March. And that's when we had the,
Second Amendment stuff.
what I call the firearm issue. And
But I think the city place would have held just as many, it would have been as crowded,
I
but.
mean, it was, and we had a good, I think the EFC can accommodate seating more people than either the A.B. Gibson Center or the city, is
I
what
don't know about that.
We just-
No.
Maybe gives a whole lot of people.
You can put a lot in it.
Yeah, that's
Well, that's, if you took the chairs all the way to the back wall, that's true. You can't put- Anyway, we have digressed. I just wanted Kevin to give us that information because we had asked him to pursue it and he has done it.
I think no matter what, continue with that because that, even if we end up not being there, it can be used for other things.
Right.
Yeah, that enhancement of that facility.
It's still a need.
Yeah,
Yeah.
and because we use that for a training facility for county, it is our EOC, so having that potential is of benefit one way or the other.
It won't be a waste of money.
No.
Right.
And, okay, looking at just some of the budgetary, because right now I don't know what next year's budget's gonna look like. Well, these are just a few things that I know we're gonna need to look into, address. Of course, don't have the February inflation numbers. They have modified the January to 1.3%. A 1% cost of living, adjusting the pay scale by 1% costs $195,000. That is salary and the variable fringe that goes along with it. So that's your retirement, social security, things like that. Right now, our health insurance renewal, our health insurance,
we're trending about 112% of premiums. But with the last renewal or we believe the League of Municipalities, who is our provider for health insurance, they cap renewals at 10%. So that's why I'm putting in a 10% renewal. It's just over $300,000. Our annual health insurance cost is over $3 million for the county portion.
So you said 3 million, we pay, the taxpayers of Scotland County pay $3 million
For health insurance,
for health insurance. And it goes up every single year then.
yes.
And now, is that the $300,000? Is that a part of that, what you just said?
That's how much I think is gonna, that's my guess as to how much it's gonna increase next year.
And 3 million, not 300,000. Didn't Betty say 300?
No, it's gonna increase by 300,000, you
Right.
say?
The increases.
The increase is 300,000 on a $3 million.
Yeah, 3 million, right.
Yes,
Yeah.
That's big money, isn't it?
yes,
It's big money, yeah.
which is why we've been making changes in our health insurance plan for the last 10 years.
And the changes don't, translate into better coverage.
No, most of our employees do not see it that way.
Yeah.
Uh,
Which is self-insurable rates.
Beyond that, retirement system updates, we will receive notice from the retirement system next month on how much that insurance, our rate is going to increase. But that is going to go up. The rate that we have to contribute is going to go up. And it's going to go up on a regular basis. Now, the state backed off, but a number of years ago, but it came back. Right now, we're contributing 7-8% of an employee's salary into the retirement system. It's more for law enforcement officers. But the state and local, state plan, which would include educators, it's over 12% right now, I think. And at one point in time, the state said, well, our long-term goal is 12 to 15%. And with that, I think before we get to that point in time, and this is something that the retirement system board has had conversations about, but they don't want to have the conversations, but at some point in time, everybody's expecting that they're going to go from a defined benefit plan to a defined contribution plan. Which defined benefit is, of course, you're going to make a percentage of your salary, this percentage of your salary for the rest of your life, versus a defined contribution plan, which is basically a 401k. You contribute X dollars. That's how much your plan's worth. You're welcome. Which the private sector has done that already, has done that a decade ago.
Who did? Who
Who
did
did it a
this?
decade ago?
Private sectors. There are very few defined benefit plans.
I've been hearing about this. When does the state plan to do this?
They already did they took all the benefits January 1st. If you're a new hire after January 1st, you no longer get, the retirement or the lifetime insurance.
That's what I want to hear. That's what I want to hear. That's rough. I mean, that is something.
Yeah.
If you try to throw out your 401k plan out early, you mess up your whole life retirement.
And that's the state plan. So the question is, when is that going to be followed by the local government?
But it save us money, right? We won't have to pay that retirement money, will we?
It will be there. The big thing of it is the continuing costs would not go up as much. And what they're really trying to do is get rid of the unfunded liability. a defined benefit plan, your first day of work, a 25-year-old woman on their first day of work, you're here, you make this much money, you're automatically a $40,000 liability to me. Because, you know, I know how long you're gonna live, I'm assuming you're gonna make this, and so as you go on, it continues on. And I don't recommend this, but if you ever really want to have a migraine, read read the notes on our audit report, especially when it's talking about the UAAL. That's the unfunded actuarial accrued liability, which is our pension plan. And you will see we have $1.5 million of liability in that, because someone who, I'll pick on Susan because she's been here a while, so there's a part of the pension that she has, we're gonna, you know, is going to reflect back to us. So in that plan, they're assuming right now, she is a liability to the county for $200,000 or for, or whatever that number is. Because we have the pension plan, we're gonna have health insurance, we have retirement, life insurance, all those other costs. We have to know we calculate what those are while you're still employed.
And so when we hire new employees, we gotta think about, not only you hiring a new employee for, what, $45,000 a year, say, all this other put together, it may be $60,000, $70,000 a year each time.
Which is why we've changed our retirement plans over the last number of years also.
And the health insurance.
Yeah, and health insurance, because Susan's retirement plan is a whole lot better, or her benefits are a whole lot better than Jason's.
Hers are probably like mine.
Yes.
But they can't be beat anywhere in the country, because I have talked to people about it. But it's over.
And it's been incremental because
Yes,
under
it has
state
been.
tort law,
Mhm.
whatever you're hired in, that's gonna be your benefit. So what we've done is like, all new hires after '04, even if you qualify for retiree benefits, it cuts off at 65 and you're on your own Medicare supplemental. If you hired on or before January 1, 2012, we, kind of titrated it down to where we will cover, depending on the years of service, we'll cover 50, 75, or 100%. But you have to be age 60 and have 25 years to get the full 100%.
But, and some of those, they're not necessarily going to impact this upcoming budget, other than our retirement system is going to cost us more next year. But long-term, you know, people always say, well, I will go work for the government because my benefits are better.
Those days are over.
Well, once your benefits aren't any better, hey, I can make $10 more an hour. I can make $10 more over here. I'm going over here.
In private sector.
So, yeah, so that's gonna cost a greater pressure on salaries in the future.
I mean, the North Carolina retirement system benefit package, up until they started whittling on it in the last few years, was a model in the envy of the rest of 49 states in this country.
And didn't that begin when the Gatsby rules changed?
Yes. Yeah, when you started having to book those, so that's why you hear of all these pension plans that are broke. They're not broke, but they just have huge unfunded liabilities.
In many counties, just as of this certain date, if, you know, all new hires after this date, they get no retiree benefits, period. They get now the retiree benefits.
Going to a straightforward 1K or a Roth
Yeah,
or whatever.
and that's it.
But you got a choice whether you should want that or not, right, as an employee, they can't make you do it, can you?
Like,
The 401K.
Yeah, it's voluntary.
Volunteer. So the person doesn't volunteer, they can work 30 years and have no retirement. That's good and bad. I
You
mean,
know,
you
when
know.
I said no retirement, what I'm talking about is like health insurance and life insurance and things like that. A lot of counties are stopping that.
Okay, okay, I see.
But also talking about health insurance. Well, let's go back. Well, back up the step plan, just doing our estimates, because right now, everyone, if you're in position, you're in position, in a permanent position, so you're not on probation, you would get a one-step increase, which is 2.5% every other year. So at year 3, year 5, year 7, you would get a step increase in salary. And that cost is $177,000 approximately. Then also looking at, assuming the Laurel Hill Community Center is open and available in April, we'd bring staff in before that and make sure they're up. So basically looking at increasing Parks and Recreation staff for 5 months, that would cost $40,000. And then, of course, the positions that you've added for foster care.
Is Parks and Rec just one position?
No, that's 2.5 positions.
2.5 positions.
Which is comparable to what we're doing at Wagram.
Okay.
Did you say foster care or Parks and Rec?
Both, you said.
Parks and Rec.
Is the 2.5.
No,
2.5.
Well, then does that count the half, you know, the guy died, and we replaced him that was under there?
We have not replaced him.
So that's the half.
That would be half.
part-time.
Oh, that's, okay, so that's an existing position.
We were counting,
Yeah.
like Wagram, they have 2 full-time and 1 half-time receptionist, that's what we have done.
That was me. What's his name for the law?
Michael Alford.
Do we pay for Wagram to employees? I thought that they were under some other kind of plan. Do we pay for Wagram employees?
The Wagram Recreation Center are
We pay
our.
for two.
Now going back, talking about health insurance, of course, several years ago, we did go back to, we are only offering new employees a high deductible health insurance plan. But we are maintaining, our existing employees at that point in time could maintain their PPO. 2 years ago, we changed it because the PPO is about $100 a month, or a little over $100 a month more expensive. For the difference, so we started charging back a portion of the difference as a buyout to the employees. 2019, we did 25%. Last year, we did 35% with the intent of bringing it back to the board for review. And looking at going to increasing that buy-up again. Right now, we have 53 of our 320 employees that are on health insurance. 53 are on the PPO plan. We have most of our retirees were already existing before we started this plan, so they were not charged a cost share. We've had 2 retire that were paying the cost share, so they're continuing paying the cost share. With that, if we look at continuing the trend, we look at 45% and 55% of the difference of next year and the year after, if we just look at it. With the projections of, well, we know we have the actual costs for last year and this year for the difference in between the PPO and the high deductible plan. And then we just did a 10% increase in those premiums for the next 2 years. And if we go to 45%, the monthly copay would be $89. And then the year after at 55%, The monthly buy-up would be $124. And that's something for, that's something for the board to consider for setting that policy.
What, we do this every 2 years, every 3 years, what?
We adapted this plan to be reviewed for this third year, yes. And we just did 45%, 55%, just as potential numbers. But if there's a goal that this board would be interested in charging for the buy-up, even if long-term you wanted to do 50% of the buy-up or 80% of the buy-up cost. If you had that goal, we can bring those in. But like I said, for next year, we'd be looking at continuing at that increase, going up to 45% buy-up, which would be $88 or about $89.
And that's just for the employee in their part for 1 month, right?
Yes.
That's dirt cheap. I mean, they're getting off, that's dirt cheap to them.
Yes. And with that, the county is paying the other $200 difference.
Right.
And this one, if there's any discussion, any questions y'all have, that's fine, and we can just, this can be considered, take action later. And there should be a letter explaining this in your packet as well.
So you want action by when if we don't do it today?
If you don't do it today, we'll probably have another retreat in April.
I'll go with the pleasure of the board.
Yeah, I'd like to digest this.
Yeah,
before we vote on it.
Okay.
Yeah, this is not a simple item, so.
Well, it's not final anyway, right? Because you don't know what the premium's. gonna be.
Correct.
Right.
It
This
may
is
be
our
5%.
first, this is our first look at it.
Right. And that brings to the next item for recruitment, selection, promotion policies. Now, with this,
Mr. Kevin,
yes, sir.
if I could, Madam Chairperson, before we leave the budgetary goals, I would like to offer a motion to the board about our staffing. Over the past, I've been here 16 years, and been here 16 years, and our staffing have not kept up with inflation. And I would like to offer a motion that it be adjusted by $60 monthly, just to keep the amount that we have been receiving, to keep it relevant to what it is right now. Because of inflation and the cost of living, it has gone down. The $500, $540 or $60, whatever that is, the purchasing power that have diminished over the past 10, 15 years. I've been on that board and we have not addressed it. And I'm not addressing this based on Rawson County. I know they receive $10,000 annually. That's not my business. I know Hope County received $250 every time they meet their chairman told me they meet minimum 3 times a month, but I'm not basing this on that. Don't care what they receive, you know, a lot of times we wanna say, what does the next county receive? That's none of my business. It's what I do, and I'm not asking to be paid. This amount is not a salary that we receive. It's just a thank you from the citizens of Scotland County. And I think we have been very appreciative of serving the folk. But the $500 has diminished tremendously, and so that would be my motion that our staff can be adjusted.
I'm gonna make sure I heard the final piece. You are motioning that the monthly stipend the commissioners receive be increased by $60 per
Yes.
month?
Per month, yes.
Is this in the new budget cycle?
That's right, the new budget coming up, that's why I want to mention it.
Starting in July.
Yes.
That's what I.
And that's the
motion.
only time you can adjust it.
Because, I guess for, I assume BJ, commissioners are paid, is it a 500 even? It's not, it's 500,
563.
563?
Yeah, a few years we have gotten the whatever the employees, if we were employees, a few years we received whatever increase that was. But the basic part has not been changed. And I just thought it's time.
Well, and that's assuming too that we're not included in this
Inflation.
living adjustment. So
Well,
We normally-
historically, it happened.
I know we have, but unless like last year when we said,
Right.
don't include us in it. So
So you made the motion?
Yes, my motion.
I second that motion.
do we need to do this since we're in a discussion now, or do we need to wait till we're doing the budget? Doesn't matter.
It doesn't matter. This will go in, your budget is set with the commissioner's salary is set when you pass the budget ordinance.
Okay.
So
this is just an instruction for it to be
Correct.
included in that budget.
yes.
Then I have one other thing. If we finish with that now?
No,
Well, we
Yeah,
got,
hold on.
we've got a motion, we've got a second, and I think the motion's pretty straightforward to increase the monthly stipend of commissioners an additional $60 per month.
Yeah.
Okay,
Before we vote, I'd like to ask a question.
and Betty has seconded. So now, anybody have any comments or discussion with?
How long has it been since it was raised to its current level?
It's been incrementally changed as the cost of living adjustments
Yeah.
have occurred.
You get
Except for last
adjustments
year.
through cost
The
of
base
living.
hasn't been changed. It's
But-
just been the-
Yeah, the base has not been changed
Has not
since
been
I've been
changed.
here.
Yeah.
I'm talking about the base.
And you've been in 14 years, so.
Yes.
But
That's
until,
what I'm talking about.
okay,
14 years with no.
You're only talking about $4,000 a year combined.
Yeah.
So it ain't like we're not breaking it down.
No, it's,
You gonna finish the motion?
the motion's been made and seconded, we're now having the discussion. We'd ask a question and it was answered, so is there any more comment, discussion from anybody?
Oh. I ain't gonna be hurt either way.
Okay.
No, no more comments.
Okay, I'll call for the vote. All those in favor say aye. Opposed?
hey,
I'm opposed, but it's a 1, 2, 3, 4 to 2 vote, so the motion has passed.
Then I have one other thing. I want y'all to help me understand this one. When the COVID money came down and we voted to give our employees, I don't know, $30,000, divide among them. The board made a decision that we not take it and then it be given, that amount be added to the kitty to give the employees, then we get more. And I have an issue, personal issue, with federal money. I'm different with county fund, but with federal money, if I choose not to receive it, that's my choice, if I'm eligible to receive it. And if I choose to give it to an entity of any sort, that's my privilege. But I don't think, as a commissioner, I should vote for you to do what I do. And that's what we did. We voted that the board wouldn't receive it, even though we were employees. I don't know how we did that. Maybe we just qualified ourselves as employees. You're either an employee or you're not. But then I'm saying we, I'm not saying you, then we directed it to go to a certain entity. And my question is, as individual commissioners, should we decide for another person where some federal money that he's eligible for based on our finding and tell that person to give it to somebody else? That just doesn't seem logical. Doesn't meet the logic that
You talking about the care money? Care.
the COVID money, and I'm not talking about the money so much as what we did, how we did it. I was sitting here and we voted not to receive it, and then that it be included, the amount that we would receive be included in the amount that other employees receive. And I'm saying, either we are an employee as commissioners or we're not. And for me not to receive it, it seemed that I would have to be disqualified as a county employee. We just did it. And I'm just thinking, well, okay, but it just doesn't seem the way we want to think. Because someone then may want to receive it and give it to X, Y, Z, while we're being told it all go here.
Other words, you're trying to say that everybody make their own choice.
Yeah, it didn't seem to be democratic. I'm done with that. I would like to see someone, because now, Biden may send us some more. We hope that in his bill, he may send us some more. And would we do the same thing? Just think about that.
I remember the vote, and I
I'm
remember.
not asking for a vote on this, just think.
Yeah,
She
but
said
I
she remembered.
voted to give in the first vote, the first responders received the $1,000, and that was recommended by the feds. And then we went with the hazard pay to county employees, and we voted that we would exempt the Board of Commissioners. And my memory is that it was a unanimous decision.
No, I voted.
I voted against.
I voted against
Did
it.
you? Okay.
But my point is,
Okay.
how does the board get to decide that? There seems to be some legalities in there that we might have missed.
In other words, one person decides that, hey, look, I don't think we should, we take this money from it, we should give it back to the county. And that person makes that decision, and no, we won't accept the money, we're gonna give it back to the county. And then I guess out of embarrassment, everybody's kind of go along with the vote. I think that's about how it was. You see what I mean?
Yeah, but I remember the vote, and I remember the conversation. So I don't know where we go from here on action that was taken a couple of months ago.
I don't think he's looking for action. I think he's just looking for explanation for the
Yeah.
future.
Yeah.
I mean, we had a conversation, we voted, the majority voted that commissioners would be exempt from the hazard pay,
But nobody asked the commissioner, they want to be exempt, that's the point.
but we all discussed it for a pretty good
Sat
while.
here and discussed for a while.
Yeah, we just,
They were discussing about exemption.
we weren't meeting in
No,
here.
we
were
just voted to do it.
We didn't discuss the exemption.
Well, we had a motion and we had a second and we talked about it. I mean, I remember that, and
What we talked about was just to give
my
it.
position
My
was that-
point is,
it was hazard pay, and I did not feel like, as a commissioner, that I had been exposed to hazardous workplace environment due to COVID.
but I
mean,
felt different. I felt like I had.
You had, right, and that was the difference. I mean, coming out to a meeting, yes, you're putting yourself at risk and you're putting yourself exposure to the pandemic. But Carol McCall, did not feel like I was in the same category as somebody sitting in the tax office or DSS or out here at the county administration. So, I mean, I understand your point in that, a decision was made when it could have been left to be an individual decision, and if you received it, you could just say, keep it, or I'm gonna give it to somebody else, or whatever.
Yeah, that's what he's trying.
So I don't know where we go from here on that.
I'm just saying,
issue.
when federal money is sent down to
It
the
was,
county,
it is
okay?
federal money, right?
And, I think we need to rethink, how the people gonna feel? Hold just a minute, you know, I got money, this is something that Uncle Sam is sending down to me, to us. And, how other people might feel, I feel differently than if you were talking about, you know, property tax money. I would feel different. But this is a different part of money.
Well, I think I understand what John's saying, and I've had some conversation with somebody, and it may have been John, since that vote, and I don't think he's asking us to do anything differently.
Right.
I think in the future, if we had that same issue to come up, I might suggest that we let it be up to the individual commissioner whether or not he.
Yeah, that's where I'm coming from.
I think that might be the motion I would make.
Yeah, that's the only thing.
But that wasn't the motion.
I know, no,
Right.
I think what John's doing are-
Previous vote. I'm fine with it.
Yeah.
But
And I
just think we
I
might have
understand
missed
that,
something.
you know, we as individuals can choose what we receive or what we don't.
Sure.
But the same thing with the stipend. I mean, we just voted to give commissioners an additional $60 a month stipend. I can say, I don't want it. Keep it.
Well, I think
They your choice if you don't want it.
I guess the question I
But
would
we have
ask is,
voted that commissioners will receive a $60 a month increase in stipend, and the majority carried that vote. So can I go back and say, don't give me mine? I don't know.
that's,
No, but you give it to the church.
I don't know.
I think that's what you're saying.
Yeah, that's what I'm saying. If you don't want it,
Go to finance first.
it's yours. You make a decision. I don't think the group should decide
Okay.
what you should do.
Understand, yeah, understand.
Mr. Johnston, do you have an opinion on this at all?
Well, the Commissioner often mentioned that to me at the break. I did not realize that it was, an issue that was a live issue because of the fact that the board had voted on it. I don't know if there's anything in that particular act that might cause you to treat the funds differently than you would any others, but I do believe that if the board votes in the fashion that you were suggested, that the board votes that way, then that does give the flexibility that Mr. Alford wanted. I haven't looked at the source of the funding, you know, the federal funds typically restrictions on them. I just haven't looked at that issue, but as Mr. Alford and I talked, I'd be happy to look at the funding if there is another funding act.
Well, it may be worth you looking at, and also, I think from an accounting standpoint, how difficult it would be for any one of us to choose not to get it. And then what happens when you finish your term? Does the person replace you? Have to make that same
Oh,
arrangement?
I'm sorry, I thought you were talking about you're talking about your stipend now.
I'm talking about either the stipend or the CARES Act.
He was
Well, I
talking
think the
about
stipend's probably controlled by state law. I think the funding for the COVID may have been controlled differently, but then even, it's a different set of rules, I think.
My thinking is this, the staffing or COVID money, as individual commissioners, we campaign and run as individuals. Then we should receive in the stipend as individuals. Then you do what you please with it. If it's your conviction that you might not want to receive this, it's a beautiful thing to make a public declaration or say it, that, I don't receive this, and I give it to this 501c3 or this nonprofit.
Well,
It's your money once you put it into your account, but then you can do with it. You can declare it, let the public know what you want to do with it and give it.
I'm trying to recall the details, but we once before ran into a little bit of an issue with something akin to that, where the board at one point chose to denominate X amount of dollars per commissioner, that commissioner could
Yeah.
disperse as he
I
or
remember
she
that.
chose, and don't want to get over into
That
that.
was grant, we were getting,
Yeah.
the grant was
Sometimes
given
give
to.
it to a department.
Yeah, and,
Hopefully that's-
but I'm talking about staff, and if the commissioner receives it, I received this $560. And if I choose to give it to, someone, then that would be a beautiful thing for me to put in the paper. It will show the people where my heart is, that's a great thing. But I should be doing it, you shouldn't be, legislating or voting me to do it or not to do it.
Right.
I should do it as an individual. That's where I'm coming from. You get more coverage and more respect if you do that as an individual.
John, we hear you, and,
Okay.
no, I do understand.
And I'm comfortable
Yeah, that's
either
fine.
way.
It's, if sometimes we make decisions in haste, we don't explore the full extent of what we're thinking at the time, and this may be an example of that, so, okay. All right, I think we're, Susan, are you ready?
Susan, I was on your time, wasn't I? I apologize.
That's fine, that's fine. I'll submit it anytime.
One thing, because we have, Susan has been working, or not just Susan, but we've been reviewing our personnel policy. And one of the things is to go off and looking at with our personnel policy, making sure that we're substantially equivalent with state or state protections in there. One thing we are required to have is an equal employment opportunity statement. This is not our current statement. This is actually wording for what will be presented later to the policy committee. They have not seen this yet, but this would be the wording of the recommended new personnel, the new EEO statement. And again, this is, of course, reflective of what's currently federally mandated under Equal Employment Opportunity Acts. But we have also what's in federal law, what's under judicial interpretation, and there.
Kevin, let me interrupt you. I know this is of particular interest to BJ.
I just texted you, he must be on the phone. I know where you're going with
Yeah,
it.
Shall we just wait 5 minutes, let him know we've moved
Take a
on?
10-minute break?
Well, no, can y'all let me say something? Not about this, because I got an appointment at 3:30, so I got to be out here at 3:30. And you told me I wouldn't be here at 3:30, but we're gonna be here at 3:30. But we're gonna be here at 3:30. All I want to say is, I don't want to say anything about that. I want to say, and the reason I'm saying this, at our next meeting, it'll be March 1st, right?
Monday night?
This, Monday night, and none of us have talked or said any recognition of Black History Month. And this is just a reflection for the Board of Commissioners to recognize the fact that this is Black History Month. And we have people from this county that contribute greatly to the success of this county. And John knows these people, because I didn't know them, I got some others. And I just want to name out 3 or 4 people in the recognition of Black History Month, okay? The first one, I can't do the mask and the glasses. Frank McDuffie Sr., the founder and promoter of Laurinburg Institute. And that was the only high school now for Black kids. If you live in Wagham, outside of Wagham, in an air base, anywhere, you had to find a way to get to Laurinburg to go to high school, because at grade 8, your education stopped if you couldn't go. You had to board, your parents would take it back 402, there no cars and no things. So Frank McDuffie and his wife founded promotion of Laurinburg Institute. There were several other people that worked with him. Now this other person, you may know him, Walter, I was given this name, Walter Evans. He owned the largest trading post in Laurinburg and regionally. And they say he sold anything from 6 feet bathtubs to cows. And, but he really helped, makes Lawrenceburg a, successful trading area, cause he sold so many things in that trading post. You remember that? Were you around when you did that?
No, he won't give a lot of evidence. He's old, he ain't that old.
See, I don't know all that. See, this is the thing, I don't know. Okay, I'm sorry, I apologize.
That's all right.
Dr. Moore, I don't know his first name. He was the first black dentist in the office over the veteran barber shop. Okay, that was we're talking about many moons ago. And the last one, Joy J. Johnson, state representative, the first black state representative to go to North Carolina legislature after Reconstruction.
He founded the Black Caucus.
Yeah, he found the Black Caucus and he lives over there. What's that highway?
Yeah,
401?
Oh, that's where I live.
Yeah, he's lives near John. Oh yeah, one more. Dizzy Gillespie. Dizzy, everybody know Dizzy. Dizzy Gillespie attended the Lombard Institute. And Lombard Institute. And I understand there's a statue and his residence over in Sherrall, South Carolina. They got a statue of him as a noted, well-known musician. So that was my contribution to Black History Month.
Thank you, Betty.
You're welcome.
You know, Ms. Golston, there is a plaque in the clerk of court's office with quite a few, individuals recognized.
I didn't know
In
that.
addition to
Yeah.
the few you mentioned, I think there's
Black
probably 20 or 25.
Really?
Historic Properties has one that's made, Loretta, Glenn,
Mhm.
it's hanging at the art park right now, but it's Scotland County first. And it's got pictures that tell who everybody is. It's normally in the museum, but they
She moved
moved
it up to,
it to the art park. I don't know if she.
Where's the
moved
art
it.
department? Where?
Right there next to the school board, the park.
Where all the statues,
Yeah, that's where it was. I don't know if she moved it, I don't, she may
and then I
have.
think she also had it for a short while at the old post office
Okay.
for some of the NAACP youth conferences.
That
so
was,
they could
yeah, that
see
was
it.
an event. She
Yeah,
had that.
event, yeah.
But it was at that corner, at the art park, but it's got a bunch of.
Oh, gosh, there
different
must be 100 or so
Yeah.
names and faces.
Then you forgot to mention Charles Scott,
Mm-hmm.
the first, African-American to play the UNC Chapel Hill,
He broke that barrier.
graduated from the institute.
Okay, all right then. So the Institute produced some great people, and so did Scotland High, and so did Scotland High. But I just want to recognize Black History Month.
And it tells you what they did first in Scotland County.
Is he back yet? Is what?
He went out on the phone, so, and I texted him and he ain't answered me, so.
And Whit and
And Jason.
And Jason's gone.
I think they think we're on break, so.
I guess we're on break.
I think we're on break. Hey, 10 minutes, 2:30?
Yeah, we might.
You promised me I would be out here at 3:30. I promised I will not be over at 3:30.
We gonna make 3:30.
BJ's in.
But I don't think there ain't nothing
Right
there,
across.
we couldn't wait till.
He said he'll be-
Anyway.
You what?
BJ's got talking to somebody in the conference room out in the lobby. He said he'd be through in about 5 minutes.
5 minutes,
So
okay.
just take till 2:30?
All right.
But like I said, ain't nothing left on there that we couldn't take up Monday night.
No, I'm gonna try to see. Okay, I'm gonna look. I'm glad you brought this. I would have got.
I'll get some, go ahead. For a man. Yeah, something in that door. Jason won't take it out this time.
I tell you, I've been bringing some water, that water in here, I can get a tear.
Put it in
yeah,
there.
you have to get something to.
This worked last time until Jason took it out.
I was the one to take it out. I couldn't.
Jason, thank you for that nice lunch, even though I didn't get to eat all of it.
You're
I take it home and eat the rest of it. There's a lot of food.
Was it good? Did you like it?
It was different. I like it.
Yeah.
It was certainly different.
Where'd you order from?
Four family restaurant.
Where's that?
Used to be 215 on Main. 215
Uh,
on
hey,
Main.
Oh, yeah, that's what it is.
It's called
My kid.
Soda law. Thank you much.
Yeah, it was.
Lucky. Bye.
I had the chicken and cucumber sandwich. It was really good. Chicken salad, cucumber. Yeah.
Oh, my goodness.
He's cooking.
Wow, okay.
He's they have an honest good chef there. And
Awesome.
it's,
When you said that, I remember now the day he, was announcing on the radio that this would be his last day, what he's gonna do. I totally forgot about it.
well, when I went into the restaurant and I heard him talk, when he said hello, I was like, I heard your voice before.
Betty walked out and she took the door thing out. for her.
Uh-oh.
Oh.
And I hate to fidget, but I say, every time I sit down for a long period of time, I say, I could just start acting up.
And remember, the camera's still on, so. It's still broadcasting. It's gonna be the longest. Let's see if anybody wants to go back and watch this. Let's see if anybody wants to go back and watch this.
Yeah, thank you. I got to go. You put that back in there. It is so nice today. I hate to be inside. Oh, I hate to be inside.
I was gonna say, for this next section, we're not just gonna take our chair out there.
It's a perfect day, and tomorrow it's gonna rain Friday, Saturday, Sunday, Monday, and Tuesday. 5 days of rain.
Starting tomorrow.
So,
That's why we're moving our drive, what was gonna be a drive-through event, is gonna be inside.
Oh, gosh, that's right, that's for, goodness gracious.
I got 35 minutes left.
Do you need me to come get you Monday?
Yeah, it's like if it starts raining, like they say, I'm gonna need you to come and get me.
Okay.
I tell you, every Monday is a problem. Seems like Mondays is the day it always rains.
Well, why don't I just plan I will plan to come get you.
Okay, thank you.
I will pick you up at, we don't have anything, we don't have,
Regular 7 o'clock.
6:40. Pick up at 6:40,
no ma'am,
6:45,
I'll pick you up at 6:30.
6:30.
But she'll be out at 6:45.
No,
Thank
no,
you, thank you,
I told her last Thursday I was gonna pick her up at whatever time it was. And I got there about 10 minutes early and she was standing in the driveway and she said, let me go in and find my keys or let me go and do something. And she was right there 10 minutes later when I told her I was gonna be.
10
I
minutes
got one in
later.
the home. We leave, what time we need to leave? We need to leave at 7. Well, we ain't gotta be there at 8. I know, but that's because you ain't gonna be ready till 7:45.
Yep, that's
Yeah,
the way
I
we
tell
are.
people that when you call Tammy and say, you know, sweetheart, you're supposed to meet me here at this time, and she said, I'm on my way. That means she's either in the car or in the shower.
Oh, gosh, we that bad, oh, we that bad, I tell
She
you.
is.
When it comes to her getting ready, you mark off some hours, and I mean, she doesn't get in a rush, she takes her time. You go in her bathroom.
You want to take Tammy to it.
Yeah, there's always a curling iron and a flat iron plugged in at the same time. No, we're gonna curl it and flatten it.
Well, my thing is, I live by myself, and I got to make sure my cat is where she's supposed to be. You know, she got water and food, and I got the lights out, the heating unit where I want. Yeah, I got to do all, make sure the stove is all, you know, when you live by yourself, it's a little bit different. You don't need nobody at the house.
I will be there at 6:30.
Okay.
Now, I will tell you the same thing I will tell my wife, and she will tell you he will do this. I am not gonna be late.
I
So
know.
if you ain't out of the house at 6:45, I'm gone.
I will remember.
You ain't gotta leave them for one time.
That
Let her word up.
That would do it, huh?
I left her sitting on a cruise ship in Honduras.
Oh, my
Drag her
God.
down there and make me late.
What?
Yes, sir. I left her sitting right up there in the cabin doing her thing. I
Oh.
said, I'll see you later. I left and met her down on the pier later on.
Oh, my God.
She come running. Where did you go? I told you it's time to go.
Now, it is not a good way to win friends and influence people when you do that.
I tell you, it's certainly not.
See, we were in Honduras. She couldn't leave. She couldn't throw me out, so.
Yeah, you had it that time. You had it.
My wife would say,
You don't have to
we're
have
the opposite.
Really?
Oh, really?
You're the slow one, she's the one on time.
Well, see, first of all, because she grew up, if you're there 10 minutes early, you're late.
Oh,
And that's kind of the way I was raised.
That's the way my dad in church, especially church. You did not go into church 1 minute late. You were there 10 minutes earlier. You didn't go. So
yeah.
But she wants to be 10 minutes early for everything and then complain that why hasn't it started yet? You know, where I would rather, I'll walk in 10 seconds early because she's, there's not gonna be, there's not gonna be space.
Oh, yes.
It's church, there's space.
There's always space, not at churches, nobody at church.
Well, we haven't gone to church in a year, but we'll watch it on
someone's
YouTube.
starting to back up and he's taking all that off tomorrow. A lot of the restrictions.
Yeah, I think we're planning on, we built a new sanctuary. I think we're planning on
Is it finished?
just minor stuff with it. In fact, I think they slowed down because they didn't want people chomping at the bit to get in until it was ready. I think, we'll probably have our first service there next year.
That would be awesome.
Our church is going on every month.
Yeah, there's a lot of them.
But
have-
15 people in there, 6, 8, they don't, 15
It
people,
reminds me a lot.
18, 20 people at most.
I'm just so
Very
thrilled for y'all. I'm so thrilled for y'all.
Well, then you have a lot of churches, especially small churches. It's like, okay, well, we can only have so many people. Man, I wish we could have that many people in here.
I know.
You know, okay, you're limited to 30. How many do you normally have? 15.
Yeah.
Yeah, so they can open.
Pastor, we were not trying to rush.
I apologize, but thank
Not
you.
trying to rush.
I'm good.
We didn't want to cover this section without.
I appreciate it.
Wait on Carol. Last I saw her,
She came in with us.
Oh,
You mean Kara disappeared, huh?
She was outside talking, but then she came in.
Just to discuss the policies first and then go to the deal.
All right, just go ahead and policies and then,
Okay.
see where they want to go.
That's the reason that.
Hey, we thought we had to go find you.
Around the building.
Now, I want to, come on now.
All right. We've all caught our breath.
Yes.
Okay, Susan, if you will
All right, what I do.
begin, please.
See, this is the problem.
Somebody turned the air on, didn't
It's cold in here.
You and Alpha don't get along.
Jason's a little chilly in here. You can't have it.
Like last night, turn it back up.
Oh, no.
Jason can't solve all the problems.
Okay, I appreciate this opportunity to give this information and to answer any questions that you have. But as Kevin has mentioned, we are in the process of working with Drake Maynard. He is helping us develop our policies for substantial equivalency, which, if you remember back, we discussed going substantially equivalent in lieu of doing a consolidation with health and DSS. So with that, we're trying to get our policies up to Office of State Human Resources Standards, trying to get paired as close to state policy as we can, and Drake Maynard is helping us to do that. So this came from the draft that Drake Maynard has developed for us for the recruitment and selection piece. Now, the substantial equivalency is only for recruitment and selection and classification and compensation, and we're working on the class and comp now. But we finished this recruitment, and in our current policy, we have had the internal recruitment and the external recruitment. We've had those two ever since I can remember, and this actually came from a template from counties in North Carolina. This was a template in the back of that book way back in Ed, you remember this in the Stephen Allred days. So this came
Yeah,
from a
it has been a
template,
while.
yeah, these policies came initially from a template from the School of Government. And with that, of course, we've had this policy for years and years, and then even in the draft, Drake has included that in our draft policy upcoming. But keep in mind that once we get all of these drafts together, we're going to, bring them before the policy committee, who then will, if there's any tweaks, they want to do it, and then they'll bring these to the full board. So I wanted to mention that.
I have a question.
Yes, sir.
Within this policy. It's just a proper time to ask it, maybe I need to just let you go ahead.
For our current or the draft or?
This draft here, where we have the most qualified, second sentence,
Yes.
identify and attract the most qualified. I have an exception that area right there. The qualified would give it the wiggle room you need. When you say the most qualified, you can get the same thing by hiring the qualified. You would eliminate somebody that you would want to hire and hire the most qualified. If you need a person, just as an example, to lift 400 pounds, but BJ come in and he can do 600, well, all you needed was someone to do the 400. And maybe that was your most desirable person, but when you say I'm gonna have the most qualified,
Or just a suggestion to that, maybe the right word there is attract a qualified applicant. Instead
A or the, yeah.
Because if, I mean, you're tying yourself to the most qualified.
yeah, and
I follow what you
they
say,
qualified could be John Arthur, who was sitting there, who's been there 10 years, and
but these words make a difference.
It makes a
You say
difference.
the qualified or a qualified.
it was the
You know what
most.
I mean? Yeah.
Because I've been there 10 years and Kevin wanted to promote me, but somebody else come in and they are the most qualified.
Right.
I just threw that out there.
My question is, you mentioned substantial equivalency.
Yes, sir.
Is that something that the county, the board's been working on, or is this something new? I've not heard a lot of good things about going through that process as it relates to accountability with the state, or our assuring accountability with the state. Is that something new, or is that something y'all been working on?
Well, we, back some years, 3 years ago maybe, we were looking at the consolidation of health and DSS, and Kevin can explain that a little bit for the history of it. But, with some of the meetings that we had, the, state folks that were there at that meeting said, you can actually get what you want, which is the flexibility in classifying positions. Because sometimes it took so long to get a new position approved, because with health and DSS, even though they're county employees, they are considered, y'all forgive me, they are considered separate state agencies under Office of State Human Resources. So now, every position change has to go before and there's only two in the whole state. They go to the, our assigned contact person for Scotland County, they review it and they approve it.
Is this the Office of State Personnel?
Yes, sir. Yes, sir. So the reason being is because that has had some lag time, and also with the state, and I can even have, Mr. Mader come when we go through, this policy if you choose to. But just to give you history, the state has not updated their classification since late 70s, early 80s. And for the local positions, they don't intend to update those because they are comparable to the state side. If that means,
It does,
yeah.
but what I think
I'm just clarify that, if you have a social work position or an finance position, and somebody applies for it for DSS, Susan doesn't qualify that person for that position.
But in this substantial equivalency, she won't have to go to the state.
Right.
It will go straight to her, which for me, and I think for us, that having to go to the state gives them covering so that we know that we can say, listen, the state did it. It was done by the state. It wasn't a local thing. But when we take it from it having to go to the state, then you open yourself up to the question of,
It can work for you and it can work against you.
Right.
That is absolutely true.
right, and it's just what we decided we
It
want
depends.
is the better.
But when you've got a critical need for a nurse and it's taken 2.5 months to get a applicant stamped, you're qualified, when we could have done it here in the county in 3 weeks, and you've got these vacancies just languishing empty because you're waiting on the Office of State Personnel to act on an applicant. We were trying to be expedient as well as being able to hire.
Well, I just want the record to state that I have reservations
Uh-huh.
because I appreciate even that time, if it's 3 months, having the state put their seal on it gives the confidence that they don't have to worry about answering those questions. The state did it, we sent it to the state qualified it,
True.
and it takes,
Yeah.
I wanna
see
make
it
sure
both
that's
ways. I
stated.
know where you're, yeah.
Well, they've actually made a mistake on at least one occasion.
well, mistakes are gonna happen,
Oh, I understand. I'm just saying they're not perfect.
but it gives that assurance that it's not a local thing that we're dealing with. And as I've shared in the last meeting, there are concerns with our hiring practices when it comes to what happens locally. And this, for me, will only make that worse because you don't have to deal with answer questions to the state.
Well, they still don't pick the employee at the state level. They just,
I got you, Mr.
Determine
Johnson,
whether-
but they still have to
They
put their seal. Now they don't have to put their seal on it. It all happens behind these doors and it doesn't go anywhere. That's a concern for
my
me.
understanding is you may send them 5 applicants.
They may say they're all fine.
And then they say all 5 are fine.
Mhm.
You still have to make
But
the
we still,
choice.
yeah,
one
you
way.
do the interview and
They don't
the
choose
the
the-
department head still chooses, the person to
I
hire.
got you. I just want to speak with peace.
Well, if that may be something the board wants to consider, because we're way into that process now. We've already done the drafts for 2 of the 3 policies, and we're gonna work on the 3rd, which is the smallest one, the compensation.
Well,
yeah.
apparently the board's already decided that this is what they want to do. I'm late coming in. If y'all gotten that far, I'm sure
You
y'all.
said the board now. I
This can't be your first
I don't
conversation.
know anything about this.
But I ain't on policy.
I'm not on the policy, I don't know nothing about this.
This was a board decision. I
It's a
think.
board decision.
Yeah, it was a board decision because we
It might have
decided
been
to,
before you
instead
came
of
It might have been
going,
before I was here. I'm just saying, I hadn't heard this. This is the first time I've heard that word used.
The big issue was whether, at one time, whether the health and DSS departments should become consolidated.
And that may have been before you came on the board.
Yeah.
It had to be.
Yeah, all that conversation.
Now, when you define it to the health and, it's the health and social service, I kind of understand what you're saying now. Okay, I remember it now. Okay, I remember that now.
But you would not have any memory of it because we didn't have those
I
conversations.
wasn't here. It hadn't been talked about. I'm not on the policy.
And the policy is, hadn't gotten us yet. It's still.
no, I'm still working on the drafts, because we wanted to bring all the drafts to you at one time. But I did want to make, kind of been around the world to get to this point, is that, with Mr. Alford's, question, I'm gonna pose that to Mr. Maynard, who is our consultant, to see if, because he's drafting this, because he knows what Office of State Human Resources is going to look at before they'll approve these policies. So I've got a note just to, bring that question to Mr. Maynard.
Cause you may have a BS degree working for you, who knows everything about the job in the county, and someone comes from outside with a master and shouting it.
Well, keeping in mind that with that, you get all of your qualified candidates, and then you set up your interviews, and then there may be the most qualified person on paper, but they did not interview well at all. So you've got that dynamic, but your goal should be to hire the best qualified candidate.
And the reason I mention it is because I've had a person have their attorney challenge my company on policy, where we use that very same word. That's where I was coming from. You said it in your paper and in your policy,
Prove it.
the most qualified. You got,
I only have 20 more minutes, so I'm
Okay.
gonna go as far as you
What
can.
I just wanted to do is let you know that I have gone out to our surrounding counties, and, Robinson and Hope County, they do all external, postings. That any internal employees that want to, they don't do internal and external or a hybrid of, they just do all external. Richmond, they offer both as we do. Bladen and Moore offer both as we do. So I just wanted to give you
Now,
that
off of
information.
what now? You say external and internal hiring.
Yes, ma'am.
What's that statement again? That,
Now, what we do is in our policy, we can state, okay, this position, we're just going to do an internal posting.
okay,
That means you're going to give your county employees the first opportunity at a promotion,
okay.
so to speak. So a lot of times you can do an internal recruitment. If you don't get enough qualified applicants, you can then say, okay, we need to go outside, let's do external.
Now, I feel like what we really need to do, really think seriously about the internal part. I know that it's needed in emergencies. You gotta have somebody to step in and take the place of the person in charge. But then if all the promotions gonna be internal, everything gonna go internal, then nobody else has a chance to accelerate. So if we take the internal, we got to find a way that people will be able to come in and be able to accelerate to a higher level. This way, nobody gets to move, but
Well, that's one
everybody
of the-
inside.
Mhm. And that's one of the decisions we made with the internal, posting we just had for the EMS director. And then we had the assistant EMS director that we went outside, and we received internal applicants as well. So we chose to go outside for that, because we did internal for the director.
If you do an external posting, you're not excluding anyone. You
Right.
can still receive applicants
Right.
internally, but you're also opening it up to outside of the agency. So external is everybody apply. Internal is those that are employed can apply.
So we, in a sense, we need both, but, I certainly want it to be included external also. And, well, I guess it's decide on what positions, I don't know, but I still think that we got to make sure that that people interested will know about the position, have opportunity to apply.
Susan, the question, who determines, or how is it determined which positions can be filled with only internal exposure?
That's usually the supervisor in cooperation with the director, and at most times, especially if it's a higher level position, the county manager.
And most of the time, if it is an internal only, okay, Jason's position is now vacant. All right, you might be, you work here, you'd be good for it, and you're both interested. Be happy to have both of you.
But that's not.
So at that point in time, we can do an internal hire, because I know I've got some strong internal candidates. And it's a good opportunity for promotion. If it's a situation where I don't know if I have somebody ready to step up, at that point in time, we just do an external.
I mean, I think you can have both, because internal promotions do tell employees when they come to work, we're going to hopefully create a path for your own advancement in this organization. If you go to work in an organization and the only thing they do is external postings, yeah, they might hire somebody internally, but if you know you're doing internal postings, it does send the message to your employees that your loyalty, your years of service, your performance, they're going to matter, because we're going to try to create a path for advancement for the people that have been here. External is obviously a great way to go, because there are qualified candidates out there that you need to bring into the organization that you might not have in the organization. So I think there's a place for both. I wouldn't want to eliminate either one. I think you can work with both to get the best qualified people.
But here, I think the question is, we're talking about these high level positions. And we have to have a leeway in that persons can able to apply for a director's position or a higher level position and not have to compete with that internal person that's gonna move automatically right into that place. This is where the problem is coming. I think this is where we're getting stuck. What do you think, Joan?
Well, if I may just add this verbiage, because Hope County does external. And they had, one of the things they said, positions that salaries are above 50,000 will go to the News Journal. I mean, you can state, okay, for all department head positions, we will go outside and inside. You can give those qualifiers. But I was just giving you this as information that this is what some of the other counties do.
My experience has been, and I don't know what our policy is on this, that you post for any job internally for, will it be 3 weeks, a month, or 6 weeks, whatever, you post a job internally. And then if there's no qualified or interested candidates, then you go outside.
But that's not always gonna work for us, Jim.
Why
It's
wouldn't
not
that,
gonna
why
always
wouldn't that
work
work?
because you still dealing with, you already got someone in mind to be promoted to that next level. And that doesn't give another person a chance to move up.
Well,
Because the internal part is gonna take precedent over everything.
well,
But if-
it could.
You have to be internal to move up. If
No,
you're
you
an
shouldn't have to be internal to move up.
Yeah.
You should be able to apply for a director's job without being internal. What do you think? Do you have to be internal to apply for a director's job?
Oh, no,
No,
I don't think so.
I'm
Because
just-
and maybe this is, whether we're compared, if you compare it to a larger county to a smaller county, Mecklenburg County probably would be a different answer. Scotland County's problem is gonna be with, if you don't put it out there in an open setting to everybody, is that these jobs don't come open that often.
Right. they
Just
don't.
like Roland's position, he's been there 30 years.
Yeah, right.
They're plus or minus. So let's assume that whoever will be there for another 30 years. And so that's 30 years before somebody can have the opportunity to step up.
Yeah, that's what
Now,
I'm talking about.
I'm not saying that anybody's not qualified or qualified, but I think that's where our limitation comes in, is because we don't have that step.
And see, and when you're trying to become racial balanced, see, that's a different issue. Then you have to address that situation different. You say, well, we're gonna post it internally, but we're out of balance, and so you're gonna specifically be hoping for a minority. Then if you don't get it, you post outside, but then you can't guarantee it when you go outside. You don't know who's gonna apply. You can't hold a job open forever when we provide a service. So while we try to have racial equality and what have you, when these jobs only come open every 15 years and you advertise internally, you don't get that candidate, then you go outside. You can't specifically say, I'm advertising for a particular race.
But see,
You get in trouble there. Am I correct?
yeah,
You can't say I'm advertising for,
no, you can't say
a
that. The
particular
law
one. So
prevents
you
you from
just
saying
hope.
that.
You hope for it.
Hope for it, but, you know, we got to find a way to balance this, the internal and external. We really do.
And
And that,
the rest of the Lord, do when you go outside, because they getting, I agree with you 100%, but I'm saying there's no guarantee.
no, it's no good, but we have to,
You have to
we can
try.
find resources, we can find places, we can reach into areas we haven't done before.
Sure.
If we need a director of health department, for instance, we can call it university system, some of these.
Yeah, you try, yeah.
Yeah, and they got master's or doctorate degrees or whatever. We can find resources to help provide us more information about these positions.
So you agree? But
And
I
if I
can't.
may, I'm sorry. I
Go right
didn't-
ahead.
But, I was just reading you an excerpt from our current policy, and it's also in the draft that Mr. Maynard did. Under, posting position, vacancies, an exception to the posting requirement will be permissible where a formal pre-existing understudy arrangement has been established by management. Now, we had such an arrangement that the board approved the position of deputy tax administrator when Mary Helen Norton was going to retire. We advertised for that position outside, outside applicants and inside applicants And then the inside applicant was hired for that deputy tax administrator. And the thinking was, and the board approved that, the thinking was that that person would work a year under Mary Helen before she retired, and then they would go into that position. So that would be a formal arrangement or an understudy arrangement. That would be an example of that, which the board approved that.
Now, that was a direct board appointment as well, and I think the concerns, correct me if I'm wrong, but the concerns that some of the members of the board have now is guidance for the manager as far as hires that he makes. Now, it may be parallel to what you're talking about, because,
Well, I was
Is that-
just using that as
is
an
that
example of an
accurate or-
understudy agreement.
I mean, obviously you can vote if you're the board on.
Right.
And I know that, in reference to the most recent director hire that was made, that has created this conversation, we had been told for at least 2 budget sessions or 2 budget cycles that there was a succession plan in emergency management, and that Mr. Sampson was in line for that promotion, assuming that everything went according to plan. That was not a surprise. Kevin had told us in 20 and in 19 that Roland's retirement would be with us at some point, and that we wanted a succession plan. We knew it. We'd been advised
I
on
must
it,
have been sleeping
and it
on that.
happened. And so we knew it for 2 years.
I don't remember that, Carol.
Here's my question concerning a succession plan. Does it always meet the bar for racial equality, racial balance? See, a succession plan is a great plan, but you also have to take in consideration who you have on staff. If your succession plan is to put John Alford there, and there are already 5 other John Alfords at that level, is that succession plan the right one?
The succession plan can be easily interpreted as a guarantee.
Absolutely.
That's right, that's a good word for it.
And if,
It's guaranteed more than one
right,
thing.
and it's all how it's put to that
Yeah.
person or persons.
Yeah.
And I don't ever think you put a succession plan in one person,
Absolutely.
because you don't, and never, hey, when
It can be.
he
illegal.
retires,
It can
you
be
take in
illegal.
his place
It can be illegal.
and cause all other kind of problems. And then we hear feedback, well, you can't go to work for the county unless you know somebody, you go to church with, or their cousin, or whatever, you've heard it.
Oh, yeah.
And
You will
so,
always post jobs, even though you know who you're gonna hire.
But what we wanna
You
do
will
is,
always post jobs.
we wanna
And you know what
find,
happens with that, John? Because I've seen it more than once. They know who they're gonna hire. They're just posting that because they gotta fulfill the requirement. I'm not gonna apply. They've already decided.
But you are legal when you do that.
well, that
but
gets.
you gotta do
And
it.
the other problem is you get everybody that applies for it, so they make the unemployment office happy that they're looking for a job.
So, I mean,
There's goods and minuses that come.
But
with
we
it.
got a situation here in Scotland County, the image anyway, so we gotta make decisions how to improve that image.
Yeah.
And we can look around and we can tell that it's not balanced, it's not fair, it's not. Even though nobody meant any harm in doing this, you just did, like you say, internal or whatever, and kept the county rolling. So now we got to roll in a little bit better mixture of people to get it looking better for the sake of the county. So let's make plans to find a way in the policy to be, include and be able to reach out to other groups of people.
I would like to say something on this, and then I'll address this issue anymore. A few years ago, there were 3 or 4 African Americans sitting on this board, and we had to hire a county manager. We interviewed, I don't know, for several months.
Yeah, we interviewed her.
And we would have loved to hire an African American manager. I was on the board, JD was there, I remember that. I know Clamps was there. We had to come inside, and we hired Kevin.
So there's nothing racial about it. It's just that the right candidate didn't come and apply.
Yeah, that happens,
And
but,
so I'm saying, we tried, but the dequalified candidate of African descent or Native American didn't show up.
but it's another time, John. The world has changed a little bit. And people make more demands. You see what I'm saying? When you were elected to the county commission, they expect you to come to a county that has some fairness, right?
Well, it was fair then, that person just wasn't available.
Okay,
The
maybe we have to
qualified
talk about.
candidate chose not to come here for the salary, and they went to, you get it?
But I'm saying that we
It
got
went
to
north.
try to,
Yeah.
And if the board decides that we want to do all external postings, you all are the policymakers.
okay.
So that would be a board decision.
But I
And we
don't
know
think
that, we
just
know
going to
why.
outside is gonna fix this problem.
Say that again.
I don't think going just to an outside source is gonna fix this problem.
The only thing we change is going outside.
I don't-
That's not the answer.
No, because if we don't identify the problem first, we can't solve it.
And that's one thing that,
So that's kind of leading into my
Yeah.
next part.
Okay, Susan, you want to go on, because I've got to say.
Okay. I wanted to let you know that we've done some research on, some other recruitment sources. And there are several free, and I think you've got this document in your materials. But, we have been trying to do a lot with a little, because we have not had a budget for personnel ads. When we got NeoGov, which is, a software that, all of our applicants go through, and we put qualifiers in there. These are the minimum qualifications, and the system decides who is qualified. So we have, NeoGov also, is, a subsidiary of governmentjobs.com, which is nationwide. So we're getting nationwide coverage through this. And as well as, of course, we do county email blasts. We are also always post with the, NC Works, which is also nationwide. So with this, we are wanting to reach out and utilize technology, Facebook. So what I would, really ask, and I think some of you are already doing it, is when we're starting to do an email blast of all positions now. And once you all get that email blast, if you all would share it on your Facebook pages, and that would give us so much more, awareness, coverage, as well as, there is something I didn't even know existed until this past year, and Betty Galloway told me about it at the city. It's called Handshake. And this is a free service, and you, sign up with Handshake, and you determine what, universities you want to, advertise with, and they will do it for you. You just pick your preferences. And we did some research, and we went to the HBUs, and, there's several of the HBUs that also use Handshake. So what we're gonna do is send it out to, these as well. So all we have to do is just go in there and check these universities, and anytime we have a position, we put it in Handshake, and it will go out to all these universities. And that would be very helpful for our degree positions. Income maintenance caseworkers, those are your worker bees and social services. That degree is not required, so we probably wouldn't go that, but any degree position, we would send out to Handshake.
I like that, I like that, don't you, Reverend Gibson?
But
I think
also,
that's a good resource, because you are going to the colleges and universities for certain degree individuals, hiring.
Yes, ma'am.
and what we're also, we're talking about is if we can, get names or contact people. You remember we tried this before? If we can get some contact names and, we can develop an email distribution list so that every time we do a county email blast, we will just tag on that email distribution list as well. And what I did is reach out to my classmate, Regina Smalls at the NC Works. And she, is Herman Tyson still the NAACP head? Okay, we have his number, we can reach out to them. But anyone, I've got some other, of course, are you still the head of the ministerial alliance?
Yes, ma'am.
Okay, so you were already getting that email blast. So I've always already, and these are in your documents, but I have some other names. And we have developed a draft, I think the draft letter might have been, so we will reach out to these individuals and ask them if they would be willing. And then once we do that email blast, they'll be automatically on our distribution list, and we can send it out to them, and that'll give us more coverage in, the African
If
American
there are
community.
individuals that, because the name I gave you before did not ever respond with me. So this person, is, you know, these people gonna have to be willing
Mhm.
to, use this material to try to seek out
Yeah.
persons in their, you know, in their midst and their.
And they'll just add it to your
whatever.
Facebook page or the Facebook page,
Yeah.
just like these sororities that were named in this
Right.
document. If they would just put it on the organization's Facebook page, and that'll help us get more awareness as well. And what we, that's immediate, what we can do right now. And then we're going to use the online job boards that's available for free, those that we found. And then we are going to request in this upcoming budget that, we get $6,000 for, advertising budget, especially if we get these, department head or assistant director positions available. We want to post out even farther. So that's
What
what
is
we're,
our hope in getting, I think the question was asked, are they in these high-level positions coming open in the county? And the question was really no. I mean, we don't know when we will get another position open in this county. Is that correct, Susan?
Our 911 director has already announced that he's retiring in
Right.
June.
Wow.
So that position
This
is
June?
this June. So that position is going to be there. And one other thing that I was going to bring up a little bit later was the assistant tax administrator. That position we did not fill last year because Jim, who was promoted to it, we waited a year, but you know, Jim is turning 65 this year, and I have no idea when he's going to retire. The board about getting permission to recruit for starting in July, so we go ahead and bring somebody in. We may have some internal applicants apply for it, but we would do it just a purely external because that's one we want to widen net on. And hopefully bring somebody in. I don't think we're going to get a tax administrator from another county, and it's possible, but if we can bring somebody in and then get them the training they need, when he retires, somebody will be able to take over.
What income level that person has?
I don't have my
I
salary
don't
sheet with
remember.
me.
I'll get later.
Okay,
I
okay.
wouldn't say it here.
How about your librarian?
It's a good one.
Probably,
He can retire he can retire with 30 days notice. And that's somebody who
I
had
said it
to,
in 2 years.
sorry,
Do you appoint his replacement or does the library board do that?
I do.
You do?
And not that we, if Susan just said she's probably eligible within 2 years.
Well, I'm eligible now.
But you've got rocks around your feet, so you won't.
We chain her to the desk.
Well, this sounds better because when this question was asked at the other meeting, I think it wasn't anybody could point out that was gonna be, no openings was gonna come about for high level position. Is that what you gathered?
No, he shared this about the 911 person
911
last
was
time as
only
well.
one.
But I think we already have a plan, right?
Yeah.
A succession plan there too.
You have a succession plan for
I
that.
have somebody that I hope, an internal
We'll
applicant
take
that I
it,
hope
right.
to apply.
Right.
And if that applicant is the best qualified and they do it, but we'll need to fill somebody there. We are also going to have, I believe, an IT person that's in 911 that we need to apply
Right.
that we're already recruiting
It's
for,
already.
which is, so that's an essential position that we need in that department also.
Kevin, when we say we have a succession plan, that's not documented, that's just a phrase.
That's like an informal, and this
Yeah.
has been a catchphrase in our trainings with school of government for years. And it's really come about because of all the baby boomers retiring.
Yeah.
All of these years of experience walking out the door, we need to bring somebody else and develop leadership, those who are developing leadership skills, and we try to encourage those to do any trainings that they can, so they can enhance their skills, so they can be ready.
Yeah.
in those
Nothing-
opportunities.
We're not doing formal, so when, John, when you retire, we know Tim is going to take your position come hell or high water. But we know you're going to retire in 2 years. You know what? Tim has the skills to take your position. So we're going to really push him to get the training, or we're going to push him and BJ to get the training. So we're ready. So when you retire or you just walk out, we have somebody who's there. But it's not a situation where anybody is guaranteed anything, because otherwise people stop learning.
Well, it's all how you communicate that.
Yeah.
It's
I mean, it's
somebody
like,
that They
we
think
can
they
do-
are the heir apparent to whatever, and however they got that impression is debatable, but, how you communicate it. Never have just one, I always have two.
I think it's some of the positions, I think the tax office may be one, I think the EMS director, I think is one, that you want the person who is running those positions to be fully trained by the person who's leaving. You don't want to have a gap of time and a learning curve for that new guy coming in.
Right.
But I think there are a lot of positions that you don't need that. That you want the person coming in maybe to have some fresh ideas to do things differently.
Right.
And I like Leon, great, it's not against him. I think somebody coming in there probably has some ideas that they're gonna be new.
Well, health director, I mean, that would be a person that could come in from new ideas and everything, right?
Yes.
And historically, we've always gone outside for DSS and health director. But most department head positions we have, but when you have such a technical position, like the EMS director, that we did sort of that informal succession plan, and again with the tax administrators. But so the more technical positions, the more difficulty it may be to bring somebody in from the outside, especially in emergency management.
Well, we brought Whit Gibson as a clerk of court, he'd never been in a clerk's, I don't think, had you?
He was my superintendent at the prison.
But I mean, you supervise
Did
a
you know
lot
that?
of employees in positions you had been, but you had not one day's experience and was good a clerk of court as we'll ever have. So, I mean, the point you made, I think, is well.
And also there are going to be positions like the health director. We didn't have any employees who are qualified for the position. Librarian. I don't know that we have any employees that are technically qualified for the position. Yes,
There's no assistant librarian in there that's going to walk
Well, the
into.
youth services librarian serves as the assistant. I think.
they're the assistant, but I don't know if they have a master's degree in library
I'm not
science.
sure. I'm not sure.
I may be wrong here, but I don't think I'd specify who is even in position. That just don't settle right with me if they're listening to this, that, well, you just said there ain't nobody here qualified, I'm sorry, that's just.
I'd like to interject this, first of all, what Kevin is doing and what personnel that you're doing is challenging and difficult. I would say this, several years ago, I was called based on the position I was holding, and the person said, John, they introduced 27 teachers today that was hired for Scotland County School System. There were only one or two African Americans. You need to do something about it. So I went, talked to the superintendent. He said, Mr. Alford, I'm so glad you came. He said, if you will find me 5 black, he said, I have 5 open. I hired them yesterday. He said, Mecklenburg County offered them $9,000 to sign on, and I could only offer $1,100. And he said, we have an issue here. We're having to compete with Mecklenburg and Wake County. He said, for the most qualified African American, they can make substantially more money
In the bigger cities.
in the bigger cities. He said.
And that's the issues we have with.
He said that's the
recruitment
issue we have here. He said, what you was told is correct. He said, but I interviewed him, but I couldn't land it.
Well, we got to try, all I say.
Absolutely.
We
He
got to
tried.
make this work, whatever it takes, we gonna make it work.
Well,
Thank you, I gotta go.
I've got a little bit of that information
Yeah.
here, just
Look at
looking
this,
at
Betty.
the positions we've had for the last year.
Can't see that.
I'll give you some of the numbers.
Thank you.
Everybody we've hired, every position from February of last year to February of this year. The number of people who applied, if you're looking at it, 42% were African American, 29% were white, 24% American Indian. Then eligible. That means they met the eligibility requirements that we put in the system. You had to have this type of degree, you had to have this type of license, things like that. At this point in time, people come out that pretty much African American and white are even at 35%. Thereafter, come back that they were reviewed. We have a subject matter expert. We have somebody who knows the position. They're not necessarily the interviewer, but they give them a check to see, yes, they have adequate experience or not. So that goes to referred to the department head or whoever's making the hiring. And then how many were interviewed, and then number of positions that were offered. Here, when you're looking at offer, the difference, African Americans, 30% of the positions that we offered were to African Americans, 32% were to white, 30% were to American Indians. But when then you look at hired, which means they accepted, that goes from 19 offered to 12 accepted for African Americans. 20 were offered, 16 accepted for whites, 19 were offered, 16 were accepted for American Indians. So we have a greater disparity between what was offered and what was accepted in the African American community than we do in other groups.
So you're telling us the work that we have to do to make that change, to make that make that more feasible for African Americans.
Well,
Makes Scotland kind of more appealing to them.
and some of that is also because we have a lot of people who just apply because they apply, or they don't know if they're interested in a position as they get through here. But looking at it, in the last year, we offered positions to 19 African Americans, 20 whites, and 19 American Indians. So you have more equity there than if you're looking deeper into it. So, it is an effort. And some of this is also part of the reason some of these conversations, we've been having this conversation for years internally. And that's why we've gone to NeoGov. That's why we're not doing the paper applications. That's why when Carol is receiving an application as a department head, she doesn't get a list of names until you're face to face with somebody, because we understand that we know there's a bias that Tyrese is not going to get on an interview as often as Jason will. It's just not going to happen. So
And I just
that's why
wanna
we're doing
mention-
a lot of those things.
In the referred column, those are the applications that are scrubbed. All they're seeing is qualifications.
So we just have experience, your job experience, and if you have a degree or certifications. We don't know where you live. We don't even know if you're in the state or not.
Kevin, is that the ones you were doing the hiring on, or does that include
This
DSS and
is
health?
everybody.
DSS and health
This
department?
is all county employees.
Well, so our job is trying to stay within the law, right?
Yes.
And still, try to, increase and, make it equality among, all the applicants, make more a black person applicable to the job. So we got to find a way to do that,
And part of that is to make sure that we're in the type of place where someone in the African American community wants to work. And some of that, because the county we provide services, if you think that I'm not gonna hire you because of this, that, and the other, you're also not gonna come to me when you have an issue.
That's right.
And, you know, the whole thing about racial equality, racial sensitivity, we want that. We're serious about that desire. Because if you think that, you know, if you think I'm not gonna deal with you, you're not gonna come to me when you need social services help. You're not gonna come to me when you need the health department. You're not gonna do that. And that is the last thing we want.
Which
We
is,
want you to be comfortable coming to the county.
if I may add in, Kevin, and I'm quite intentional, because I want to, I think what you're saying, you know, like I know, is the issue in our community.
Mhm.
We've got to fix that, because across the board in our county, African Americans feel that way.
Yes.
They're not going to get hired, so they don't come to this building. They don't go to DSS or help if they can help it. And that was my foundation of the whole conversation. It was not about Mr. Sampson. I don't know him.
Right.
Looking at his qualifications, he is very qualified. So it wasn't personal. For me, it was what you just said is exactly it. And we can skirt around it as some of us want to do. You just hit it on the head. We've got to change that perception. We got to do it.
And this goes back to part of the strategic goals that Betty specifically wanted last year about getting more community engagement, more community involvement. And, you know, even to the point of getting out into the community, having different work sessions, and of course, COVID blew that completely out of the water.
Right.
But if we're more approachable as a resource place, as a place where, you know, we can establish dialogue, we're gonna be more
Makes a
approachable as an employer.
That's right.
And part of that is figuring out exactly how we can become the place where
People want to
everybody
come.
in Scotland County would like to work.
The county friend, what is it, well, they got to see us as, a place, when they come in this building, you know, people smile and, you know, I mean, it's got to be more visible and more friendly. And, you know, they say sometimes we out in front of, we were running for office, but when we get position, we don't speak to anybody, you know, let's get back to the county commission.
Yeah.
You know, that word is out there too, so we have to continue to respect and be friendly to people, you know, all walks of life, and try to make sure that they are comfortable in our presence.
Yes.
As a commissioner, that's very important. We gotta make sure they're pretty comfortable. But thank y'all. I appreciate your efforts you putting forth. I know it sounds like we don't care, we don't, you know, we can leave this and leave that. But the fact remains that we can try to work towards solving this problem.
Yes.
It is a situation, it's gotta be resolved. Gradually, you know, it probably won't be done tomorrow, but gradually it's got to be done. And I know we can do it, and
But we want to work
appreciate
on
that,
that.
to work on it. I appreciate y'all effort.
But one thing I wanted to mention, and this kind of ties into your perception, we had meetings and meetings and meetings years ago, maybe not that many years ago, but we had all the stakeholders that were in recruitment. And we came up with a plan, we wanted to market the county. And what part of this budget is to have materials where we can go to job fairs. We want to market Scotland County in job fairs. We get invited all the time, but we don't have any materials, so we
That would be
haven't.
great job.
We have not, yeah, so that's one of the things we want to do, is go to these job fairs and market Scotland County.
Yeah. That certainly is a good resource
Sounds good.
right there.
Oh, let me just throw this in. Commissioners can't solve what we're talking about here. When you read our newspaper, it goes all over the world, shootings, killing. When you market our education system, our high school, people know when you're recruiting the most qualified, they want to know about your school, your neighborhood, your safety, your crime, okay? Until that's acceptable. Cause I've been hiring folk. I've driven professional folk around Scotland County and then offered them $100,000 job, okay? And they said, no, thank you. And I was looking at it, all right. After they surveyed the county, they had options. And a person of that caliber that we're talking about that we want here, okay? We are competing with the surrounding town. And to ask our personnel manager, our county manager to bring these people to Scotland County is difficult, if not impossible, to get the number that you want, that we want. Because when you're investing in a home of $250,000, you want to know 15 years from now that you can get 100,000 more. And when they check Scotland County, it's the opposite. I'm just telling you what the facts are. I have a relative right now seeking a home. When he's out in Gastonia, what have you, he don't want to invest his money here because he knows what the retail value, based on the past 15 years, would it be 15 years from now. So when you're recruiting folk of that level, think like that. Scotland County is a beautiful place. I love it. I chose it over New York and Connecticut. But the now people think differently.
Well, it's hard to compare to Moore County and Robinson County with salary.
Absolutely.
And
Yeah, that's what
I
you
remember when we were having a deluge of our social workers leaving because Robinson County was giving $3,000 sign-on bonuses. And they were just walking out the door and doing the same thing at Robinson County and getting so much more money. We're losing nurses left and right. We get them in, we don't keep them here before they're going to bigger, better things.
My wife left Scotland County, went to Robinson County, got a check and told me my check is messed up. $4,400 on the recruiting for her to go.
Susan, these are names, if I can give them to you,
Oh,
of the
awesome.
presidents of those sororities that you have listed. and their
Awesome,
contact
thank
numbers.
you so much. I will reach out to them and get their emails on our distribution list.
Is that recruitment potential people?
Mhm.
Ms. Dorothy Tyson.
No, I gave her the presidents of the Deltas. She had Miss Pierce and Joyce McDowell,
Mhm.
but I gave you the actual presidents of those organizations.
Okay, wonderful, thank you.
Ms. Dorothy works with one of the radio stations. Dorothy Tyson.
Yeah, she was with WWL.
Well, I was gonna call Dorothy, but Regina reminded me that she gives the hot dogs every week. So they're already advertising their hot dogs on WLNC.
Right.
Mhm.
She's on a lot of boards too.
I'm gonna add Dorothy.
Dorothy knows it has as good communication in the community as anybody out there I know.
Yes.
I'll call her tomorrow and get her email address. She used to work for Scotland County.
Jason's probably got it.
And Scotland County
I
Schools.
may have her.
You have her?
I think
Good,
I have
good,
her.
good.
She's on the DSS board.
Mhm.
I think I have her from when we
Okay.
were doing census stuff.
All right.
So Susan, what we focused on first is the very first slide you put up, which would be sort of a,
And that's
Overall
really just the
statement.
EEOC statement updated to
Right.
get the new,
and then you
some of the
outline
legislation.
how you want to enhance, improve, broaden, and grow your recruitment tools and the request for money to make that happen. You gotta have money to do that, and we understand that. What other information do you want to go over?
Well, that was basically what I had, is just to let you know, the surrounding policies, some, two, just journal, and, I think three, do as we do. Thank you so much. I'll get from you. And they do as we do, they do, the same thing as we do interim and external. So, and I guess that's when we go to the policy committee, that's gonna be one of the things we need to talk about.
Yeah, and I mean, it'll come to three, it's obviously myself and Whit and John, but there's never been a policy adopted or rejected that the whole board didn't vote on. I mean, so, it's not, three of us that are gonna make any decision at all. Yep. Okay. I just want to make one statement. I think that going forward, my goal and my vision of this organization, which is Scotland County, is that we have the best qualified people, but that we also create an internal environment where people know that they have opportunities to be promoted and to advance, and that we're developing the leadership skills among our own employees, so that when someone comes to work here, they know that if they want to stay, that there may be a potential path for them. And that may be what will help with retention, because we do have some turnover issues from year to year. There's no question about that. So I think you can do more than one thing at a time. You can create that internal atmosphere and environment where people are valued, they think they're being trained in leadership, but that you're also aware that there are people outside of your organization that can bring you new ideas, new approaches, and that you have a balance of the two, and that you never shut yourself off from valuable people that can help your organization, internal or external.
And what, I want to share this with the board, please. Perception can become reality
Oh, yeah.
for people. But it is a false perception for anybody to believe that Scotland County, a board of commissioners and county manager, personnel managers have discriminated or willfully not hired African American. That is not the case. When we look at it, people apply, but they don't necessarily qualify or accept the position. Secondly, many of us in leadership positions buy into helping spread the negative things about Scotland County. We amen it. Okay? That happens. For example, perception that if you a member of Harvest View Ministry Church, you can get a job in the county.
I don't know where that came from.
But did you hear?
It has been said,
Like
over and
the
over.
commissioner told me, and I said, where did that come
I'm
from?
telling you now.
I did that a lot.
Yeah,
I have too.
and that's spread in my community. I don't know where it comes from. And I'm just saying, having been around for 20
That
plus
happens to be
years,
my
sitting on
church.
this
I don't
board
know
and
where
other
that
boards,
came from.
I have interviewed.
They don't specify you,
Yeah.
it's just the ones I've heard people say that, say the church.
Well, see, because I brought that up at our last meeting.
But I've heard it way.
It came to me, nobody ever said it was attached to you. However, I was watching a Northview service because I enjoy Northview, and you were there doing something on the service. And then
I'm on
I
Trace thing.
Then said, okay, so that's what they were saying, but nobody said that, you know what I'm saying? So I agree, I mean, there is negativity out there. For me, it's my job, I believe, as a commissioner, to bring it to the table if I hear it, so that I can get clarity and dispel that if it's not true. And that's why, if I hear it, I'm gonna bring it up, because I don't know if it's true or false until I bring it up, we have a conversation about it.
Because folks don't know about the tax department. We had Ernest there for 20 years or whatever. We had Heidi Massey in the leadership position. When I sat on the board, the city council, we had police chief and others. They now, when we say Scotland County, I can tell you the Board of Education is highly represented with minorities. The sheriff department is 70% minorities. The city, they have several in top position, and we just have longevity here with us. We treat people so nicely, I'm serious. Even with the Great Depression, when we had to cut back, our folk didn't leave us, okay? We didn't have big turnover in managerial position. So I'm just saying, due to the way that Kevin and others have managed, folk just don't quit us in managerial position. And so we're gonna have to sell Scotland County in a different way. When I say us, I'm speaking primarily to my folk now. Let folk know that we treat people right here. But it's hard to say to our children, stay in Scotland County when you can go elsewhere and do much better financially. It's difficult, but I just don't want any of us to leave here. I don't want the Caucasian to feel that the African-American community is beating up on you. And I don't want my people to think that I'm insensitive. I just know the facts. And we're good to our folk here. And we're not able to recruit some minorities that we would like because of opportunities elsewhere. But we're working on it. And keep our eyes on the ball and we'll be all right. But we don't want to accuse each other. We don't need to go to the media to discuss these things either, because Kevin worked for me. And I can go to his, I don't have to go to the change, because they're not right and the light was favorable. They love to sell newspapers and I don't blame them. And so let's keep all that in mind. Thank you.
I like to say Northfield Harvest Ministries is a very diverse church. I'm gonna throw that one out there.
I didn't know you were in church there, but I've heard that.
Yeah, yeah.
My
very
family
diverse.
members there, so.
I know.
Are we at a point that we could maybe put the rest of this
Yeah.
in Monday night?
Please.
Can you do it Monday?
Sure. Without much objection here, I gotta go get some money.
Madam
This is my last slide.
Oh, well, yeah. Is this what,
Yeah, and I've read that, yeah, we're not taking action on that.
No, 160D planning and zoning update, that's in process with the COG.
They need to get on the horse with it
Yeah.
because their deadline's coming up in
Yeah, their
June.
deadline is July 1st.
Well, the deadline for some of the changes is July 1st. They have to be done
So,
to meet the statutory requirements.
But we'll be back Monday night, we can do whatever.
there's no action on that one, and then the other one was already mentioned was, I am gonna want to, advertise for the assistant tax administrator position.
The only comment I would make on the first zoning, on the zoning update, is we did have conversations with the public, fairly considerable conversations with the public when we were talking about the,
Tactical training.
tactical
facility.
training facility, about being able to provide protection for property owners better through the rewrite of our zoning update than some of the
Yes.
options that were offered during that time.
And we're gonna be working on changing how that's done in this new process. But we'll bring more of that information back to the board, and we will wind up with public hearings on that.
we can be public again?
Public hearings on the whole ordinance, right?
Yes.
I'm not trying to prolong this conversation. So we can have that conversation on Monday, I think.
Well, that's the end of the conversation. That's all that I've got about it.
So the only other thing that, and I'm not, but there's been some conversation about the trash,
Yeah,
and I think we should talk about that either today or Monday. Monday's fine with me.
okay, we put trash on the agenda, and what I was gonna say is that Monday, if I have interpreted the latest, announcement from the governor, is at our meeting Monday, we could allow 25 people to come into that room.
That's the way I interpreted it, but are we meeting here or,
We're still meeting
so
here.
we probably should keep it,
Yeah, keep it tight then.
I mean, just because we don't have room for
I know,
10 people,
Yeah,
5 people.
because we are gonna, I think Monday should be COVID in the, doing COVID shots in the health department, but they'll be working to reestablish that center, so.
but when we do get back to our regular, maybe this is March, maybe in May, we'll be back. And hopefully we can be open to the public, even if it's just 25 people. In the olden days, we never had more than 25 people come to a meeting anyway. I mean, it was,
Most of those were staff.
I mean, 25 was a crowd.
Yeah. Is there any way we can put these other items on the agenda for Monday night and adjourn?
That's it.
I'm done.
I can't concentrate on that.
Can I ask one comment? Because everybody else in this room may know, but we got the money from Commerce for that loan, right?
Yes,
We've got it in hand.
yes, it was, we
I know
finally
this.
received that
What money is that?
last week,
So,
575,000.
Oh, really? When did that happen?
last week.
Oh, okay. No, I didn't know that.
And now the legislative team is trying to work their magic with it. So, but they couldn't do their magic until we got the money, so they're taking it one step at a time.
Yeah.
Yeah.
We have to have it in hand before we can say,
You can't forgive it if they ain't.
right, that's right.
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 All right. That's
All right,
good.
well, for Monday, we'll talk about trash. And this, I think, is covered for your satisfaction. Okay.
Do we have a board of election issue that's gonna be settled on Monday?
No, just a discussion about, what,
They just want,
just an update on the last election, 2020 review.
Yeah.
2020 election review.
Dale and Kat are gonna come and tell us how well it went, how hard they worked, how successful they were, which they were.
But they do have an issue.
Hmm.
But there is an issue at Board of Elections that I've heard of, that you've met with them about, something with money.
There's money left over.
Would that be discussed Monday too?
There's money left over from CARES, the COVID money, and right now.
We can discuss it
Kevin
Monday.
reached out, and the Board of Elections in Raleigh and the Office of Pandemic Response in Raleigh, they don't agree on who controls that leftover money. And until we get some answer from Raleigh as to who controls that $12,000, then it's just gonna stay where it is. Because we don't have a final answer on it,
Who has the $12,000 right now?
The state.
the state. And the Board of Elections is contending that it was their money, it was part of their budget, and they didn't spend it all, so therefore it should be theirs to spend as they choose. But the office, is it Office of Pandemic Response, Kevin?
Yes, pandemic response office.
Yeah, Pandemic Response Office, they're saying, no, that's federal money, it goes back to the original folks. So that has not been resolved, and it is a issue on the state level among many counties as to what leftover money, who owns it, who controls it. So right now, it's still with the state, but there was $12,000 of unexpended money from the Board of Elections during the election period.
So we don't have any of that money holding at the county.
No,
No,
So we're not denying it being used for those employees.
they have requested that it be used for those employees, but we don't have it to dispense
The
because,
state still has it.
right,
Do we have the right to state an opinion?
what?
Do we have the right to state an opinion as to what we think should be done with it?
We're waiting for an opinion to come down from Raleigh. We have reached out to the association, and the state is saying that that money stays with us. It does not belong to the Board of Elections. Am I right, Kevin? Am I saying it correctly?
well,
Can we do this Monday night?
yeah,
Yeah, we can, I think we don't need to, we can finish this conversation on Monday.
Right, we can, yeah.
Yeah, then that's all I was saying. Let's talk about Monday. I'm
Yeah,
cool with
okay.
waiting. But motion to adjourn.
Motion-
Second.
All those in favor?
Are you?
oh, wait, I want to talk.
No.
Are you turning us off, Jason?